Yes.
Okay,
yes.
we're recording.
I agree.
Hearing
with
some
that.
feedback.
I definitely agree
So
with
it's
you
been
there.
artificially
Right.
brought
Right. Last year
down.
was a 4%, right?
3 something.
Yeah.
Here you go, guys.
Okay.
You're on.
All right. Good morning. I'd like to welcome everyone to the Tuesday, January 23rd, 2024 regular meeting of the Board of Selectmen. It is 8:35. I don't know what it is.
We had some IT issues.
There we go.
5 minutes.
Could you look at the agenda before you, and if I could get a motion to approve the agenda?
So moved.
Steve, second. Amy, it's unanimous. Thank you. Moving on to the minutes from our regular and budget meeting held on January 17th, 2024. Could I get a motion to approve those regular and budget meeting minutes?
So moved.
Steve. Sorry, Amy, it's unanimous. Public comments. Members of the public are welcome to provide comments to the Board of Selectmen on agenda topics scheduled for review and or vote. Comments submitted electronically should be sent to the following email address: bosdistribution@newcanaanct.gov. Do we have anyone wishing to make comments?
No one online.
Okay, thank you. Moving on to budget review. Review and discussion of the budgets for fiscal year 2025 for Health and Human Services, EMS, Police, Fire, General Government, and Library. So who's going first? Jen? Good morning, Jen.
So don't worry about any of the mics.
Okay.
It's all up here. They look like they're working, but they're not.
I heard you
Very,
touch things.
very careful.
I heard we could now touch things.
Everywhere. Good morning, everyone.
Good morning.
So, mission statement of the Health Department. First, I'm Jen Eielson, Director of Health, just for the record. Mission statement of the Health Department. It is the mission of the Health Department to control preventable diseases through education, inspections, and monitoring by enforcing federal, state, and local codes, laws, and regulations for maintaining and promoting public health. 10 essential services of public health by Connecticut general statute. Every health department, whether it's a district or municipal, has to provide basic health services. The state health department has adopted the framework of the national 10 essential public health services as that statutory requirement. Summary of major health department responsibilities. We're responsible for carrying out and enforcing all aspects of the Connecticut Public Health Code and Connecticut general statutes pertaining to public health, license and inspect all food service establishments, hair and nail salons, and all cosmetology businesses, public pools, including condos and club pools, septic and refuse trucks, private wells, daycares, lead inspections, and septic inspections, soil testing. We review all building permits for properties on septic systems and or private wells. We're responsible for public health emergency preparedness, CDC required deliverables. We provide case management of all New Canaan children found to have elevated blood lead levels of 3.5 micrograms per deciliter or greater. Manage infectious diseases such as COVID, TB, Campylobacter, flu, norovirus, and all foodborne diseases. We provide written comments for review of all P&Z and Inland Wetland Commission applications for properties that are on septic and for commercial properties that are licensed regulated by the health department. And we respond to investigate various complaints from landlord tenant disputes about rodent vector concerns and general housing complaints, mold, water leaks, etc., garbage. Health department staffing requirements. These are the three main people of me, my registered sanitarian, Gino, and Shannon. As you can see, the laundry list of requirements, including a minimum of a bachelor's of science degree and all these required certifications, which is part of what's leading to the statewide and nationwide public health shortage, because it takes years to get all these certifications and then maintain them all. Next, major changes in 2023. We implemented online permitting through OpenGov. Myself, along with the IT director, Chris Kaiser, were co-project managers on this. We launched online permitting on November 1st, 2023. It's our first year utilizing online permitting for the restaurant license renewals that were completed by December 31st. And that went surprisingly well, seeing as the restaurants are not like the contractors or in other towns, they were familiar with the system. Generally, a mom and pop only owns it in the one town. And those that did struggle, they came to our office in our conference room, and we walked them through it. So nobody was left on an island to figure it out for yourself. We also will be doing online permitting, utilizing it for the salon relicensing, which begins in May into June. And for the public pools, that also begins in May, and they have to be licensed and inspected prior to opening. Usually that's Memorial Day weekend, most of them open, even though it's still cold out, but that's what they want. And we also will be doing it for the refuse and septic trucks through OpenGov. As we discussed last year, the legislature passed unfunded mandate, Public Act 2146, which mandates local health departments to provide QPR, question, persuade, refer, suicide prevention training. That was to begin as of July 1st, 2023, which we have done, and we've been doing monthly. The library's been great partnering with us, providing us that space. And every month they've been full, which is great too. And by QPR standards, you're only allowed, maximum 15. They don't want 50 people in a room. It kind of defeats the purpose of learning that. So of course, there is a cost associated with it in buying the books and that stuff, not for the presenters, because myself and Shannon are certified instructors. And that's one of the costs that we'll discuss later on as part of professional services. Some OpenGov analytics, just to give you a snapshot. This was from November 1st to January 16th. This is the total amount of revenue collected across the 5 departments: health, building, P&Z, wetlands, and engineering. It also gives you the permits issues, the records created. The next screen will give you more of a breakdown. And where we go to the row labels, count by department, those are individual standalone permits. So for the health department, the 144, those are our individual restaurants, septic, whatever. And that's not the number of building permits associated, because the building department gets that number. So all of us that review that building permit. So I just want to be clear that, those that have less numbers, it doesn't mean they have less work. They just have less standalone permits. They're still reviewing the building permits. And then it gives you a breakdown by.
Jen, can I just, I'm getting a little confused. So if you go back a slide to the open government analytics and the revenue collected, it was at $358,000. That's what your department collected?
No, the whole system collected since November 1st. And that's our, this is our dead time of year. So that's actually pretty high for this time of year. This next slide will tell you what the health department alone has collected.
Okay.
Where it breaks down by row label, those are everybody's individual revenue line items. I didn't label everybody's, because not that I don't care about everybody else's, but just want to show where the health department line items are. So the health department has collected individually since November 1st, the 51,800.
Okay.
And then it also shows you the breakdown of the credit cards, which we knew was going to happen.
Are these dates different? I'm just looking at the 358 versus the.
No, but by the time I ran the report,
Okay.
somebody else paid. And I knew you and Amy would immediately pay something. And I wasn't gonna go back and reinvent the wheel. It's just to show you what OpenGov can do with the snapshot. So I can.
Asterisks are good. Asterisks are good.
So I pull the spreadsheets for, Ann and finance, so they can see, and you could data sort it by type of permit. So state education fee, affordable housing fee, health department, building department, P&Z, whatever. You just have to be careful to look at amount paid and not total amount paid, because total amount would include, which I don't have on here because I don't want to confuse you. Total amount includes the stripe fee.
Oh,
Yeah.
or credit card. So we don't want to be confused
giving us
because those
net.
are two vastly different numbers. But as we predicted, credit cards are the number one, payment, which we've never had in the 10 years I've been here. So it's been appreciated by the contractors.
have you adjusted your fees to account for the strike fees with the permitting? So that, like when we pay a
Mhm.
parking fine, we pay extra if we pay by credit card.
Yep.
No, so the fee is the same. So say my soil testing is 200.
Right,
We get that 200,
But you
they're
have to
just
pay it.
paying an added fee on that Strike takes.
so they do pay for the. fee.
Yeah,
They
so
do,
it
just like,
doesn't come out of ours,
Yeah.
like,
Okay.
like when I pay my taxes in Milford, it
okay,
comes out, no, it's not like that, like a restaurant would have set up. So we get our full amount.
okay, good, perfect, thank you.
Jen, is it fair to say if this is a 2.5 month snapshot, are we talking about over a term of over a full year? The numbers are.
Well, that's what's gonna be interesting for next year, like, I didn't propose increasing my revenue this year, but just in looking at from last year to this year for health department only, I'm speaking, my revenue in this time frame has gone up 30%. Because A, I'm collecting the money right off the bat. B, nothing's sneaking by anymore, you see everything, and again, collecting the fee up front is huge. Because you're doing the work, where before they were collecting on the back end, sometimes someone never came and picked it up. So you did all that work and then the fee was never collected. So it's like this morning, for example, somebody checked sewer instead of septic, but I still get it. So I said, no, you're on septic, added back in the fee and said, I will not review and approve this until you pay the fee. So it's much better, it's more transparent because everybody can see everything, which I love. I mean, this makes me very happy. Kind of sad that this makes me so happy, but.
Well, you
But,
even were talking about how much better it is for the public.
Oh, yeah.
For them to be able to see along the way where they are and what's been done.
Yeah, and the permits are going much faster. I mean, before it was 6 to 8 week process. Because if someone at the front of the line is out on vacation for a week, that permit sits there, nobody's seeing anything. Then they come back, it takes them a couple days, blah, blah, blah. Now it's a lot of simultaneous review. So permits, are within a week now being issued if they're complete, which is, a lot faster than before. So everybody's kind of happy with the way that it's going. So next, to answer your question though, by next November 1, we'll have that full year to really analyze. So next budget year, when we all sit down before, because that's when we begin to make our budget in November, we'll have a much better idea of the impact revenue wise, and to be able to adjust accordingly. Next, to state DPH grants that we've received. We're enrolled in a Connecticut vaccine program for children, VFC, and vaccines for adults. The vaccines are provided from state DPH from a CDC grant. The immunizations grant from DPH, that contract was just executed and approved under the previous Board of Selectmen. That goes back to September 1st of 2023. That was in the amount of 48,156. 30,870 to cover the nurses, and 17,286 must be used for the media campaign. There is no way around that. We just did the RFP. Thank you to Greg to help me edit it and give me the local media contacts, and he's been great dealing with that. It's on the town website under bid notices. It was sent to all the media contacts that Greg got for me. So once that closes, then we'll finish, selecting whoever, and we left it where we can select multiple if needed. So that's been great. And that one will end June 30th of this year. The next grant that will piggyback off of that, the workforce development grant, that one we receive up front instead of reimbursement. And by the way, all these financial reports are submitted through Core CT, which is the comptroller's database that me and Ann are in, which is quite a fun database, you can imagine. The workforce development grant will be in one check up front, but there's project codes to it, so don't worry, it won't be spent. So July 1, that will begin the next payment cycle for the nurses we covered under that until next June 30th. And that's in the amount of $45,030.
Are you getting help on that paperwork or is that?
No, I do it all. It's fun times,
Cool.
especially now that the state is getting more and more particular, like, you order pens, they want the invoice to, the check, they want everything, they don't just take your word for it that, yeah, I spent blah, blah, blah. But,
Which is a good thing, but
yeah.
as
It
a
is,
taxpayer, that's a good thing, but then you see the amount of paper that
So
is created.
this grant is used for a public health nurse, and that's outside of the folks you have as full-time staff. This is
Right.
okay, and
And they-
it will cover the total expense related to that.
Mhm. And right now, there's, like I said, the workforce begins July 1, so for this budget year,
Mhm.
we're covered. But if I don't get another grant, then the following year will be the conversation of, the part-time nurse and her 17 hours of can it be moved to operating or
Mhm.
not, if I can't secure another grant.
And I know we're kind of, I don't want to say post-COVID world, but a different COVID world. So in terms of, so do you have currently a nurse covered by a grant doing this at,
Mhm.
and
It's been
are they
4
busy?
years.
Are they busy at 17 hours a week? I mean,
Yeah, well, because we'll get into it,
Okay.
but they do more than just the COVID vaccine.
Mhm.
With the childhood vaccines, we're doing diabetes screenings at Lapham, at Schoolhouse. She's assisting with the mental health for first aid stuff, the talk that we're doing on, TikToks and other things. The 17 hours is actually not many hours when you're breaking it down.
And it's fully paid
Huh?
for. And it's fully paid.
Right,
for.
right.
We don't pay
Point.
for it.
Yeah. that's
And
Well,
that's
yeah, I
what-
mean, but it's a part-time, it's not somebody, we don't pay benefits for that person.
No.
We don't pay anything.
And they,
so it's a-
they know
definite.
they're hired as a grant. It's,
Right.
Right, we can reevaluate if you don't get the grant.
Correct. Local health, emergency preparedness. We're completing budget year 5 of 5-year public health preparedness, the FEP grant, which is dispersed by state DPH from CDC. July 1, 2024 starts a new 5-year budget cycle with new deliverables. It's based off population, so that New Canaan only gets $11,708 yearly for FEP for all the same deliverables that the large cities get, which has been my biggest fight of, if we all have the same deliverables, why are we getting small little slice of the pie? So that equates to only 4 hours a week of me hiring Nick Jossam to assist me with all those deliverables. Nick is also our regional coordinator for all 14 towns. And with the regional position, he only gets up to 16 hours a week. So he's able to do both. He has a master's of science degree in emergency management and a bachelor's of science degree in arson investigation with a minor in criminal justice. So he has a very varied background on this and very well versed in all the public health preparedness deliverables. And by deliverables, it's tabletop exercises, it's full scale exercises. It's, exercising our point of dispensing. It's all these things that health departments are mandated to do. And they provide, like I said, a nominal, they thought the fairest way was doing it by population, but when you all have the same deliverable, it's really not. But 4 hours is better than nothing to help me with all the deliverables. Before I had Nick, I had nobody helping me with all of it, so it's been great.
And you expect that grant to go forward?
Yeah, that's been going on for over 20 years.
Okay.
And these are the CDC public health preparedness and response capabilities that public health is responsible, the 15 capabilities. Some state DPH changes. Last year, we had discussed about the lead and the different levels changing. The new law just went into effect January 1st of 2024, that now 5 micrograms per deciliter triggers a full-blown epidemiological investigation, where before, originally it was over 20, and then it became, over 10, and now it's all the way down to 5. So, we'll see how that has an effect on, our case levels. Shannon just got certified in lead, and Gino's also certified in lead, so they can help me with all that case management.
Hey, Jen, how many cases do we have on average with a year of lead
It
issues?
does, like,
And probably
before, I
depends.
used to only have, like 3, now I get like 3 a month. And lead just takes forever.
Yes.
I mean, it literally, a case can be open for over a year,
Mhm.
especially if it requires abatement. And you're working with the homeowner on getting the testing done, approving the, the plan. Then they do the work, and you gotta do the inspection, then you gotta do the clearance letter, then you gotta do the dust. I mean, it's just a very, very lengthy process.
Mhm.
So, we'll see what happens now. I mean, they gave their predictions, the state, that they don't think it's gonna affect, the towns like Darien and New Canaan as much, because our housing stock has been turned over a
Yes.
lot.
Yeah.
But according to the assessor database, we still have quite a few that are pre-78.
Right.
I live
That-
in one of those.
Yeah, and it's like, if they sell that right now, it may be an elderly couple in it, but they sell it to somebody with a child under 6, that's where this can really,
Sure.
trigger.
And is the family, then, does the government then track the family on their testing of their children?
Oh, yeah, every year you have to, by law, get your child tested for the blood. It used to be twice.
If you've purchased a home that has this
Well, it's
issue.
Connecticut state law, so anytime you bring your child to the pediatrician,
Okay.
every single year, if the child's under 6,
Okay,
has to get tested.
okay,
And that's where we get, the case
The
numbers
referrals,
from.
okay.
And then like here it gets tricky, because then you get, well, no, I own this home here, there, and everywhere. And you're trying to figure out, well, which home actually poisoned the child.
Hmm,
So it can get,
I feel better. My kids got tested.
and if they're over 6, then the law doesn't pertain to them.
Yeah.
So.
Yeah.
Some community health programming, matter of balance training. Shannon and my nurse Ellen are certified trainers. The purpose of this program is to reduce falls and injury prevention among seniors. It's also one of the initiatives of the state health improvement plan. Falls are the leading cause of emergency room visits and account for more than 8 million ED visits each year per the CDC. Ellen works with them on what medications they take that, make them, a little more susceptible to falls. And these programs are conducted at Lapham and Schoolhouse and anywhere that requests it. Some additional community health programming. We did free skin cancer screenings with Connecticut dermatologist and Dr. Elba Mole, who's actually a New Canaan resident, on October 23rd at Irwin Park. She's agreed to do it again this fall, after the summer. I know CERT has moved into Irwin, but Stuart said I can, borrow it for the one time. And then the booth in front of Ellen is what Shannon's dad put together with our old vaccine booths that Steve Benko had made. We kept all the materials and made it double. Shannon's father is the chief building official in Greenwich, and he did it over the weekend and built it for us. So they did full body skin cancer screening, and all 40 slots were sold out with a waiting list. So that was great. And next year, now that we know the speed and how long it takes, we're looking to add more slots into it as well. And like I mentioned before, QPR, we do that every month at the library. In fact, we have one tomorrow at the library. TikToks, we've worked with Dr. Roskowski, again, another New Canaan resident. And her and Shannon and Ellen have provided these TikToks at Lapham Center and the New Canaan Library.
Jen, how do you make the public aware that those offerings are available?
Last summer, I created a Facebook account because we had so many issues trying to communicate to the public.
Mhm.
And then like if something's at Lapham, then Aggie will put it out through her channel. If it's at the library will put it out through their channel. I've been talking to Community Foundation about maybe having them help advertise, because
Well,
We
when
don't
my
really
newsletter
have a
comes
mechanism.
out- When my newsletter comes out, I'll want to have you,
oh, absolutely, we would love to.
yeah, that
And
would
I
be great.
know Russ had talked about, creating the buckets again in Everbridge, like I used to do with the COVID group. Of people opting in, if you want to hear about health department programs or blah, blah, blah. And that would be the best way, is having my health bucket. And obviously the newsletter would be great, because it reaches a broader audience, so. Because a lot of people don't know about a lot of things that we do, and they're kind of like, wait, you do that? So,
And there's the government calendar. I don't know if it's appropriate there, but there's community calendar too. So certainly getting,
Yeah,
know,
I mean,
just,
if it's
yeah.
released, any of the local paper or Canaanite, I'd be happy to put it out, sure.
Yep.
Because it's a great community service.
yeah, so.
and they're always looking for content.
There. So it sounds like you're not having a hard time filling it.
Yeah, well, you're selling out, so that's pretty good.
Yeah. Well, in the Facebook page, it's been great because I have the other community organizations in town, like when we did hydration talk. Well, 2 weeks ago, was Staying Put sponsored the luncheon portion of it. We were able, tag them on Facebook. They sent it out to their, group too, so. That's been, and I shared on my personal Facebook too, which has other New Canaan residents on it, so. It's been helpful. Every Friday morning, the health department does coffee talks at Lapham on various topics that seniors want to hear about. Like I just said, we just did another hydration talk, but this time we're Staying Put sponsoring the luncheon of it. And the community foundations offered in the future to do something like that as well. We don't have a food budget, obviously. Diabetes screenings, we do every 2 weeks at Lapham. My nurse Ellen goes there and does that. And we also now do them monthly at the schoolhouse apartments. We have an upcoming childhood food allergen seminar with Dr. Ruskowski of Comprehensive Care, planned for March 8th at 11 a.m. at the library. And that's important for the parents, because there's a difference between allergens and sensitivities, and how, deadly these food allergies can be. We also just gave away 25 free radon test kits that we got from the state DPH via CDC grant. Flu vaccinations, this was current as of January 19th. So we've done 745 to date. Again, we get those regular dose from the state, and all childhood vaccines from the state. We also do mobile and homebound, and this isn't just for seniors that are homebound, it's also those that may have sensory issues or other accessibility issues where, part of ADA compliance is accommodating them. So, and Ellen doesn't mind doing the home visits. It's what she does in her other job, doing home health care, so. And the residents have been extremely receptive since we began this, almost 3 years ago now. And we also obviously go to Lapham and Schoolhouse, particularly with Schoolhouse, because a lot of them lack transportation, so it's important we bring things to them. Inspection and permit data. I just want to make a note at the bottom, salons, cosmetology, pools, septic and garbage trucks, they don't begin until May and June. So the 23 to 24 are the year to date and then / estimated. The temporary food events should actually be estimated lower because of Waveney House. We weren't sure whether we were going to have Waveney House or not because of the elevator, and now it's possibly next year it might affect us. So not really sure where that's going to shake out in the scheme of things. But other than that, everything else is the building permits, obviously, I think will be much higher, but again, we'll know more as we get more data. It's only been 2 months with the open go. Now moving on to the actual budget. The full-time My 3 full-time staff are town hall union. They get a 2.75% COLA raise. Shannon also gets a grade increase as part of our hiring contract for getting the lead certification, and that would begin July 1, even though she got certification now, she understands that. In terms of the service contracts, where you see that now newly added, that $1,000 is Bluebeam. What Bluebeam is the scaling system. So when we get plans electronically now, everything, health department doesn't take paper of anything. So electronically, when your engineer's plan says scale inch and 20, that will scale the plan for you, so you know it's correct. And then they also can do other things, converting PDFs, and all that jazz, but mainly it's used for that purpose.
And Jen, we don't have anything like that in like the DPW department with all the mapping and the engineering
Yeah.
services.
Maria's always had it on her computer. Nobody else could get it for
Oh, you
years.
can't access it if
Mm-mm.
you, so
No.
it's because that's why I've noticed through this process, there's some,
It's actually
Lack of-
cheaper this way now, because before, the reason only Maria had it was
Mhm.
because it was too expensive for the licensing.
Yeah.
So now that they've actually changed the structure, it's $300 per user per year for the contract. Maria's always had the full
right.
quote of everything,
So 300 per year. So why is it 1,000?
because there's 3 users.
Oh, so you can't use one machine
No,
in the health department to.
no, we all have our own computers,
Okay.
and especially,
Yeah,
that would be a nightmare trying to
Okay,
share. a
I'm just
computer.
asking.
yeah,
Yeah.
they're getting really good at making sure they get licensing to be
Yeah, I
for
know.
everybody
Yeah.
who uses it across the count.
And then, the office supplies, you'll see were reduced by over 1,000. That's because we are online now, so now we don't need to buy all the envelopes, the labeling, all that jazz that went along with the various things that we had to mail out for permitting. So that helped offset the Bluebeam. So even though it shows a 6% increase, the bottom, which we can really affect, doesn't really have, in fact, it has a negative, not an increase.
Hey, Jen, is there a summary of the health department revenues that you bring
Yeah,
in?
that's next.
Okay, there you go.
Next slide. Our last slide. This is all the revenue. And like I said, I didn't propose any increases just because I'm a little gun shy right now, even though right now it's showing a year-over-year increase. But next year, next November 1, when we see the full year in OpenGov, I think we'll be able, plan review is the building permits, just so we're clear. It's kind of labeled different, and the pools. There's not a separate line item for pool licensing, so it's just been, so that $8,000 is included in that plan review. Everything else is self-explanatory of the restaurants, the wells, septic, the salons, and refuse and garbage trucks.
Did we do a review of our fees based on peer group?
Oh, yep, we did that in, when did we do it? Last January. Then it went to publication in May, ran for the month. And I presented that board of selectmen, all the towns around us of what their fees were.
And we're in line.
Yeah, and the only ones we increased slightly were the restaurants by $25 a fee for a class. Because we're not the highest, we don't ever want to be the highest, but we also don't want to be towards the bottom. So every year, we usually do that analysis of all that. So then once it ran for the 30 days, July 1, those fees took effect. So that will actually help offset the temporary event issues I might have with Waveney of that $5,000 by having the increased fees of the actual restaurant permits themselves.
Hey, Jen, the salary part-time, the 45,000 line, I mean, is that the one that's covered by the grant?
No, that's Dr. Reed's.
Okay.
The grants are covered separately. There's different projects for that. It comes out of that line item, then at the end of the year, Anne has to reconcile everything and
Okay. So the net expense for the health department is, $430,000 plus or minus, right? After the revenues you bring in.
yeah. Correct.
It's not a big line item, but it's a big increase in terms of the employer 401 or 401A contributions. Did somebody sign up who hadn't before?
I don't,
So.
we don't plug that in.
Yeah.
So I have no
Again,
idea.
it's not a big number, it's just a big percentage.
So I should have mentioned that during the overview.
Mhm.
There was a change in the employer matching for the town hall union employees from 6% to 7%.
Mhm.
And that 1%, it makes up the difference in pretty much all 401A
Okay.
contribution lines that has town hall union employees. in it.
Okay, thank you.
Thanks, John.
Gotcha.
Any other questions for?
The question, I have, now that you have online payments, which is great, right? Is that gonna free up your time more, or put lower pressures on what you do? I'm just, because all the stuff you had to do by hand.
No, because I monitor that system like a hawk, because like I said, some of them come through, the person will check, I'm on sewer, they're not, they're on septic, It has lowered the fact that, because, what's not included in this, we keep our digital files up to date every single day in the health department.
Mhm.
So everything is scanned and moved to Docs on Demand. So my admin used to have to physically scan everything. Now I've added a step under all the things that we review. And then she just goes in, takes those documents. She still has to physically move it to Docs on Demand and then puts it into Docs on Demand. So it's.
I mean, physically, computer move, not physically, not paper move.
Right, I mean, the paper stuff, she still has to scan, like Gino goes on, does a restaurant inspection, that still has to be scanned because it's not on a tablet, and with the service around here, probably never be on a tablet, it's just not reliable. But it's reduced, some data entry to the point, but they don't have bridges to certain things like Docs on Demand. So if we don't keep that updated, a title searcher or a lawyer is not gonna know to go look in OpenGov to find these permits here if it's not been put in the online database. So we make sure, at least for now, that we're doing that every day.
And with your grant applications, is Greg helping you with grant applications, or do you do?
No, I do them myself. The
Okay.
state has changed the way they're formatted, where it's not with this narrative going back and forth 7,000 times.
Mhm.
They go right to the Attorney General. They get language that's approved to simplify the process. And then that's actually the easy part. It's the actual managing of the constant reporting
Yeah.
and dealing with core CT, and then dealing with, on the side, sending all the backup documents to the state mailbox associated, but not on core CT. So it's a time consuming, but I feel it's worth it to ensure that I have my nurse and save the town money.
No, that's great.
Physical space where you are, efficiencies.
Vine, we love Vine.
Yeah.
We loved Irwin. I mean, who wouldn't love Irwin?
But
But
everything is, the building's not falling apart on you. It's-
no, there's nothing wrong with the building.
All right.
Everybody,
I love the outreach too, Jen. I mean, you
Yeah.
look at the community outreach and everybody knows you in town and your department. You've done a great job getting out there. People really respect you and love what you're doing. So thank you.
Well, thank you.
thank you. All right, any other questions? Thank you.
I went way over time. I apologize, Bethany.
I don't have any of that.
Sorry.
We asked too many questions.
Yeah, I don't think it was you, Jen.
Hey, Josh, Jen's revenues go in other revenues in the revenue and line item.
What do you mean
Just where they come in on.
under health? Department?
I just meant on the summary sheet.
Oh,
Yeah,
oh,
I
oh,
just-
oh, oh, yes.
I just meant the summary sheet. Yeah, where they pop in. Yeah, thank you.
So it's all other.
Yeah, I just was where they
Yep,
fell in
yep.
on the line. Yeah.
Okay, good.
Good, go.
Hi, everybody. Bethany Sorrow, Director of Human Services for the town of New Canaan. Start off with the mission statement. Human Services is a department that a lot of people say, what do you do? So I want to go through it quickly, but with detail, in a sense, you can get a little bit of a flavor of it. So the mission statement, to help all New Canaan residents function optimally by developing programs and activities that address developmental needs, as well as by helping residents obtain appropriate social services and resources. So taking that and breaking it down, we have the helping the residents is more individual assistance, and developing programs and activities puts us out in the community outreach education. As a result, we create, we grasp from the state and federal programs, human service programs, and local agencies, and partnering with those nonprofits, and sort of creates a nice synergy for the dual purpose of helping residents individually, as well as educating on public health issues. So some numbers, total population in New Canaan is a little over 20,000. Our clients and contacts, we do about 1,150 a year, unduplicated. These are individual people. They might call, these are clients we've had for years, or contacts we might hear from them once or a few times to solve an issue, whatever. And then what we do is we work through the assistance provided to break down human service or the residents a little more closely. This is the age breakdown that we have to the right. So to give you a trend of where, as of 12/31 of 2023, starting in fiscal year 2022, I started after COVID because that was just a unique situation. And I think this gives us just better numbers in terms of actual functioning day to day without any real crisis at hand. So 2022, we started out with the population. Let's start with the adults and seniors. We increased from 162 in 22 to year to date, we have 202. And there are reasons for this, both low and affordable housing that's increased in our area, as well as the economic environment, people wanting to keep their kids in New Canaan, for the unbelievable school system. So a lot of things, variables come into effect here. You can also see just youth, family, and the domestic violence cases. We definitely will surpass 36. And when I say domestic violence cases, these are not all of them. These have been from the police. They get a report and they have to follow up by law, mandated. We send to Human Services, and Jackie DeLuey, our adult youth outreach worker, deals with the domestic violence cases in town. Now, Domestic Violence Crisis Center gets far more people in privacy want to call the agency and do things more on an unknown, anonymous basis, working with them directly without but with maintaining their privacy from the town aspect. So in our seasonal programs, energy assistance, you can see the households have gone up. They've doubled in 2 years, from 38 to 76 households applying. And they can go through the program, which is Community Action Agency of Western Connecticut. But of those 76, we have worked with them 70, probably 70 of them this year. They come in and we help them fill out the application, because most likely they will run out of fuel assistance awards that are given to them. And then they have to go into other security nets that the town has their own warm-up fund through the kindness of the generosity of the residents on a full donation basis. So the town does not, there's not a
Is that
budget.
the,
line.
is that the community foundations?
No, so
fund?
Touch of Life.
Yep.
Touch of Life is Community Foundation, and we have 3 sources of assistance money, and that would be special projects, warm-up fund, and food pantry fund that the town has set up as a nonprofit, where when someone does donate to it, they receive a tax acknowledgement letter. It is tax deductible. And the other 2 would be the New Canaan Community Foundation, their Touch of Life program. And sometimes they can pay for things that the town cannot, or we go in on paying for something, as well as the Salvation Army.
And do we still have, I know we have I saw the food pantry fund. Do we have that information on the balances on the warm-up fund? Okay, yeah, that would be great.
So yeah, so we keep track of that and how much we can spend, and just the kindness of the town residents. It creates a wonderful helping agent for us to be able to.
And that's all paid from funds as opposed to operating expense. We're talking about
Correct.
expenses. Yep.
Donations from the.
Okay.
Okay, so for our state and federal programs and agencies that the social workers and we work with, and this is in terms of helping troubleshoot, applying for assistance, Social Security to get disability, food stamps, Department of Children and Families, if there is unfortunately some domestic violence related with children that are involved. We've got the Adult Protective Services, that's for older people that's for 60 and over, in terms of financial, physical, emotional exploitation or abuse. The energy assistance, the Husky Medicaid, renter's rebate, and our Marcy, who is our senior outreach adult caseworker. She and I are choices counselors, and we're able to help people going through the Medicare process or other type of state, what is it called, the marketplace for insurance and Medicaid health insurance. So to give a little bit of numbers, this is from the Department of Social Services, just like Jen works, the Department of Public Health. Our department works with the social services. So just an age breakdown you can look at in terms of through the year, the historics. We are increasing in terms of the number of people. At the same time, they change their qualifications of who qualifies during the year. It could get higher or lower in terms of assets, things like that. But basically, the trend of those compared to the federal poverty level and the state poverty level and the median age of our area. This is who is working with Department of Social Services in our town and receiving some type of benefit financially.
Oh, so we don't have 20.
I'm sorry.
2023 numbers.
No, they will do that. Will be coming up.
When does that come out?
I can check. It's usually, it'll be by July 1st.
Okay. Okay. A full year, okay. 6
Okay.
months after they do
Yeah,
it
so
at a
6 months
fiscal year
after.
end. Okay.
So
Tourism government.
now I just wanted to compare the social service clients at the state compared to the human service clients we have. And this is approximate data from our side, based on the data given by residents. Some of them, they don't have to answer the questions There is free will, and we want to keep that respect and dignity. But from what we see, this is our, the group capturing whereabouts, how much, what percentage of DSS clients are also seeking help through the town and using our services, our caseworkers, for individual assistance. Okay, so this is once again through DSS, the assistance for participation broken down, cash, food, medical, and other. The food would be the food stamps now. Medical is compilation of Medicare, Medicaid, I'm sorry, Medicare Savings Program and Husky, whether from the child birth to.
You know what, can you go back really quickly? I just was looking at the chart with the DSS and Human Services population.
Right here, yep.
So why, what is the difference between the clients you serve and the clients that the Department of Social Services in town serves?
So really no different. I
You
mean,
just take a subset.
if they qualify
Yep.
for state, they definitely qualify.
Okay, so
But
these
then-
are all your clients are definitely DSS clients.
Yes, and so
I
what
don't
they
have any
need,
distinction.
helping with the kids pay camp,
Yeah,
daycare, not, we will not help someone on a continual basis. We are getting them out of a crisis situation or they've gotten behind, the kids being in school, the rent, something's happened in their life. And we are assisting things that they don't have enough money for. We're trying to stop any evictions, things like that, within reason. We don't sustain them living here. We can't do that. Then we actually say you might want to look for, elsewhere. You might have to sell your house, find a place where the rent is less, things like that. So these are people that we can give them additional assistance. And if they're in the low income or the affordable housing, they're definitely going to be staying here. And we're very, as I said, they do have to do a separate financial assistance for human services. They have to qualify, whether a long-term basis, we have many people on fixed incomes. So we help them apply for the energy assistance every year and the renter's rebate. They live at schoolhouse, things like that. There's a lot of other things besides the state programs that they need.
So you fill a gap above, like the state would do the minimum, I don't want to say the minimum, but for people with the
bridge a
least.
gap in
resources,
terms
least
of
resources.
Community.
Yeah.
Functioning in a positive atmosphere and a giving spirit of the community, as well as Jackie gets grants. Jackie gets grants for children from the state, and so she applies them to things. We get a grant for the Get About. So working with the Get About, things like that, people that need rides because they don't have transportation or they're immobile, so we help them with the Get About. So there's a lot of other intrinsic things.
So like, would a Get About client be in the 2027 that you serve? Would that be considered?
If someone called asking for help with the Get About.
Oh, but if someone calls directly, not necessarily.
We don't have, no. No, there's no indirect, this is direct contact with a resident of New Canaan. There's, yeah. Meals on Wheels, there are clients of ours that, Meals on Wheels, that we do pay for. They qualify, some call on their own. And they qualify through, we don't know all the clients.
Yeah, but so we would, through New Health Insurance, we would pay the Meals on Wheels. That wouldn't be something in DSS. I mean, that's kind of the.
Right, Meals on Wheels doesn't. There
Yeah.
are other channels. There's Catholic Charities that
Mhm.
deals with Meals on Wheels. Also too, there are ways, but we do have working with the town. I mean, working with Waveney and Meals on Wheels, things like that. We can, if needed, covered cover someone needing assistance from Meals on Wheels. So here are the benefits. And then to break it down again, Husky Medicaid gives you idea of, as clients, who we are also helping with other things for Husky Medicaid. When I say help, it could be filling out other applications. It doesn't mean all the time monetary. Okay, this is capabilities. Some people have a special needs or handicap. Working, we help them. So it gives you an idea. So the food pantry has been our biggest jump, and this is because of the affordable low-income housing increase in our town. And we do need to be mindful of it. The residents have embraced it. Our contributions, once again, to this volunteer-based program that Human Services has, it's definitely climbed. It's come up. But once again, it is not a budget line item. This is something that we do. The town does, and we've been doing it for a long time. COVID was through the roof. We had a lot of people. But then that's why, once again, I started in 2022, just to get some normalcy to our numbers. So besides case management, which I just have finished with, and agency grants, which I'll go into, these are some of the programs that we have, that we sponsor, help, once again, trying to complete that mission statement of being out in the community, educating and providing the needs as a community. This is less individually based, this is more community based.
You pay for coffee with a cop?
We don't, no, we have it with it. So we have coffee with a cop. So Marcy, it's usually older, not children, it's adult. So she comes to that coffee with a cop that she'll have at Lapham
Okay.
or at schoolhouse, things like that. Yeah, coffee with a cop, but that's not a financial based. But we'll have a social worker accompany to say, if you do need help with something, signing up for, the police have a wonderful, if someone has special needs and might get confused where they are, dementia-based, neurological-based, helping them sign up, getting onto that website with the police so that there's a safety sense in town. It can benefit the resident. Once again, educating what's out there and what they might be able to utilize. Once again, we do not do long-term counseling. We get a referral, we do the short-term crisis counseling. And that's when, we were there and we launched them into what the appropriate need is. Whether they stick to it with it, that is their personal privacy. And, we're not following up saying, why didn't you? But we have, we want to give them what they need, they appear to be needing, and always with an open door to come back if something else is needed or not working. This is our community partnering and education. This is just a few, but we will contact anybody, anything, if there's a need of a resident. These are the agencies that we do work continually with. And in terms of being able to creating a bridge between needs, education, partnering, and the residents' optimal living community atmosphere. So in a nutshell, this is a very fluid, constantly partnering and assisting, and each thing at each different level is very circular and can come back around again, but this needs to be functioning. This needs to be flowing and having the access to all these things from a community level, that being up on in an air balloon looking down, all the way to being in the basket of the balloon and landing. So it's just a little bit of a visual to see what's constantly needed. We have no idea who walks in that door, who's going to walk in that door sometimes. Police is available with having the community impact officer there. It's wonderful what the partnering that has been created through Human Services. At the same time, what do? We do what's needed in order to maintain this community. So here's the budget. To give you an idea, the budget went down in terms of expenditures, operating costs, about 2,500. We're noticing our evictions for, what would that be? Program? Public health services. The town Human Services is responsible for eviction costs. And it's a state mandate. It's nothing that's in the charter that can be changed. So we do have to pay for evicting, storage, and then release of the goods. Hopefully the trend is less now that COVID is sliding through and off. But there were quite a bit of evictions last year.
Yeah, it's different.
Can we,
What's in
our
the book.
numbers don't tie to,
Yep.
our budget book numbers don't tie to this. So I'm trying to
what I
figure
was-
out why.
That's what I was asking Josh before. Your budget in here is $490,181, but you've got,
So as soon as you said it went down, I'm like, "Oh,
69.
that's not what I see.
I don't know if your
Well, no, wait,
salaries.
no, this is for operate, but maybe for increases in salaries. I haven't,
Oh, you don't have salaries
I
in
don't
this
have any
line.
of that.
Oh, okay, you don't have any of the
So
salary
maybe
stuff
some
in here.
sections probably-
Yeah, so public health.
$1,000.
Oh, so you probably just, yep, she starts at 75. She starts at the public health services
Human
line.
Services expenditures.
So go down all the way down below and start at public health services. So if we take out, let me just,
Yeah,
because
yeah,
I just want to make sure that that's actually what's happening. If you take out, so take the 490 minus everything above that public health services line, does that tie out?
There is still the
Yeah.
two differences of supplies,
Supplies.
office, and dues and subs.
Oh, geez.
She has 1,250, we have 1,500.
Okay.
okay. You have
And-
1,500?
And dues and subscriptions, you have 1,300, we have 1,500.
I don't know where that happened because, yeah. Okay, we can.
So is this your budget?
For goodness,
This
it's
is my
go
budget.
ahead.
Okay, I like this budget.
Yeah.
So, just kidding.
Okay, so anything below the employment aspect? We're comfortable with this.
Okay, so I'm just
All
gonna,
right, so we're gonna make these.
Um,
changes. Josh, you got
yeah.
that?
Yep.
okay,
So the dues and subscriptions is going to 1,300. And the supplies office is going to.
your picture,
1,250.
yeah, 75. So those are all, I can't see the pictures. Okay, I see it. Okay, 1,100,
We're good?
200. 50 is here.
So she started.
So I'm showing we've gone down from human services below
So it's just dues
2,500.
13. So just two line items went down in the top section. Dues and
Your
subscriptions.
budget really went up 3.91%.
Well, right, as we get down, but yeah, just this one section.
So 469. So instead of 49,
243.
oh, because that doesn't.
Is that what-
So do we know what the total is, Josh, for when you include the salaries? Her numbers don't include the salaries. With these two change, it's just two changes. So, oh, actually, I can do
They- they-
250 and 200. Just take out 450. Just take out 450 from 490.
4,897,331. Back.
And you said 3.81?
Yep.
Okay, thanks.
Okay,
Mhm.
very good.
Yep.
All right, so and then the increase is requesting, this is where the human services agencies come in.
Right.
I want to show you, right, so we've gone down this year in Get About. It looks like, but we're going up in Kids in Crisis. This was inevitable. We knew this coming down the pike. The Board of Ed agreed with their ARPA funds to cover a middle school teen talk counselor for 2 years. And that would jump off after. So this was something. So right now I have it that we pay for 96,000 is the high school teen talk counselor through Kids in Crisis. An additional 48 is half of the middle school teen talk counselor.
And how is that other half being paid for?
This is what I am going to do. I am going to scrape. I am working with other possibilities, which I know we have a meeting set up to look at the possibilities there. We have received from the opioid settlement additional money, which totally comes under addiction, education, things like that. Kids in Crisis or Teen Talk Council, they do educational teachings in health class and things like that.
Yep.
So we can get money from there. There is a credit that we have due from Kids in Crisis because this high school Teen Talk counselor did not start until January. We have a credit. I'm going to put that towards it. So I'm requesting at this point that we pay through Human Services half of the middle school Teen Talk counselor and the other 48,000 from other agencies, grants, and things that I am working on.
So Bethany, that 144 should probably show as 192.
No, oh, well, but the other agent, this is why the other agencies are going to be paying for it. Would you? It's a different, so it won't
So if you
be
take it out of the opioid, you'll take it from that.
from the opioid settlement,
Okay,
right? So we're not gonna put it into opioid settlement into Human Services.
just so Josh knows. Okay.
Yeah, so is that okay for doing it that way? I mean, if,
You're showing.
You
the
have to
net
talk to the,
expense. You're
the
showing
bosses
net-
over
the
there
net
on that.
expense of The town of New Canaan.
That is an accounting question.
Proposed, you're talking about the proposed net expenses of the town of New Canaan.
Yeah.
With 50% to be picked up elsewhere. Now, is the view of that this is in perpetuity? So, because it was funded by ARPA, right?
Not initially, though. ARPA what didn't exist
just
when
for the
Teen
high-
Talk
middle
came
school.
in.
No, but we're talking about replacing, if something was funded by ARPA for 2 years. And now the point we're making is that it's considered valuable. So on an ongoing basis, this could be a
Right,
expense in perpetuity.
right. But it didn't start with ARPA funding. Because that's a Kids in Crisis.
No, the
counselor.
expansion counselor.
The expansion of one extra counselor.
Yeah, I got that.
Yes.
I got that. I meant
Okay.
to, you know.
so we
I just
just
wanna make
put
sure.
down that we were gonna somehow, we were gonna try it out for the Teen Talk counselor.
Yeah.
Great way use of ARPA funds for the school.
Okay.
It's been phenomenal. So knowing that and having the success rate, yeah, I want to try to keep this going.
So does the school, so when they come to present their budget and we ask them about the Teen Talk counselor, are we going to get the same feedback from the high school and the middle school that they love the Teen Talk counselor?
Right now, they are not using any funds for fiscal year 25. So I don't know if they will include it there.
No, I mean, but aren't they resident at the high school and the middle school, the Teen Talk counselor?
Correct.
And do they have any interaction with the social, like the school counselors at the high school? I mean, I know that they're independent.
Right. If there is a danger to an individual.
Yeah.
Or the school, the Teen Talk counselor has to go to, for security purposes, has to go to the school for safety purposes.
So I guess the better way to,
So otherwise, it's not commingled. There are files and everything, and this is the plus.
so where do we get the feedback on the effectiveness of this Teen Talk counselor? Who would we get that from?
From the school itself, from the counselors,
So, okay.
it's a great help.
Okay, so when I talk to the Board of Ed, I will ask them, how effective is the Teen Talk counselor?
Yeah.
And you know, and I hate to always be metrics because metrics
Yeah.
are difficult with personal things.
Right,
But if we had some idea of, this is kind of full-time position, right? So how engaged is somebody, how many people, how
Right.
often, because is it something, and I don't know, but is it more? Could halftime do? Just versus just saying, yes, we're gonna fund this, but we have no idea how many kids are tapping it. We just don't need details, except people say it's great.
Yeah, when they submit for a grant every year, it's in there, I will get it.
Yeah, that'd be great.
Yeah.
Yeah, just so we know,
It's good, yeah,
Yeah.
know the numbers,
Yeah.
exactly, totally get it. We're going to, so to offset that increase, we have, you can see going down what we have broken down. We basically have. Also, what we had is the New Canaan Urgent Assessment Program was decided that would go under Human Services for the 50,000 grant.
Mhm.
So you do see a huge jump, especially from fiscal year 23 to 24. That was because of that $50,000 grant. Not grant, that this town decided, the urgent assessment program, it was decided to be funded through.
Yep, right.
So that sort of bumped us up
Right.
quite a bit. COVID, you know, we had more needs, but now, I mean, we're trying to ease off and wean ourselves from this, but it's as a result, my personal opinion is these agencies are vital for New Canaan. These are the agencies that the social workers and myself, that we refer people to, and we will continue to refer to. How the town wants to, I don't want to do business with them.
I've talked to
Yeah.
other first selectmen.
Yeah.
And we are one of the only towns that does this.
Yeah.
And their attitude is the state pays these agencies for our referrals. And so they are incented to take our clients. So we don't need to incent them as a town to take our clients. The state incents them by paying them for our clients. So
Yes, and where we see this really, these go to administrative costs where the grants, I mean, the state
right,
does not pay for the running of these.
right, and that's where we had this conversation
Yeah.
about whose job is that? Is that a not-for-profit fundraising like New Canaan Community
Mhm.
Foundation, like me as an individual
Yeah.
taxpayer, paying to support those agencies
Yeah.
outside of, it's a fundamentally different way of looking at it, Bethany, but I have a pretty strong opinion about, you know,
I
what,
want to show you,
Yeah.
going to that. Well, so here, this is what I'm asking. Yeah. I think-
and we're the only ones that do this.
Yeah.
I mean, it is not a common practice in any town in
I-
Fairfield County.
Yeah.
So
I wanna
we
show
don't
you
do
the
this.
Exactly. So
That's-
this, let me go to
Okay.
it right now since we're on that. So this is the history, starting from 2010. What the town has done in
Right.
terms of giving. Do we want to change it?
Right.
Possibly.
Well, I'd like to ask you about, because, you know, there was a significant increase in the number of those agencies that we added to this list starting in 2024. And
Mhm.
we got rid of, or we halved it. I think we're kind of taking let's give them time to adjust to us not doing this anymore. And I understand that, because you don't want, but, so I'm a little confused so what does Family Centers, that was a new agency, what services, why are we continuing to fund them?
So family centers, they've merged with Center for Hope.
Okay,
They do counseling, free of,
what kind of
any type
counseling?
of counseling.
So I guess what I'm trying to say is we have lots of counseling services. We have the urgent assessment program. We have, we also have, there was another one up here, community program, mental wellness. I'm like,
Yeah.
I had this conversation when I was meeting with the executive directors of a lot of the not-for-profits yesterday. As a town, as a municipality, I think we need to look at where are we getting our bang for buck as a municipality?
Mhm.
And what are we using to provide, you know, that we need to fund? So we made a judgment as a community that we were going to fund the urgent assessment program at Silver Hill. I'm not quite sure what we're doing with all these small donations to these other agencies
So
that,
it was brought up at a commission meeting, Health and Human Service Commission
Mm-hmm.
meeting. You can see actually the Meals on Wheels stops, like, so the first 6, this is a consistent every year of giving.
right. It's just these bottom, and now you still have,
So it was
new one.
suggested so that we weren't showing any favoritism, that any agency could reach out and request.
And so you
I
just
don't-
said yes?
I know, it's like, we're
No,
not a
they
grant
can
making
submit.
agency.
They can submit.
Yeah.
But we
They
obviously
have a
said
right
yes.
to.
Yeah, but
Yeah.
I guess my thing is with, sometimes I see, you know, what does $2,500 do? I mean, you're either committed to something or you're not. And that's why, but 2,500.
Think about it as the cost of doing business. Or
But you don't need it. It isn't though, Bethany, because then I talked to other towns.
Yeah.
It isn't a cost of doing business. I know that that's what's being said and communicated, but in talking to every other town for selectmen in Fairfield County, this is not a cost of doing business. It's a generosity of the community. It's not a
generosity,
cost of doing
And the
business.
Health and Human Service Commission is an unbelievable commission.
I believe you.
Right, so, and I'm not fighting this.
Okay.
I am showing historically what's gone on, what has been requested. Health and Human Service Commission. And it's an altruistic commission, group of people, and this is something.
I think what you're saying is it's more appropriate through the community foundation.
Exactly.
As-
And
as
Young
oppo-
Women's
as-
League
yeah,
and
whatever,
all those
yeah.
other groups.
But you know, it's, and I understand the one that, you know, and look at, so the Meals on Wheels, folks use it in
Mhm.
town, right?
Right.
So is that going to Meals on Wheels for their administrative, or is that reducing our ability to help offset people Meals on Wheels expenses? Costs for, food. That's a one- that's a one just-
It falls under administrative. This is where the agencies struggle.
Yeah.
So this is
Yeah, I
just,
mean, this is-
absolutely, this is New Canaan. Like you said, Deanna, we can do more of the popular thought.
Well, and a lot of these were just added last year. I
Yeah.
mean, a lot. And I was like,
yeah,
okay,
it's not a lot of money, but
But
it was
it's-
added last year.
right.
What is child guidance?
Child guidance, once again, it is more of the guidance for mental behavioral health for children.
Is this an organization? Child
It's a
guidance?
nonprofit, and it is definitely, they do all types of counseling. They give us a report every month. And once again,
It's a Fairfield County?
it's a Fairfield County, and mental health is so expensive and it's not covered by insurance, especially if you have Medicaid, Husky.
Mhm.
So this is helping the behavioral health, public health crisis, things like that.
My argument, my only argument is that if it truly is a really beneficial, not-for-profit that many people
Yeah.
value, they will write checks for it. I mean, we found that with Get About. I mean, they're doing extremely well, which is why this budget came back. I mean, we've already funded their bands, but their fundraising was exactly. I mean, we can talk in another year or two if they're struggling, but right now they're not. So, you know, as a taxpayer, if they're doing well fundraising, then we shouldn't, as a taxpayer, be paying for
Right,
that.
right, and I know, and it's a different administration.
Right.
It's a different environment.
It is.
Um,
Yes, inflation is eating everyone's ability to pay.
Yeah,
And we have to be more focused on paying
exactly. So
every-
I take that, I respect it.
Yep.
And, listen, human services is human services.
Right.
We will take any
Right.
money that we can.
Right.
I'm not groveling for this. At the same time, I'm supporting the commission in terms of what they feel, how the community would benefit. But, I will take the lead, whatever's needed in terms of changing a little bit of the feel.
Mhm.
And why not? I mean, this has been, I don't even know fiscal year, before fiscal year 2010, I don't even know, but I just want to say, being the director of human services, we do have to, I want to maintain the generosity that the town wants to give, but I also understand the fiscal responsibility, and it's a balance.
Right. We are an unbelievably generous town.
Unbelievable.
So, and
So I get it. I want to make sure that, I want to,
Bethany,
Yeah, but
if there was ever a
it's-
time where you
do
needed
that.
to come to us for a special appropriation on anything, that if something came up where you say, hey,
Yeah.
we really need to look at this, we're here.
so that's right, yeah, so the 48,000, I am gonna do my darndest.
Yeah.
But at the same time, Kids in Crisis also can help out too. We started Kids in Crisis, New Canaan and Kids in Crisis, we take them together. If we need help, I can ask from them too. So I'm gonna do all I can, but I also understand concepts. I get it.
I'd love to see some feedback in terms of, since there is a doubling down, which I'm not, with the additional, supporting kids in crisis for, the schools. Because what we're basically saying is, this is where we think it's important. We just need some information about
I'll send you
what
their,
what they do.
I'll
And
send you their-
how many
their
kids they
grant
work with, da,
process
da,
and
da.
What they submitted to us.
Yep.
To the commission.
Like, how busy is this person?
So that is my talk. I'm sorry, I don't know. what
Okay,
to-
so just to be clear, so we're looking at the budget that you have up there, which is slightly different from what we have in our
Right,
book,
400,
not a big.
Just 400 and, it's just $450. It's only in the program meeting expense line, or supplies on office and the dues and subscription. Those are the only two lines that are different,
Just in that portion, her
right, in
salary.
the upper, in the upper portion.
Okay. Thank you.
Yeah, any other questions?
Thank you.
Okay.
Thanks a lot.
The town values everything you're doing.
Yes.
So please don't take it the whole.
Oh, yeah, no.
All right, we're a little behind schedule. We'll try to make it up. Got our EMS guy sitting there.
All right.
Alec and John, nice to see you both. Your budget is in your book. Yeah.
And are you the chair of the EMS?
I'm the president.
The president, sorry.
John Knight is the treasurer. And
New in these roles.
relatively new. Compared to prior presidents, probably. But hopefully we can answer all your questions.
Okay.
We don't have any slides because our budget is relatively straightforward.
Right in the book.
Yeah.
Relatively simple to talk. And I don't know if you want to talk about EMS in general, just put it into the budget, or whether we want to save some time for this.
Doing okay with the renovation of the police department, you guys? I
You know,
know
it's
Tom,
us
Tom
really
represents
starting
you
to
guys.
affect us, and
Yeah.
it's all about the driveway.
And we're
So
good?
Right now, they're dredging the driveway right next to EMS. so
Right.
We're entering and exiting through the schoolhouse apartments.
Mm-hmm.
So we're trying to make sure everyone's going very slowly and carefully through there. But that's only for another week or so.
And then you'll have
And
access.
then we'll have. The issue will be for the next 18 months or however long the project goes on, we will have a single driveway
Right.
for ingress and egress.
Right,
which
right.
We're just gonna have to get smart about.
We've got some extra signage up there too right now, which is.
Yeah, we're gonna have, I
fine.
mean, I'm most concerned about delivery people who will just want to stop, walk the driveway and get stuff off the truck.
Same with schoolhouse apartments, people.
Yeah.
Block the driveway.
But at least now there's multiple. options.
Right.
So we'll see how it goes. I mean,
Yeah.
we'll obviously. We're not doing our job.
Can you talk about, I mean, we talked about it before, but the medical supplies, the increase this year in the medical supplies and what that represents?
Sure, so we have, so one of the three big lines in the budget is this what's town contribution. I don't know if we've changed that to say medical supplies and vehicle maintenance and repair, but generally that's what that contribution has gone towards.
Okay.
And John can talk about it in more detail, but in any given year,
Mhm.
it's either under or over what the actual medical supplies are in vehicle. I think, given the increase in costs across the board right now, we're generally under, but we make up any shortfalls, which contributions from the public that
Okay.
go to funds.
Oh, so it just got switched. It was in town
It
contribution.
got broken out
That's
from town contribution.
That's right.
To supplies, medical and repairs, mobile equipment.
Okay, just to more accurately reflect what we're contributing
Based on
to.
the
That's right. I
percentage
couldn't
that they
remember that. Okay.
told us from the previous year.
Yeah.
How they expected.
We have other categories of expenses, but we pay for that ourselves out of other things. But as an example, last year, We had ambulance supplies of roughly 62,000, vehicle repair and maintenance of roughly 11,500. We bought a new Lucas device, which was 19,500. We bought 3 new stair chairs for $13,840 and new digital and analog radios for 10,700. So that was roughly 119,000. So the town's contribution helped pay for roughly half of that.
And then you fund the rest through fundraising or
We
through?
have an annual letter that we
Okay.
send out in the fall, and also
Okay.
sometimes if their families will, if they've lost someone, they
Yeah.
will sometimes say, make donations to the volunteer ambulance, to EMS
Okay.
along with other things. But,
It's not an overly aggressive,
Yeah, I was gonna say, I don't know if I've ever received a fundraising.
well, you should have, because it's supposed
Yeah,
to
maybe
go
it
out
does.
to every resident.
Okay.
In New Canaan.
Okay, I get a lot of mail,
but,
so maybe.
there are,
Right.
there are other EMS services that more aggressively fundraise, but we've been
Yeah.
able to
That's great. Okay,
basically cover all of our expenses through that.
shows that
and then
everybody
sometimes
loves
as
what you do. I guess
Yeah.
everybody supports what you do, so
Yeah.
thank you.
And then sometimes patients who we treat will send in a donation as well.
Oh, that's nice.
Can you just talk about the reduced expense for the outside services for paramedic? Was that just,
Sure.
I
What
recall, was
happened-
that bid out?
It's a 5-year contract.
Right.
And so it was being renegotiated in the spring of 2023.
Mhm.
And so and there also was no increase in the contract over the 5-year period. So
Right.
the number that was in for last year was an estimate based on where the negotiations
Yeah.
were at the time. And then it ended up being less.
I'm so
than had been
surprised.
projected.
Well,
So, yeah, that's-
the way to look at it is to go back to 2023 or 2022, where you see 399 for the, well, at least, I don't know if you have those historical
Yeah.
numbers.
Mhm.
So this is a 5-year contract fixed price, so you see the 399.
Right.
And now we've ended up at 465, which is a 16% increase from
Okay.
the last 5-year contract.
Oh, but so we assumed it would be higher and then when,
Yeah.
Yeah,
we
okay.
didn't- We didn't have a good feel.
And this number also doesn't increase over the 5-year period.
yeah, it's flat.
It's flat.
So for the next 5 years, a 16% increase from the last 5 years is awful, it seems to me. But-
Yes.
In a shortage area.
And
Yes.
this is with Norwalk EMS, who supplies us our 24/7
Right.
paramedic.
Is that
And
true?
and they're a nonprofit
Mhm.
division of the hospital as well, so it's really supposed to be just a cost pass-through.
Sure, sure. Well, that's a nice surprise. They don't generally go that way.
Yeah.
So. Terrific.
Okay.
So the town contribution, did we address that
Mhm.
sufficiently? And the other sizable number there is the information services, which really goes to pay for the state services, our dispatch services.
Okay.
And the tracking and patching.
Got
So that's the 62,617. And basically that gets billed July 1 and paid upfront for the year.
It's just an expense. Yeah.
Yeah, we don't have any
Yeah, got
negotiating power there. And the other relatively small numbers are generally provided by yourselves, paying for certain utilities.
Equipment's holding up well, ambulances and so forth.
Yes, the issue with the ambulance is that we order a new ambulance every 3 years, and the one that we ordered 2 years ago.
Right.
It's been massively delayed. And then
Right.
we just come with another roughly 10-month delay in its delivery. And I have not been able to get like definitive feedback as to why this is going on with us, which I've been pushing, but there's people who are in touch with the ambulance supplier, so. It's not, I don't have as much information as I'd like to have yet. But it is what it is too. We have the order in. And we're sort of at.
They'll just tell you supply chain, there's
Yeah,
supply chain.
well, I just want to make sure that we're not getting pushed.
Yeah.
To the benefit of some other client. who
Right.
Said, throw you something, I don't know.
Yeah, so we have something out in 2 years. That's right.
So, yeah, the next one in the normal cycle would be
Mhm.
ordered in 2 years, but when we, and we have to decide whether we want to order that sooner to
Oh.
accommodate a continuing delay in
Yeah.
in supply chain.
Yeah.
So we're looking at, we will get around to that. And we'll be looking at whether the costs are accurate or not, but.
Okay.
And Josh, just make sure I've got this. So instead of filling out a town contribution line item, we're adding up the other ones.
Yeah, you're
Correct.
gonna have the two, which is a new line item called medical supplies, I believe.
Yep.
and The mobile equipment. repairs fund. That's a breakdown based on the percentage of how they estimated their expenses last year.
And, yeah, and our expenses are pretty difficult to predict or budget. So it's a more stable budgeting line item for your purposes, and we accept the volatility with the cushion of our donations.
Well, I mean, the headline is the best deal in town just
I
got
know,
better. I
I
mean, it's
know.
incredible. What
I
you
know.
guys do, I mean, it's, we say, you know, we've said this year after year, when EMS has come, it is clearly the best deal in town, and the town can't thank you guys enough for
All the
things you
patients
do.
get a free ride to the hospital.
It's unbelievable. And to have a decrease in the budget on top of it, it's like, oh, boy.
Yeah.
It's unbelievable.
Decrease because the estimate.
Yeah.
The estimate.
Every other.
I'm with you, but we estimated high, so. But I completely, it's amazing. You don't even realize that
Surprised
other people have to pay for this stuff. Thank you.
Yeah, thank you.
Thank you guys. And thank the whole staff for it.
Yeah. That free ride with nice residents is always,
Yep.
pleasant residents. It's a great benefit.
And that construction will be over soon, so
Oh, yeah.
Yeah,
get back to normal again.
thank you.
Thanks, guys.
Short and sweet.
Did we catch up? Let's see, where am I?
Not really, but. All right.
Oh, yeah.
Go fast.
Maybe.
Police.
Oh, yeah, please.
Yep.
Yeah.
John, co-host. Yep.
And so many bubbles.
Good morning.
Good morning.
So we are here presenting our budget for not only the police department, but the animal control. Main focus of our budget this year was obviously adding 3 new officers so we could position officers into 3 elementary schools at the request of the Board of Ed last year. We started that process with the hiring of the new officers. We're still involved in that process. But this budget was built with hiring them on full time. And as I explained, when we proposed that it's much more beyond the just the salaries and the benefits. There's a ripple effect throughout our budget, and I'll show that moving forward.
So this proposed budget assumes everybody's on board for the entire, that you've gotten up to the full complement for the entire fiscal year, right?
Yeah, going from 47 to 50, and everything associated with having a
Great.
staff of 50. And this will allow us to staff the schools with certified, sworn, well-trained police officers in all of our schools, all of our public schools. Additionally, we're doing some, continuing to do careful analysis of our historical spending and our contractual obligations. And with that in mind, where we can perhaps focus our negotiations for the contract, which is coming due in 2025. And as you'll see moving forward, a lot of the expenses that we see, especially in overtime, are contractual obligations. So we're going to work closely with human resources, perhaps recognize some cost savings. First, we'll go through animal control quickly. Their budget is pretty small, but as you can see, it's a pretty active department. We've got 1 animal control officer full-time, and he handles quite a number of calls throughout the year. We have some abundant wildlife not just dogs and cats. And he does do some.
I get all of those up in my.
Yeah.
Yeah, I do too.
Yeah, be careful with your.
Bobcats are
Yeah.
really on the
Pets
rise
is-
now.
Yeah, they are definitely here and they're here to stay, so. It's good to have, the full-time staff of the animal control officer. For the budget this year, it's 100,500. Now, Josh could probably explain it a little bit better, but combined animal control and there was a dog fund that was also an expenditure that was combined this year. Just to make it cleaner. I don't know why they were ever separated or in different funds, but they were combined this year to consolidate everything. So it does show, I believe, a 7.4% increase, but that's not entirely accurate because that's combining both dog fund and the animal control.
What line item?
Yeah,
is
where,
that in?
what page is that? Do we know?
Well, we're in 9 and 10
9 and
on the
10,
debt, on the budget.
So is
but-
is it within the PD?
This is within the PD.
Okay, so
but,
we're not broken out, yeah, okay.
There.
Just in overall salaries.
Yes, but in previous years, the
Animal control on 12.
Well, thank you.
Sorry.
Yeah, and when Josh comes back, he can explain. it
Great,
better,
great,
but
great.
We
Thanks.
combined two funds and that's why you're seeing an increase.
Okay,
The
so
salary
this is
is
for-
actually decreased because we have eliminated the need for the part-time salary because we had that last year when we were onboarding our new animal control officer and Allison was retiring. So we combined and we've also adjusted his salary down for whatever reason in the past. It was considered a department head position, which we adjusted that in hiring the new animal control officer. So we adjusted that, so we are seeing a decrease in the overall animal control budget.
So, I'm sorry, so our budget, it looks like it's going up 7.41%, but that's because we're not reflecting the dog.
Because you combined the.
Right, so
two-
that's, so if we were doing, apples to apples,
If we're doing apples to apples, I believe it was a 4.9% decrease
okay,
for the animal control salary. Then
yeah. If we can clean that up so we can understand, I mean, it's hard for people to follow,
Yeah,
so.
yeah, going forward, it'll be much easier because it's just one budget.
I mean, I
Yeah,
don't
you
even
know,
remember what.
the dog fund and
I don't
the
even know
animal
what's in that
control
dog
fund is combined.
So
So-
dog is it's
So
the,
they're
it's
trying, it's showing an increase, but it's really
not the, I don't think, it's
So
not,
that's a
Are we
dog
talking
fund?
about the police dog? Or,
No,
yeah, right, I don't think so, yeah.
The dog fund is where we have to split based on, state statute. So, and the revenues that come in against it, we had a dog fund all by itself.
That's that $3,700 of licensing fees for dogs?
A piece of that.
Yeah.
Oh,
A
that's
piece
right.
of that goes in,
Through the town.
into the fund. So it is, a split every time we do it. And then we do the filing in September for the state for that money. And then there's some residual left over. This fund is so small, the recommendation by the auditors was close the fund out. Because really, it's a balance sheet item for us, for the state filing.
Uh-huh.
So what happens is their budget is gonna go up on the expense side, but there's an setting small revenue on the other side. So it does pretty much net, and there's a $61,000 fund balance that's in that fund that's gonna come in back to the operating fund, into the general fund.
It'll be just a one-time.
One time only. To bring it back.
So what is just in terms of the staffing, so I understand this, we had full-time animal control person, we have another staffing.
It's,
I'm just trying to understand the numbers here.
so.
So
the-
we have, right now, we have the only thing we have is a $76,000 full-time salary.
That's under animal control under the operating. In the
Right,
dog fund, it's purely expenses related to the dog fund for the operations of it. So, mailings, different things that they have to do in June towards all.
to
the-
make your beagle legal.
Yes,
That's it.
yes.
Was that under the town clerk's budget? Was it,
Um,
or was it?
No,
or was
there's
that-
no, town clerk is a different mailing, but the mailing for those pieces for the dog fund, when they have to do it in June for the, or, I forget what
It's
it-
licensing,
register
you're
your
licensing your
dog,
dog. Yeah.
registering your dog. Okay.
They have mailing and some other things that they do, and postage, they put it into the dog fund to offset against some of the revenue, because the town gets to keep some and the state gets some. And the state, we put into this dog fund plus some of the town, and, it's usually a surplus. So the recommendation of the auditor is going, it's too small.
It's teeny, yeah.
Yeah, take it out, get rid of the fund so you don't have to track it. It becomes a balance sheet item for the state, and then there's a revenue and expense for the police department. So the offset is in revenue.
So are we gonna combined go down, I think you were saying, Chief, 4%? Is that because we're pulling a one-time cash?
Haven't pulled that
infusion?
in yet. Have
Okay.
not pulled that in yet.
It's a decrease in salaries is why we're saving the money, right?
From last year.
From last year, yeah.
Okay, all right, so
And
that's,
that's the
what's-
fully
that's what's
loaded
driving it.
salary, that 88 is
Yeah.
fully loaded, okay.
Okay.
So I'm like,
I mean, I know these are small numbers. I'm just trying to
Yeah.
make sure they
Yeah, the
make
61 still
sense.
has, it will be something will be a suggestion to say we're gonna take it back in as a one-time.
Why would we have a buildup in that fund?
Years of just excess funds in there.
I mean, did we not just charge what the state charges, or do we charge an extra?
We get a portion of that revenue.
Okay, so
And a
that's what it
portion
is.
Goes to
Okay.
the general fund, but a portion
Okay.
goes to the dog fund.
Okay.
Yeah, and there's a calculation, so what you may pull in that you say is state related, when you do the calculation at the end of the year, you may actually have more revenue than the state's requiring, even though that's what they're asking you to take for each license.
Oh, we get the late fees, maybe, the buck a month late fee. Anyways,
Could be, yeah, but it's a couple years worth of.
I've been late.
We digressed a lot from.
Sorry.
that's why.
But yeah, we're just trying to understand it. Okay.
You wonder why it was 10:15 before you started.
All right. Moving on to the police department budget, just some highlights from 2023 for the police department. We handled close to 15,000 calls for service. Those range from anything from checking the schools, hazardous road situations, family disputes, burglaries, motor vehicle violations, DUIs, alarm responses. We run the whole gamut. We do focus quite a bit on community service. We continue to have our community impact officer that Bethany spoke of, and that position works very closely with human services and downtown businesses. We focus on, we've continued the roving elementary school resource officer, which we're looking to supplement with 2 more officers. And we've run citizen police academies. And in 2023, we actually hired 6 new officers. So we did have a lot of retirements, which we'll show you that'll probably come up again when we start talking about overtime from previous years. But we have stabilized, and we're looking like we're in good shape staffing wise. Again, we do focus quite a bit on the community service side of things. The top left corner is looks like our Citizen Police Academy. Bottom left is Safe Driving Week at the high school. Bottom right, drug take back program that we're continuing is very successful, and some other domestic abuse and child abuse programs. Particularly worth noting in the middle is our accreditation. We were reaccredited for the 10th time. So it varies between 3 and 4 years, but for the past 30 years, we've been nationally accredited. So we retained our 10th reaccreditation last year. So that's something that we're very proud of, and one of, I think, 19 agencies in the entire state of Connecticut that holds that accreditation standard. It's quite an undertaking. It's quite costly. It's time consuming, but it's worthwhile. It's state mandated that police departments hold some sort of accreditation. Many agencies attain the state accreditation, which is a lower standard. But we've been nationally accredited for a number of years, and we're going to look to maintain that. Something we're very proud of.
Is that in addition to the, a great statement on the department, do we benefit in other ways, like with reduced costs and something?
I don't know if there's an insurance benefit
Yeah.
as far as cost, but if there is ever any kind of lawsuits,
Okay.
we would recognize that cost, because we can go to our policies, our training, and our
Yep.
standards that we have
Okay.
documentation of, that we maintain our officers at a certain level, and we can prove that we have those standards in place and those records in place. So it keeps us in check and knows we can never
That's
go.
great. That's great. Thank you.
Well, go into our capital summary. Our capital request is obviously somewhat modest this year compared to years past. Obviously, with the building project, we were hyper focused on keeping our capital requests at a minimal. request. The good thing is that we are in very stable shape for our vehicles. Captain Ferenga will talk about that in a minute, but we recognize, we caught up to date with our vehicle inventory in years past with the supply chain lags and the difficulty in getting vehicles. We switched from Fords to Chevys. And that was due to because we could get them much faster and cheaper, and hopefully it'll be a little bit more reliable. But we did have a good catch up year this year. We're trying to get those vehicles on the road and equipped, and they're at our outfitter now. So we're only requesting one vehicle for next year. Included, we're also asking for traditional taser replacements, mobile data terminals, bulletproof vests, those sorts of things that are just kind of the annual upkeep of our essential equipment. The fixed license plate reader you'll see is $28,000. That's our annual subscription fee to that. Those fixed license plate readers are leased, so we have no obligation or no cost associated with them. If they go offline, the company will come in and fix them, replace them, do what they need to. So it's been kind of a successful, easy program to get up and running and maintain. I'm gonna turn the mic over to Captain Ferenga. He's in charge of our fleet and our vehicles, so he'll talk to that.
Thank you. As the chief mentioned, we switched from Ford to Chevy. The cost increase was so much so that we were able to obtain an extra vehicle with budget money we had, going from Ford to Chevy, and also the availability. Just to highlight it, we ordered all of our Tahoes and one Ford pickup truck as a utility for patrol, and received all the Chevys probably 2 months ago, and we're still waiting for the Ford. So the backlog was the backlog in cost was a huge push for us to obtain vehicles somewhere else, which has been great though for us because we got an extra car in our fleet. So as the chief said, our fleet's in really good shape now. We're going to be offloading a lot of the vehicles that have high mileage, breaking down a lot. It's cost prohibitive to keep them. I've been working closely with the highway mechanics and going over our fleet to keep an eye on what they feel we should keep, what they feel is just not worth fixing anymore, putting any more money in, and what isn't safe for our officers. And that's been working out really well. So we're looking for, one ask this year, then the subsequent years will be multiple vehicles just to keep us in a good cycle. And one point of note, because this has come up a lot, regarding the car's decals, because they do have the subdued decal, but the new vehicles, police is going to be, it's a much cleaner and much more visible police decal on the cars. It still looks really nice, it looks really sharp, but I know a lot of people have been concerned with feeling like the cars aren't readily identifiable as police vehicles. This will mitigate that.
You mean the black on blacks that they have?
Yeah, it's like a light gray and the black
Mhm.
colors, yeah. So now police, it's a lighter color, it's clearly visible, it's unmistakable that it's a police vehicle. So any residents
I've heard
concerned?
comments both one way or the other, either they're too
Sure.
subdued or they're
Like-
too marked and too aggressive. So we tried to strike a balance with something modest and something easily identifiable.
They don't have light bars on too, don't they? Or-
Yeah,
Yeah.
yeah.
Some do, some don't. With your staffing going up by 3 officers, is that requiring an additional vehicle in the
So-
future or at some point?
Yeah, as we're rotating through, we do need to keep a few additional vehicles so that they are equipped with vehicles for the schools.
Right.
And that is built into the cost the chief will talk about is related to the 3 officers, because that becomes the car, the equipment in it.
Sure.
All the things, the computer, the printer. They all need to have in-car cameras, state statute, and the body cameras. So all those pieces of equipment are built into those costs.
Mhm.
And so as we discussed in previous years, we don't just run our cars for a certain amount of time and then get rid of them. We cycle them down to a lesser role in our fleet, which the SROs don't need a high
Right.
performance vehicle. They're not stopping cars. They're not transporting prisoners. They just need something that's identifiable.
Gets them there, yeah.
School. So the cars that come off of our main fleet then go to a secondary role, perhaps a side job, perhaps an SRO, something that's not quite needs to be tip-top shape as a frontline patrol car. So we get as much use out of them as we can. And then if we can, if there's another need in another department in the town that needs a vehicle. I think Chris Kaiser's driving one of our old SUVs, you know, so we'll get as much use out of them as we can. And if it makes sense, we'll trade them in too, or we'll get rid of them. So we get as much use out of the fleet as we can.
But with 3 more officers, we're gonna have to hang on to stuff, cars a little bit.
Yeah, we'll just tweak,
longer.
we'll
Okay.
tweak how we
Yeah.
cycle them out of our fleet before.
You still have one of those, there's LTD sedans, or something, 1 or 2 of them.
There's a few Crown Vics
Yeah.
left. Those are the best.
Yeah.
Here when we retire.
The floor is literally a Flintstone vehicle.
They work great though.
They
Yeah.
start right up. Yeah, it's
You
great.
know, I just have a question. So was the mandate on the in-car camera and stuff, did that come in this year? I see that there wasn't any money and then all of a sudden now we have an annual.
Yeah, we're getting to that right here.
Oh, beautiful.
So that was mandated in 2022 that all police officers are mandated to carry body cameras on their person. And the dashboard vehicle cameras are required for the front lines, full vehicles.
Okay.
We do recognize there is some grant funding available. What do we get? 30.
We got the 30%, which is I think it was about $30,000, which was put back in. That's already been plugged in, and the purchases were already made with that. So this is something that was already done. This is just maintenance.
So there's maintenance fees and
Software.
software. So it was somewhat funded, but not very well funded. So it is a mandate from the state statute that we have to have. So want to talk more about the program at all, or?
I mean, if you've probably seen them, we have them on, the officers have them in the cars and on the person. And, you know, it's been working out great. Our department's used cameras probably since I think 2015, had a much earlier version, and they've been nothing but helpful. You know, a lot of times, unfortunately, officers are accused of either not speaking to the public properly or mishandling something. And when you review the camera and the footage, it kind of puts it to bed and shows that there was nothing necessarily done improper or what have you. So it's definitely they've worked well to our benefit, and the officers, they really enjoy having them now for the most part. They want to have them all the time for that.
That's great.
purpose.
Yeah, because initially there was pushback, like, should we do this? Shouldn't we do
Yeah,
this?
Well, I think there's
concern
a
of what was gonna
cultural shift, and I think officers see more often than not, the cameras and the videos catch officers doing something right rather than catching them doing something wrong. You know, I can go back to an example I had a few years ago. A resident called me irate, threatened to begin moving out of town. He was so upset how he was treated by the officer. And when I went back and looked at the video, it couldn't have been more opposite of what he described to me. And I wouldn't have known if we didn't have the video. And in fact, called him back and said he owes my officer an apology for the way that he treated him. And he was quite humbled once he realized there was video showing how he acted. So it's been very helpful. And that's all I have for capital. If you have any other questions on capital before we move on. So our operating request this year is 7.685. You'll see that's an overall increase of 8.09%. I did factor out, if we did not hire the 3 officers, we would be much closer to a 3.5% increase. So a significant amount of that increase is due to the 3 new officers. And obviously the 2.5% contractual wage increase and utilities, gas and electricity increases are driving a significant part of the budget increase. Staffing wise, we're in good shape right now. We have 4 officers that are eligible for retirement, but within 2 years we'll have 12 more. So we're going to hit a wave where it was just back 20 years ago, we had a big hiring trend, and those officers are now hitting their 20-25 year mark.
That's us.
Yeah.
Yeah, set the table, yeah.
And as I said earlier, we are entering into contract negotiations in 2025. So hopefully we can work on some staffing and hiring and some sort of things that we can recognize some cost savings with our overtime budgets, which we're always looking at. As I said earlier, we were looking to increase from 47 to 50, and it's a long hiring process. We started this back last year. We were able to identify 2 people to send to the academy in January. We weren't able to find that 3rd person in that first group. We're hopeful to, we're in another hiring process, interviews, background checks, all of those sorts of things for the April academy class. So we're hopeful to get a person identified for that class. But we've also had some upcoming, some retirements or some people that have resigned. So we do have vacancies. It's just kind of a 1 step forward, 2 steps back every year, it seems like.
I just want to just expand a little bit on what the chief was talking about with our school resource officer program. We are going to be expanding another 2 SROs so that we can make sure we have our SROs fully embedded in the public schools. So we want to make sure we have all the schools covered. And just to give you a brief timeline of where it started, it was actually 17 years ago now, the New Canaan High School SRO started. And time flies when you're having fun because just, by the breeze. But, I don't think you could even talk to school admin or teachers that could even remember before the SRO was there, and imagine not having them now. And soon after that was such a good success that Saks actually jumped on about 15 years ago. So, and that's another one that's been there so long, a big success. And as you know, we have our roving elementary school resource officer, Shane Gibson, and rave reviews from the principals and vice principals and all the teachers and parents and the students at the elementary school levels. And due to all the support for that, as you all 3 of you well know, we were approved to up our complement to 50 to staff that. So now what we're doing, like the chief was saying, we're hiring to backfill our patrol division so that we can select the proper person or people, officers, to fill those spots. You're not going to pull somebody that's a new hire and make them an SRO. We're going to go into our existing, our known veteran officers, poll them for interest, have an interview process between us and the school administrators, as well as Dr. Lutzy, and select the proper officers. And I know there's been a lot of talk about how to make this an interesting position for the officer to keep it dynamic, and I'll get into that in a second. But just to give you a brief overview on what the unit is, they're supervised by our youth sergeant, who's a member of the investigative division, but he's also a sergeant, so he supervises the SROs. So currently he has 3, and now he'll have 5 officers under his command. We'll add 1 officer at west, south, and east to make sure all the elementary schools are covered. And obviously, just to give you the purpose of the unit, everyone knows is to provide school security. Unfortunately, schools have been increasingly targeted by violent or unhinged actors in the past few years. So it's something we want to make sure we keep our schools safe. And those officers will have increased scenario trainings with force on force, but primarily use de-escalation as our #1 tactic, and then force if needed. But those officers will be highly trained, in addition to what we normally do and have required for the police department. And then obviously the other purpose of the unit is to have school community integration with NCPD officers, as I think you guys can agree it's been a success over the years. And they will obviously receive basic school resource officer training, and then there's advanced SRO training, crime prevention through environmental design, threat assessment, interviewing of youths. There's a lot of different kind of training. And that helps keep them engaged and interested in the position. But also what we're looking at doing is having specialized roles for those officers as well, to keep it interesting and more productive for the school and students, to be frank. We don't want to have it so that there's just an officer basically as a security guard planted there. We don't need that. We have great monitors that can handle that position. So all officers will be engaged in the school activities. So we're in taking the theory to design and practicality phase right now. Our first ideas are having a safety and physical security officer, and that officer will have like the crime prevention through environmental design training. We'll be running the lockdowns and working very closely with school admin and facilities managers to make sure that the site is safe and bring any ideas to the CAB and our Board of Education. Also, we're looking at having one of the officers be a safety education officer. And that's kind of like harkening back to the days of DARE. The program does still exist. It's still a viable program. There's another program called SHAPE, which the Fairfield schools use. So that's another idea we have. Just gonna pick the right curriculum. I was recently speaking to the president of NASRO, and he recommended we touch base with the Newtown schools because they have a very successful elementary school program with SROs. So we've been having our youth sergeant going back and forth with them, coming up with some ideas. So we're looking forward to that. And so the idea is that you'll have an officer who's stationed at one school, you know, as his primary or her primary school, to embed with the admin and the teachers and the students and build those bonds and relationships, which we've seen successful at the high school and the middle school. But then as well, they will also travel to the other schools and kind of switch off and, you know, coordinate schedules to conduct their specialties. And obviously we'll find any specialized.
So you just rotate the officers
Yep,
when the
they'll
other
rotate it.
officers. and-
So most of their time will be at the primary school, but then they'll travel around and there won't be a lack of coverage. One, like say the East officer is, for example, the safety officer that's going to teach a DARE program. He would go to West and then she would go to East covered and do her role there.
What do you do for coverage? This is basically 5 officers who have these roles and share it within the schools. If somebody's sick, out, but I mean, I'm assuming they won't take vacation.
Sure.
They'll
so-
make their vacation around school vacations, but what do you do in terms of if someone's out?
We've had that question come up before, and like I said, our youth sergeant is their supervisor. So he visits them periodically and he'll obviously know if they're out or absent, if they're at training or out sick or on vacation. And they tend not to take vacation during the school year and they kind of just mirror the school's time off with that. So it's very minimal when there's not coverage. But the youth sergeant will kind of step in and plug the hole there.
Backfill?
And yeah, or we'll let the patrol division know and they'll do increased checks and they'll get out. And we have one of our call types is called a school check. So the officer will call out a school check. It's kind of like doing a location check at a business. You'll get out, you'll go in, you'll talk to everybody, kind of touch base with them and be a point person with them. We also have school liaisons, which we won't necessarily have in its current form with East, West, and South School. But the idea is to maybe have, you know, kind of like officers in the wings that we want to look to be SROs in the future, and they'll kind of be liaisons, and they'll touch base with the SRO and maybe kind of plug in those ways. Not to the same exact role as the SRO, but as coverage, basically.
Pretty short, they will cover each other. So as an example, recently the SACS SRO was out on maternity leave for an extended period of time. And Shane covered that SACS building periodically throughout his day. Still rolled through the elementary schools, but he also added SACS to his rotation. So instead of only having the 3 officers now to cover all of the schools, we'll have a much bigger pool so we can cover each other and that's how we'll handle that usually.
Okay.
The goal is omnipresence at the schools, obviously. We're protecting our most valuable asset, so.
All right, police overtime, the next big item to discuss. So we do have our scheduling software that we've incorporated a number of years ago, and that allows us to get pretty granular insight as to where our overtime is coming from. And it's been great rather than in years past, having really no idea and no way to track it and see what the trends are. We can focus on that. And like I said, we can take this information and be able to sit down with a wealth of knowledge at the negotiation table and say, listen, you know, these things are driving our overtime. These are other things that we can show some cost savings on. So right at the top is administrative, and that's kind of a catch-all. We're looking at ways to identify certain things. For example, right now, when an SRO stays after school or does a speaking engagement or something like that, they'll put his overtime into that bucket. We're gonna parse that out and be able to identify that in a separate line, a separate reason code within our software, so we can track that better. Also included in that line last year, which was pretty high, was when an officer's has to go for a PT appointment for a workers' comp thing or something like that. That's kind of thrown in that bucket too. So that's sort of a catch-all bucket that I want to try to identify some better, more identifiable, large ticket items in there. Training, which we always like to see towards the top of the list, is something that's good to see. So we've got a pretty high percentage of our hours are due to training. And then a lot of it is shift shortage. We've seen a high number of overtime based on shift shortage, and all of that's contractual. Officers are allowed to take their time off. And looking back historically, you could see in 2020, 2021, those numbers were pretty low, because I think just people, due to COVID, weren't traveling, weren't taking vacations, weren't taking as much time off because there was nowhere to go really. And then we saw it spike up again, and it's trending kind of high. And last year was sort of the perfect storm where we saw a lot of shift shortages, but we also saw a lot of shift shortages due to retirements of supervisors. So it took a number of months to get the people to backfill those supervisory positions. And we also had some long-term workers' comp claims for people that were supervisors as well. They were out for several months. And those are very costly to us to hire back supervisors.
Is there a chance, and I know people choose to retire when they want to retire, so we have 12 folks who would be of retirement age. I mean, just, there is a chance that if we have, I know it's hard to find people, but that you might get a salary, some relief in salaries if you have a decent amount of turnover, just like we see with schools sometimes. And that's a little different too, because they can hire people higher.
Yeah.
But these are,
I think the schools
it's an expensive year
recognize
for you. Yeah.
I think schools recognize it more because it takes so long to go up their steps.
Mhm.
And then due to our contract, the step increases are very rapid.
It's
So
flatter,
Within
yeah.
5 years, they're at top step.
Okay.
So it's a very short-term gain financially, but then you have a very young force that's very
Young.
green. So
Yeah.
it's a trade-off,
Mhm.
but we might, and I hesitate to wish for that because just the hiring pool is so small. We're fortunate where
Right.
we're hiring 1, 2,
Mhm.
3 at a time.
Mhm.
If we had to hire 6 or 8, I'd be very concerned if we would get that number of candidates coming through.
Got it.
Some of the bigger towns, your Bridgeports, Stanfords, they're very far behind in their complement. I think Bridgeport's, over 400 and I think they only have in the 200s. So they're just very understaffed, and it's very difficult to get good candidates. So
are you seeing any improvement in individuals wanting to go into law enforcement and?
we are, like I said, we have a long hiring process. They go through a number of interviews, significant background checks, polygraph, psychological exams, medical exams. So we're maintaining our high standards that we expect of our officers. And as I said, we're only hiring 1, 2, maybe 3 officers at a time. So with the pool that we get, we can identify and, like I said, back in January, we didn't have the right 3 candidates. So we just went with 2 and on to the next. So we're not going to sacrifice our standards to just go put a body in a so.
Interestingly, though, we've seen a lot of very high qualified female officers coming across, more interest in becoming law enforcement, a lot of qualified females.
Yeah.
Which was a struggle for our lockers for those.
Which is why we're building more locker rooms.
Yeah, absolutely.
That's why we fought for that, man.
Exactly.
I think 2 at the academy.
One now.
One, yeah.
With this software and the way we've tracked this over the years, how does we're about to, this is almost a 10,000 total hours of overtime. One of the slides that would be helpful at some point would be to see the trend. How does this compare, 2 years ago, 3 years ago, 4 years ago, in terms of total numbers of hours?
Yeah, and I have some spreadsheets with that, and
I mean, are we trending?
we're trending higher for some reason, and then that a lot closer as to why, and
Because the reason we installed the software years ago was like, we were like, it was really out of.
And that was a long time ago, right? That we got a good bump right then,
Right.
right? So I agree with you. I'm sure you're looking at it, but
yeah.
a big number.
We have seen, and I can show you, so this slide shows kind of what you're talking about. This is all of our reason codes that we have that would be attributed to a shift shortage.
Okay.
And you can see that that's nearly 50% of our total hours of overtime is due to shift shortage. So what we're gonna do in the coming months is really look at why are we so short-staffed on our shifts. And some of it can be attributed to a lot of the younger officers, a lot of the newer officers aren't interested in participating in promotional exams. Right now, we have one officer that's on our acting sergeant. Whereas in years past, when I was going through the ranks, it would be 7, 8, 9, 10 people. And those people fill the roles as acting supervisors during the shifts, where now we don't have that pool to draw from. So if a supervisor calls out sick or is out for a shift and there needs to be a hire, in years past, there would have been an acting supervisor already working that shift and not a need to hire somebody back. We would have just bumped them up and pay a little bit, but now.
Is it because they're not aspirational to move up, or what is there?
I think the financial incentive isn't quite there. They can make a lot of money working side jobs, working some overtime, and have zero responsibility. And unfortunately, that's appealing to some of the younger folks. But that's another thing that we're really trying to look at and trying to identify. Why isn't there a desire to participate in that? And I think part of it too is, for a very small agency, we have a lot of opportunity. We have the CIO positions, we have the SRO positions, we have these positions where, investigative positions where officers can go to and be quite happy and quite content, and they're fulfilled in their career, but they're on this track where they don't want to take the promotion test because, hey, I'm happy being an SRO now. So those are some of the other things that we're looking at, is putting term limits on some of these assignments where we can say, hey, you're going to be the downtown officer, but your role there is going to expire, and you're going to have to figure out and do some succession planning and figure out what else you want to do for the rest of your career. So rather than giving somebody a lifetime sentence into these desirable positions. So.
I may be missing something, so I apologize. But so we have OT on a number of different line items.
Yeah.
Okay, so in 2023 actual salaries OT, 406,000.
Yeah.
Adopted 265. And then, is there a cumulative OT number in this? Because we have, I'm just, because if we had in 2023, 406,000, we only adopted 265,000, that's just for the straight salary OT. But then there's sick, traffic enforcement, injury, detective, STEM. Is there a cumulative OT number?
Yeah.
So like if
I have-
we all the OT, yeah, okay.
So-
And I guess that is against,
That's
because that
all-
one line item in
that-
23 is high, so
What's that?
that 123 number is high. It is.
That was that year that was kind of the imperfect storm year where we had some supervisor retirements, and I had those 4 supervisors throughout the year at different times, and some were at different times, that were on long-term injury leave. So it was a very costly year.
Yeah.
In that regard, and that was, you can see that that was quite a blip. But this number is inclusive of all of those, I believe it's 6 lines.
Yeah, that's a question. So,
So that's a cumulative number that you're looking for, so.
right,
As you said, last year adopted was 523, so all of those lines
okay.
was 523. Currently, we're year to date at 343, so we're a little over 65% of that of overtime already with 6 months to go. So we are trending a little high again. Not quite as high as fiscal year 23. Fiscal year 23 was just a bad year for us. And I kind
But
of
so
look at,
cumulatively, the OT request is 13%. Is that right? If I 523 to 590 year over year, is that right?
yes,
If I did that quickly?
I would have to do it, but yeah.
Oh, yeah,
it's-
I just did,
yeah.
so we're good.
But the
Well,
addi- So but the addition of these new officers and that expense that we're with the SROs. Technically, you'd say, okay, it's gonna help reduce our overtime, but it's actually not. It's
No,
actually
no,
probably.
it's gonna be a zero sum because those 3 officers are gonna be added to patrol, and this overtime is mostly patrol. So those 3 officers will be added to patrol, but we're gonna take 3 officers out of patrol to put into the school, so it's gonna be a net zero as far as that's concerned. We may see some advantage in the summer times when school's out, those few months when
Right.
vacations are high and we have those officers now back on their patrol shifts. They don't get the summer off like schools do, so we may see some benefit, but I don't.
Do you see
Cautiously
any
optimistic.
seasonality to your overtime? Is it bigger in the winter? Is it bigger, I mean,
It is high in the winter time, during, prime vacation times, holiday times. But, like I said, a lot of it is driven by
it doesn't help you when they're.
staffing, the supervisory staff. We have to look at. And we want to take a close look at that during negotiations. Yeah, it is a big number, but
Yeah, I mean, we've looked at this over the years, going into a budget, already knowing you're gonna have $600,000 here in overtime. It's like, well, how can we correct that curve?
Well, you always know you have a chunk. I
Right.
mean, that's just the nature of this. So we know we have a chunk. It's the increase that's.
Well,
the
when
trouble.
is, and it is, it's like, when is it time to hire another officer? I mean, to be honest with you, because that number tells me maybe you need additional.
I think John, I think you said it, no matter how many officers, it's the time off.
Mhm.
That's what we have to focus on, because you can keep hiring, but these guys all get time off, which causes the overtime. So I think it's a bigger picture.
And there's no managing from the department of who gets to take a time off when?
it's all
It's all
contractual.
contractual.
You could theoretically have all the officers take the same time off?
No,
Not really.
that's where this comes in.
That's a contractual.
Okay.
To make sure that the shifts are staffed properly.
Okay,
But you do also have to allow the officers to use their time.
Sure.
So they're gonna have
Right.
vacation days, then we have to hire back to cover those vacation days. But there's a limit to how many people can get off at any one time, and also what tier of rank can get off at any one time.
Is there
That's
anything
all
that
in the
triggers,
contract.
anything trigger mutual aid? Did that ever happen?
No, we're not that desperate. I mean, it could if we have a
That'd be
situation, we
advantage.
do have plans in place that we could call in additional resources from surrounding towns. But fortunately, we're not at that dire straits yet, no.
how do you compare to other communities in overtime?
Good question. I'll have to check on that. I'll check with Darien. and Wilson.
Yeah.
and see
Yeah, it'd
where
just
they're-
be interesting to see if there's different
Very true, yeah.
management styles that.
Yeah, I did have some kind of casual conversations with other departments about officers being involved in promotional processes and Stratford, for example, they can't wait to take the promotional exam
Yeah.
for some reason. So, I'm curious to see what we're doing wrong in that area or what the issue, where the drawback is. So, yeah, I'll check.
It'd be
with-
interesting to see, do more of their officers live in town in Stratford than maybe. here?
Perhaps, I don't know.
It'd be interesting just to see like, what are the drivers,
Yeah, but I'll I'll get some information and
Okay.
see what the overtime is in the other towns and see if they're seeing the same trends.
Yeah, that'd be great.
Yeah, but so we're looking at approximately of the whole police operating budget, 8% of it is for overtime. Now, we're always gonna have a chunk because of the nature of people taking. So I think that's kind of, it's interesting. Go back and look, but. And this is a very small thing, and you bet you're gonna say contractually we can't. But for the officers who raise their hand for SROs, now, and I have a sense that's how they operate. But can part of that basically being that you will not take days off, you know, obviously you're sick or some emergency during school days,
Well, they wouldn't cause overtime if they took a day off for whatever reason. That wouldn't be an overtime position.
okay,
So we wouldn't have to fill that. Typically, we have to fill patrol shifts.
Okay.
To a minimum standard.
Okay.
Minimum 5 officers, but if an investigator calls out sick, we don't have to backfill that with an overtime hire or an SRO. Some of these special assignment positions are not required to be overtime.
all right,
Most of the overtime you see is for patrol shifts.
okay, thank you.
That's all I have.
I mean, the capital is some of the lowest we've seen. Thank you for that.
Well,
We
Kind
aren't
of, sort of,
building-
it's kind of sort of low, yeah. But you know, it's just for the building so far, knock wood, been good on the demo and not finding any big problems. And that, I know it's been renovated a couple times, but you never quite know. So fingers crossed, because once you get through the demo, those big risk factors fall off, which is good.
Yeah, that was something that was brought up at the building committee a number of times, that once we get through this first month or two, they'll know and we can push forward, so.
And hopefully come in lower.
Lower and quicker.
Yes,
All right. That's a good work. Thank you.
thank you.
Thank you.
All right, thank you.
I'm good. I'm good. Thank you.
I'll be sitting still, there's nothing slips.
I'm good.
Oh, thank you. It's like, what is wrong with me? 6 weeks. Not the same thing. Yeah. Driver still has it. None of us can get rid of the cough.
Oh, it's
I can't
weeks.
get rid of it.
Oh, no, it's a multiple week thing.
Yeah.
Yeah.
I'm like, what the hell?
We sounded like a consumption ward for about 3 weeks.
All right. Set. Good morning, all.
Morning.
Hello there.
Like to present our Department of Fire Services FY 25 budget to the Selectmen. Our 24 goals and objectives quickly. Our public education continues. We did a little less than the year before. This is fiscal year. Excuse me, this is calendar year, but 85 actual public education events that we did. Still continue to have the code, scan me code, and all the documents for residents to grab off the website throughout the year, and obviously advertise them as time comes up. We are in the process. We started to evaluate our department against national standards. We are looking at roughly 20 different standards that would directly impact the fire department and the town. So all the officers have taken on a few of those and going through line by line and seeing where we are in comparison to those. We implement a new records management system, which actually includes our staffing, listening to PD, it does include our staffing now as electronic. So it's becoming a lot more manageable. Not so much as a record keeping, but looking forward also. So that's a nice thing. Have full transparency on it, looking out to see what people are on duty, what they're taking off, in the future. We did place our new rescue boat, last year's capital, project. We got our rescue boat in service, actually training this week, probably finishing up now today, put out on Mill Pond. There were some questions calls over the weekend, so we did.
That was from me,
social
Albie,
media
I'm
this
sorry.
morning that we were going to be out there, so, and that rescue boat's dual purpose for ice and our, I hate to call it swift water here, but, rapid water here with the flooding and so on, so that's, provides dual purpose. So those are some of the things we did finish in 2000, well, we, are started on in 2024. Work in progress, we're still working with, EMS and PD and emergency management to, get our active assailant training done, as a group of departments, not just one department. So that's actually happening in March, for a contingent of, members. We're still pre-planning the commercial district. That is a requirement for the, actually, I should have said, remind everybody, we did make we bettered our rating to a 3.3Y for our insurance services rating, which affects all property and commercial insurances. So one of the things that directly affects that is completing annual pre-planning. So with the records management system, and one of the officers is kind of taking the helm on that to have a plan in place to get into each occupancy on an annual basis. So we're still trying to get our first round completed to get that initial information into the system, and then we'll start on our annual, how we're gonna hit it on an annual basis.
I'm sorry, what does that mean? So we got a better rating,
Oh, so
for those of us
insurance-
down the world, yeah.
Insurance Services Office gives a
Nice.
public protection classification rating. It directly affects the residential, commercial building insurance and property insurance. They evaluate every 5 years. So ours went from a 4.4Y. The letter identifies our non-hydrated area. So we're still struggling with water supplies, but that, that gets accounted for in their insurance. But we went down to a 3.3Y, which in turn, is bettered our.
We want to go down.
We want to go down.
Okay.
Yeah, 1 is the best.
All right.
10 is the worst. And, we want to continue to go down. And a lot of it is stuff, just straightening out record keeping, adding more training hours, getting the pre-planning completed. And the water supply infrastructure is still a challenge for us. So that's something that we're going to continue to work on.
And the pre-planning means what you would do if there's an issue.
Pre-planning is we go into commercial, any target hazard, commercial occupancy. Different reasons. One, if we're going into a school, pre-planning is, okay, where can we keep kids if there was a fire, if they couldn't get out, where can we shelter them? Where's the best access to put a fire out? I look at commercial, and pre-planning looks at commercial occupancies. If take a multi-store, like an office on top, if I had a water pipe break, as basic as that, where's the water shut off so I can quickly reduce property damage?
Got it.
That is the whole goal of pre-planning. And, if there's a fire that started, obviously, those things would be in place too. But the biggest thing is, how do I secure utilities and so on, so it doesn't continue to cause damage, is what the insurance companies are worried about.
All right, so basically, the quicker you can get in, stop something.
Well,
Right.
and over the years, we had a higher ISO, but we
Yeah.
started putting dry hydrants in town and,
Mm.
giving other areas, between ponds and our pools, our residents' pools. Is there a way
Pools,
to?
Unfortunately, they do not recognize pools yet.
We have
That's
a
still
lot of
something they're
pools.
working on. So, yes, that was one conversation with ISO, and, briefly talked about it. We still want to tap in the pools. We're still that's one of our hit lists. Even if it might not decrease the ISO rating, but at least we know there's water there.
Do
So
you
we got some
need
ideas.
permission from the government, or is it?
You would need permission from the resident, and maybe a carrot for the resident too. So that's something we can talk offline after budget season, that it's one of the things on the horizon for water supply improvement, is getting better access to people's pools if they're available to us. A lot of them are not, they're just too far away, or they're
Right.
downgrade. So we can't draft them. Still working, any grant opportunity that comes up, myself and Greg Riley are trying to take advantage of those as possible. Unfortunately, we weren't successful in the big grants we put in for last year. So we're ramping up for this year's, which starts at the end of the month that the process opens. So we're gonna be going for a self-contained breathing apparatus, which you'll see in the Capitol. Moving forward with 25, continue on national standards to review those and get a better sense of where we are compared to those. And then start looking at where do we want to improve on if we can, both looking at operational and cost impacts, on any of those standards. Continue to pre-plan, as we just talked about, enhancing firefighter safety. We're very good at that. We got a lot of mechanisms in place. We do have a push in the fire service now, cancer reduction. That's one of the biggest things coming out, and now it's legislated that, in the state that we need to have a cancer reduction plan in place. So that's something that we're starting to move toward and seeing where we are with that also. And you'll see there'll be a couple purchases coming up, requests for limiting that cancer reduction in firefighters.
And that's cancer that would be triggered by the nature of the work, not, it can't, or is it holistically? I mean, or is it just behavioral changes that would help
Well,
anyway?
some of that's in there too. Yeah, so
Okay.
behavioral changes are definitely in there.
Right.
Especially for compensation. So certain maybe not so good behaviors aren't supposed to be happening, such as smoking.
Yeah.
And use of tobacco. So that is actually in the law.
Okay.
So that's something that needs to get looked at. And even our gear, a lot of our personal protective gear is on the big level, is looking at how do they reduce the chemical contaminants that are actually in the gear when they make it.
Right.
So that's happening on the national level.
Didn't you just have a cancer screening like
Yes, so the union, the firefighters union brought the United Diagnostics in with the recommended cancer screening that the state union is recommending. So the guys use their HSAs to go through that. We had volunteers that actually went through it, and then they offered it up to neighboring communities and departments. So it was pretty well attended. Increased water supply, as we just mentioned, and we're working on increasing our special rescue capabilities. We identified swift water. Unfortunately, we looked some of the trench requirements and some of the things that we can do moving forward for technical rescues, such as a trench collapse and or rope rescue, that we're trying to relook at our capabilities and what we need to do for what the hazards are in town. So, operating budget.
Oh, it's right up there.
Overall increase is 4.43%. It's total operating budget, just over 4.7 million with a 269,000 increase. Major drivers, contractual salary increases at 2% for this fiscal year. We do have an increase on the staffing model that Josh sent out. We would like to stagger 2 firefighters starting for anticipated retirements in 2025. So we budgeted 1 firefighter to start in August and a second one to start in the spring of 25, which would get them through the recruit academy and our in-house requirements for the anticipated retirements in 25.
Are those definite retirements or could
Those are
people
definite
rethink? So it's definite, okay.
Yes, those are definite retirements. The reason I need to ask for the staggering versus starting 2 in the spring, once you ask for more than 1 spot in our recruit school up at the Connecticut Fire Academy, we go into a lottery if they have too many requests. So if we don't win the lottery, percentages are a lot less than Powerball that we can win. But if we don't win the lottery, then that spot would be a vacancy until December of 25, which would incur overtime until the end of that fiscal year, end of December, which would be fiscal year 26, which would be a roughly $60,000 cost over that month, because that's what our last retirement cost from August to December in overtime.
So is the
Right.
school a couple times a year? Is it,
2 times a year. There's a
Okay.
fall class. And
so you go for one, you definitely get in, and then
So,
you go for the second, you
Yeah,
definitely get in.
because if I ask for one, it's a guaranteed spot
Got it.
for any department. Once, it's because of our size, because we're only a
Yeah.
24 career staff department, you know, versus a Bridgeport, which could get more on their initial. So ours is smaller and we go into the lottery right away,
And is it allotted for both positions or one?
just one.
Okay,
So
so
I'm
the,
guaranteed the one. So I could guarantee that position in the fall, we can get that firefighter through, bring them on shift. I would like to start him on him or her on days. You know, they would work days until that vacancy opened up on shift. And then the same thing with the second one, they would have a day schedule and be an extra firefighter on the day shift, which is basically a 3 on 3 off schedule that other departments that have a similar model use. Instead of putting them on a 24-hour shift, which the 24-person career staff has. Any other questions on the two, or the thought?
I'm still struggling on
Right.
this. If you vote, so we have a class, you put 2 in, you'll definitely get one. The
Yes.
second becomes a lottery, right?
Correct.
But does that preclude you from 6 months from now asking for a spot and getting it, or just?
No, that's why I want to start one in the fall of this year. So after this budget starts, I'd like to start one in the fall
Mhm.
of 24, which is 25 budget.
Yeah.
And then start the second one in February of 25. That both of them will be through everything and ready to go on the line after July 1 of 25 when those members leave.
Okay,
So I'm guaranteed one each time.
What will happen if we
Good.
don't plan, like we talked this year, is the overtime is gonna kill us.
Mhm.
So
Right.
I think by bringing those extra in at a lower salary to cover those shifts, in the long run, it will benefit the town.
So yeah, if we put them both in the spring, they, and we were fortunate to get the one in the lottery, you're saving about $28,000 by getting them in the spring. The risk, if not getting them in the spring, is a cost of $60,000 on the back end with overtime, when that person definitely leaves after July of 25.
Mhm.
Any other
Yeah.
questions on that one?
so it's a temp increase in staffing.
It's just temping,
Yeah,
yeah.
you just gotta
It's
do it.
just preparing
Okay.
for, in which the bargaining agreement has it in already. They can announce their retirement 6 months, and then that allows us to put somebody in early, which multiple times we've had a 25th firefighter on the roster until that person left, based on the contract and it's just saving on the overtime, the back end of the overtime.
Okay.
Career Assistant Chief is funded for the entire year in 2025. Our callback is a request for 10,000. We looking at what we have spent over the last couple of years, it has gone up. We've went over what we budgeted for. We had a slow time during 2020 and 21 based on not a lot of calls. I guess we were using averages, but this was actual for the last couple of years. And callback is just for reported structure fires, mutual aid calls for us, and it allows the career staff to come backfill the firehouse and or go to the call if it's in our town for assistance. So that's a great insurance policy with a 6-person shift, having the ability to have firefighters come back for 2-hour minimum for the event. Employee fitness, you'll see a large increase. That was I want to call it a line item error, but we weren't sure it was coming out of HR maybe for a little while there. All we're doing is cleaning up where it should be coming from. So it was getting paid through an HR line and it's coming into the fire department line. So that's why there was a large increase. on that to make sure it's getting accounted for in the proper location.
That's just gym memberships. and
That,
things.
yeah, that's the reimbursement for gym memberships.
So we'll see 10,000 down on HR. to
I'm
offset
not gonna
this.
answer that one. I'm not going there.
I'm looking at that.
Our training costs, although we still up from previous years, our actuals, we are able to decrease that as far as what was asked for. Let me just jump to that. That was a found savings and training overtime. We were doing EMS training online. I've since moved that since last year's budget. We were able to secure daytime training for the career staff. So now we're paying it on the training cost of the instructor coming in and not the overtime cost for the firefighters, which we were doing online, which started during COVID, obviously, and was continuing, and we're able to contract the instructor to do that.
So
that-
training's going up 20,000 and training overtime is, where's that?
Well, training overtime
Got it.
would be salaries training 51920. Last year's request was 132 because of the, we were still doing EMS online. We were able to change that in the fall. So it significantly dropped current budgets that I spent 45,000 on, training overtime right now. And we're on pace, so we requested, for 90 for next year. We still do. Training overtime includes, a lot of our, requirements, the new firefighters going to pump operator, which is minimal, but then our hazmat, our people that are involved in teams such as hazmat communications, when they have to go off-site for training on a monthly basis to keep up their certifications. Our live burns, trying to do 2 a year with the volunteers, that's a cost to us to go off-site to train. And any of a big chunk of that is they have a training days that they can use in the career side, can use in their bargaining agreement, which is 30 hours a year. So that potentially could be 30 hours times 24 people. We have not accounted for the entire 30 hours because it looks like it's about a 75% use of that 30 hours. So that's included in that. So that's a contractual item. So they could take any state fire class or take time off if they were doing college in a brick and mortar facility. They could take that training time and go off-site to do that if they were working. It's not an overtime. It's only used, that one's only used if it's their shift. So if they're taking, an example would be fire officer 1, and they're off duty, they just go on their own and do that to complete the class. If their shift happens to be that day, then they can take the 8 or 12 hours off to go to that, and they can, they could go 30 hours a year. Any other questions on the training overtime line? Apparatus for equipment repair, asked for a significant increase. There, we're looking at about a $11,000 increase. Our aging, it just comes down to the aging fleet and really doing a much better job getting the rigs out there to get inspected, and they're finding some problems that, some is preventative, some is catch up over trying to get the most out of our apparatus over a 25 to 30 year process. So it's starting to cost a lot more to keep them on the road. So that's where that increase is for the apparatus. And it's also emergency equipment repair, which is our aging SCBA and extrication tools that are large impacts on that budget every year with some of the repairs and replacement they have to do. And found savings, we, average has been pretty good for the overtime line for sick. The firefighters calling in sick, so we did a reduction on the sick overtime line also. So those are two places where we're able to reduce.
Oh, wait, did I miss? Why are physicals up so much?
Physicals, that's a requirement for fire service and we went to a new vendor, we got a quote from them and really pushing, again, back to the Cancer Reduction Act, everybody to get the compliant physical, whether it's from our vendor or some are still going to their doctors and asking for reimbursement, as long as they can provide that service. But that's what NFPA is requiring for the physical, is why the cost is. So it's accounted for everybody. It accounts for every one of us doing it on the town's cost because it is our responsibility to provide that. Some do go through their insurance.
So in prior years, when we budgeted for it, we just didn't, because we don't have a big increase in staff, but like,
I'm sorry, it was,
so we went up from 32 last year as a budget. So
right.
how many,
Yeah, and that's just based on the average. Here's the problem with physicals. It's going to, I can't say if you have something done this year, that person might get flagged for a stress test this year. So I took an average of each physical at the high end and the low end to go there. So I don't know, my 3-year firefighter that's only 27 years old would need a stress test on that. I can't say that until he or she actually goes to the doctor to say, all right, he's up for a stress test or a chest x-ray. So that there is a variable in there, hoping it comes in less, but I can't, I didn't want to go top end on everybody in that. And again, people are still using their own insurance as long as it meets the standard.
But if you use your own insurance,
Right.
your insurance pays for it, no?
Correct.
So can't we just encourage people to use your own insurance? Everyone's got insurance, right?
Actually, legally, we're supposed to go the other way. OSHA requires us to, and NFPA requires us to provide the physical. So, yeah, that's.
So I mean, so you can go to your doctor or you can't?
I get, and this is one of those gray areas. Well, the town provides the insurance. Does that, that's one of those debates that's happening everywhere. Well, are they doing it? And I don't want to say any doctors signing somebody off, but some people still go to their pediatrician. So, can they really do that what they're supposed to be doing? So that's, trying to get it into a set place that has the right tools to perform the physical and they're supposed to go to an occupational health doctor. That's one of the major requirements, which a lot of general practitioners are not. So that's what we're trying to get everybody to take this physical that the town provides for at a specific place that they can do it. That's really the right way to go, not going back to the insurance.
And that's what this is paying for?
Correct.
For everybody?
It's paying for the firefighter, physical career and volunteer. So
And they may use it or they may not. Which
they
tell
may
me.
use it, they may not.
what percentage of your staff is using their own insurance as opposed to using that?
I don't have that answer right now. I'd have to, I think it's about 25%, but I would have to check with Jill on that. And some of the things, and even if they go their own physician,
Mhm.
there are certain things that come back to us because that is not covered under healthcare, your regular health insurance. Then it has to come to us, such as, stress tests or even check, that's right. Something like that. It might not go through their insurance.
Howie,
Yes.
I think you can move your gym membership down to 5 because you only used 4,400 out of our account.
Okay.
So I think probably when you did the numbers, maybe you maxed everybody doing it, but we averaged 3,800, 22, 5,300, and then we went down to 4,400.
And trying
I
to,
know you didn't use any of yours, but when I look back at the numbers, we've had,
the only one I had was an actual from 22, which is 26.5.
right,
The Josh said.
so I just think you can take the
Okay.
10 to
We'll take it.
5. And if it goes over, I'll help out.
Thank you. Because we won't see those till June.
Right.
So,
We're gonna have a really nice gym at the
yeah.
police
let's-
department, just saying.
We have ours is so most of the, members are using what we have, in the firehouse, so.
It's convenient,
that's a
yep.
good thing. Just to review our, just quick over our staffing model, if there's any questions on how things are put together. So right now we have about 26 volunteer company members. Unfortunately, 50% of them are on probation, so takes a while to work them out of probation.
That's because they haven't had enough training.
Right, they just
Just
don't,
kinda.
they haven't finished their fire one yet, and all the requirements, so it's a process. Some of them can be up to a year to work them out of the probationary status. Fire marshal's office, which we don't talk about a lot, but Monday through Friday staffing, fire marshal's got on-call responsibilities 24/7. And we had 2 part-time inspectors, we since lost one, so still working with one part-time inspector, 2.5 days a week, and if the current part-time inspectors need it, he's asked to fill in for the one that that did leave the office. And our career side, 24 career staff, 24 365 coverage. They're split up into 4 groups. Each has a captain, lieutenant, 4 firefighters. Again, everything is filled at this time. That's includes a 6-person minimum max. So we don't have, with when we talk shift staffing, anytime somebody is off on a vacation, a holiday, a sick day, it needs to get covered with overtime. So that's why our overtime numbers are, where they are on each line, because each one, it automatically triggers an overtime. And then increase the 2 firefighters, which we talked to, just to see this scare you a little bit. There's the, that's basically and the yellow is what's vacant right now, as far as positions. The right side is volunteer side, and then that career side. So that's the, our current org chart of the department. Any questions on our operating?
So does your budget, you have, the opening is the career assistant
Yep.
chief, is the budget assuming that's filled?
Yes, we actually had it in our budget for a half a year, after my predecessor left and I moved up. And we didn't fill it that year, and then we have not filled it in this current fiscal year. We're in the process of working on a replacement currently for the half a year this year. It's in the budget for a half year.
Next year, yeah,
For the current year, we're at fiscal year 24. We
Yeah.
actually are funded for a half year.
half year, okay.
Any other questions? But,
I'm just saying, we're in February.
yep,
So-
so we're gonna save money.
We'll be saving.
So we'll be saving money.
Just checking. So
Been a little overwhelmed, that's fine.
I was gonna
I
say,
haven't gotten to it yet.
you're
so.
operating like this, so do you need it?
Well, I didn't make the list of what's not getting done or started and not
Okay.
finished yet, so that's the.
I just gotta
I
ask, you know,
That's fair.
Okay.
So, but I do prioritize and I like, all right, well, I keep putting it on behind me. We'll get there. So it's a process. All right, so if there's no other questions with operating, we'll jump into our capital expenditures. This is the spreadsheet of the request, 217,325. I'll jump back to this slide if you would like, but what's that include? Continued turnout gear. Full set of turnout gear is roughly 4,700 per member. We don't always have to buy the entire set, so it'll vary. But that NFPA requires 10-year replacement on that. Our career staff does get 2 sets, so they basically get a new set every 5 years. The volunteers get their set for 10 years. So every new member that's coming on, I have to, all those probies, eventually I'm purchasing a turnout gear for them. Right now, they're in old stuff that's non-compliant. But once they get active, they can't go interior firefighting without a new set of gear. We figured for 8 sets per year on average. That's kind of where the budget number comes from. We're over that this year using some other funds to replace some of that. To stick with that cancer reduction plan, I'd like to add a second gear washer in the firehouse. So that's twofold. One, it's gonna help taking the contaminants out of the gear after they use it for various calls or trainings. But it also increases our turnaround time. Currently, our volunteers are pretty much out of service when they do a live burn or go to a fire, because the gear takes so long to get it washed, because we only can do one set at a time. So this would decrease the time for getting them back in service, to have those 26 members available, because they do not have a second set. So that's kind of a
So
priority.
it's like a high-end washing machine.
Yeah, it's called an extractor, the way it washes and pulls the contaminant out. It's all stainless steel, so the contaminant doesn't stay in like a homeowner's washing machine, which is plastic, could be plastic inside, which they say the temperature of the water and the contaminant can stay inside the plastic. So, so this would be an additional one to the single gear washer we already have. And that was, I think requested 12,000, which would also include the plumbing and fitting of the machine in the current area. Also, with our cancer reduction is to upgrade our Plymo vent system, which is basically our apparatus exhaust system. Like aging equipment, again, we're having a lot of failures with the air that's needed to hold the system onto the exhaust pipe and the air coming to the unit. If a hose breaks during the week, we have to shut the system off for all the apparatus, because it won't isolate just one area. So now I have apparatus starting and the contaminants are going in the firehouse, and the living area is right upstairs. What this does is we want to replace all the ends, so that boot that's attached to the fire apparatus, want to change those over to magnetic, which would take out the air compressor for the unit, which now the system won't be out of service, and less impact on our air compressor for the building. So that's the 15,000 request for the upgrade of the station exhaust system to replace all the apparatus, tailpipes, and the system itself. We are looking at it with the career assistant chief, looking down the road, replacing that, adding a staff vehicle to the to our apparatus for that career assistant chief to have 24-hour coverage response for that. That's probably, with all the putting everything in the radios, portable radio, it's a $90,000 ask for the staff vehicle.
90,000?
Yeah. And I think that's gonna come down. That was put in when, numbers were really up there. And I think, talking with PD and what they're getting stuff for, it probably could come down.
So this would be for the assistant chief,
Correct.
okay? And there's no car we can recycle from somewhere? No.
Haven't gotten that. I
Yeah.
haven't asked at the point yet if anything else is available.
Right.
But we
And,
still have,
and is this gotta be like a SUV? It's gotta be, it's gotta have all computerized stuff. What does it need? I need being the relative word.
I currently have a Tahoe, which for the size of that allows for our command board to be in the back, our gear, some other on-scene needs. There's like basically a bin that's in the back there, so we need stuff for on-scene command things. So looking, if we're gonna replicate having that same equipment, I wouldn't mind. I'm almost thinking pickup truck for them, because again, cancer reduction, keeping their gear out of the living areas, even though we don't go in fires as much, they're still saying the gear has a potential, and having that in the occupant compartment. So looking at a pickup truck with a rollout bed or something like that for that equipment. We also, the radios are the big things. Radios will cost us, for the mobile, for the unit, and tying in a portable with a charger in there, looking at a $20,000 portable radio system that has to go in there just for communications. And then my minimal light package would probably be under 10,000, so the accessories themselves are probably 25,000 to 30,000 for the radio and the light package on there.
How long has it been since we've had an official assistant chief?
I got hired in 21 before Jack announced his retirement, so that's when it got put in.
But was there one before you came in?
Jack was hired in 05 as the assistant chief with a volunteer chief. And then when I was hired in 21, I was hired as the assistant chief for the career side.
We had a volunteer chief.
We had a volunteer.
We still have a volunteer assistant chief.
Do we need some play here?
I mean,
Let's talk about it.
discussion for another.
Good, move on. Search maze here, which is pictured, one of the, things, we've been using acquired structures, those are coming in less and less, that they're actually, knocking them down. So we, had less that we were able to play in this year and train in. So search maze is something that we could set up in a parking lot, in the apparatus floor to perform our search functions, SCBA confidence, and you doing some hose line work in there, everything that we do in an acquired structure. It's actually better than when we go off-site to the training tower, because we can make up different rooms and so on to kind of mirror what we're up against in the residential and commercial structures. I'm reaching out to Wilton and Darien for using a regional approach for a grant on this, which allows us to put in for a grant, and we can also do a regional grant, so we can still put our SCBA grant in and do this. So that's kind of my real focus, is getting this on a regional grant. But it is something that and then only because we won't use it every day,
Right.
and then having this availability to other departments, so they would take some vested interest, but that's my ultimate goal. But looking at, it's definitely something we need to maintain those skills on an annual basis. And right now we're contracting out the state SCBA trailer for SCBA confidence. We're using our firehouse for some of the hose work, which is not the best with bringing gear into certain areas of our living area. So that's the benefit of this. We can set it up in a parking lot and do those same skills and continue to keep our efficiency up.
Where would you store it?
It would get stored in a corner. It actually stacks pretty nice.
I mean, it's 20,000, and like, how often would you use it? I'm not saying it's,
Oh, I mean,
training's
we
not important,
definitely
but
quarterly. I mean, it would be, be setting it up multiple times. I mean, right now, we're just this week, the state maze trailer is coming down. I'm splitting it with Darien, but it's a cost of $4,000 for it to sit here for a week for me to get all 4 shifts through and our volunteers. So
is your split cost 4,000 or you
split costs too.
So it's 2,000.
Right.
So, and that comes in how frequently?
We've been doing it last year and this year, but that would be an annual thing that we're.
So
trying
that's
to-
10% of this cost, just saying.
But this one, the way it's made, this would be our hose work that we're not paying for hose work now unless I bring everybody off to Darien, so that's a minimal cost for Darien. But we're not getting the same training as I would going down a hallway of a residential house with multiple rooms, where this will allow for that and allow for the proper nozzle work, hose movement, and so on. It also, the SCBA and then the search, having swing doors and doors that they can close and actually go into separate rooms. It allows us to set up for that also, which we only get in acquired structures. We can't get that in most of the in the burn buildings, because they're just wide open. They're just open rooms.
Right.
Why does it look so short? I mean.
It is, it's only half wall. We don't need a full wall. Everything we're doing is on crawling.
Oh, so it's
So,
all crawling
yeah.
that you're doing? So
Yeah,
it
so
doesn't need to
anytime,
be
if we're
hung?
doing any one of those
I'm like,
skills,
look, that
we're
doesn't
never
look very
walking.
amazing.
so yeah,
Just look over the top.
yeah, so that's good for the instructor itself. So yeah, that's, anything we're doing, moving hose, search. So once we go on air, we're on all 4s.
Okay,
So
okay.
that's, there's no reason to have a
Learn
full
something new
size.
today.
At the risk of asking a dumb question, so we have a lot of town buildings that are used during the week, but not on the weekends. I mean, do you ever use our buildings to train in? I mean, because they're real
No.
buildings.
Yes, I mean, you don't want to go down that route with now fire gear and bringing in dirty boots into
Okay,
any place where we have occupants not protected. You know, so a constant use of that, and plus this would allow us to flow water, so we
Oh.
can't flow water. in
no,
any-
that wouldn't be good. No.
Yeah, so, but this, the search stuff, things like that we can do,
Mhm.
you know, but this is really designed for an apparatus for a garage. That we can do something, or even better, a parking lot where now I can flow water out of it. You know, and do what we need to do for, to build those skills.
Yeah, it
That-
seems like a great product for a number of towns to
Well,
ship
that's,
in.
that's my ultimate,
You know, I
that
mean,
is
this
the
is
ultimate
goofy.
goal, is I'm gonna put in for a regional grant for this. And hopefully that will significantly reduce that 20,000.
It
In
seemed
that
like
case.
they're like those panels would, like, with a fully charged hose and guys, you know, going through there. How does that attach to the,
But that's.
I mean, it wouldn't seem like, you'd seem like you'd be knocking those things over. Like,
Yeah, they claim not. They
Yeah,
do
yeah.
have some weights that go on them. This is probably not the best picture of how it's set up. They probably don't have all the stabilization in place. We are currently with training funds, we're going to have a company come down with a wall, a different one than this one. And actually provide us a weekend class, so then we can evaluate the wall and the members will get training with hose lines through their training, you know, curriculum. So we're gonna do that to evaluate their wall. And this is a different brand than the one I'm bringing down. So I found a second one. So. But this is all that recycled plastic, so it's forever, you know, that's the good thing, and it's gonna last for a long time versus anything we build with wood or anything like that, or a house that we only have for a week that gets knocked down. You know, this could get set up and plant, you know, we would be setting it up multiple times throughout the year just for our use to do that. Tools and equipment line was 15,000. We're, like I mentioned, with the rescue equipment, that's one of the biggest increases. Is replacing stuff that is required to be replaced at either 10 or 15 years. So the firefighters are going through a lot of that and seeing what we need. We're actually taking stuff out that we don't need in the cache, but there is a lot of stuff that needs to be replaced that's aged out, and we're doing that on a multi-year basis. So it's the rope equipment, it's a lot of the vehicle extrication equipment such as airbags, and some of our batteries, extrication equipment batteries that go, you know, don't last forever. Those are coming up. They're going to be due. So that's where that whole $15,000 request is coming from. It's a lot of small items that last for a long period of time.
So you had 15 in the current budget. Do you know what was in the budget before? Was that your budget or not? I can't remember.
The 15 was mine.
Yeah.
Yeah, so that
So
was.
what's currently in,
last
but
year.
do you know the year before what we had? I mean, is this just kind of like a standard we need to?
No, I mean, Jack, Chief Hennessy would alternate between hose and equipment
Mhm.
off years. So it was 10,000 that he was doing off years.
Mhm.
Between hose purchase and the same tools and equipment account.
So it was 10, now we're at 15, kind of sort of.
Well, we're actually looking at the stuff that we're getting the list, you know, and the reason we're seeing a lot of this is we're putting everything into that records management system. So as stuff's coming up,
Okay.
we're seeing that stuff's outdated. And all right, we haven't bought rope in 15 years, which we're past the standard.
Okay.
Continuing our water rescue, we're still replacing all the ice suits with the new water rescue suits. So that's a small request, 3325, to continue buy 2 suits a year as we finish out that Swift Water project that we started last year. And that's replacing our current ice only suits that we've had that have passed their service life.
How often do you do a water rescue?
Once a year, twice a year, you know,
It happens.
it happens, and there ain't no way to do it without the suits.
Mhm.
Not the right way. You know,
Cold.
it's cold. It's cold and it's unsafe. That's the hard part in the emergency services. I hope we never have to do one.
Right.
Yeah,
Is-
but
Did you say three? Is that for two suits? Is that
two
what?
suits.
They're
That's,
about $1,600 pop.
that was 2 suits, yes.
Okay.
That includes dogs and humans. by
I was
the way.
gonna say, I'm thinking,
Dogs are a big deal. You know, you don't wanna.
Yeah, that could be dog, I mean, that could just be a bicycle on, someone throws a bicycle out on Mill Pond. We would have to drill, make it a drill, but you dress up, you gotta go get the bicycle, cause if we fall through, gotta be protected.
Yeah.
You don't want the child going out and retrieving the bicycle. So if someone called in that there's a bike on Mill Pond, you know, first you would think did somebody fall through. Now somebody just threw it out there. We have to go get it, but you have to be protected to do that.
Okay.
Radios, these radios, we finally fixed, you know, I think we got a plan for our tri-bands that we've been asking for a couple of years. This is replacement of our current single band radios, and for our volunteers, new volunteers coming in, they all get issued a radio for personal safety. So we're at the end of the ones that Jack originally bought, Chief Hennessy bought years ago. So now we're just going to look at doing 2 a year as new volunteers come on. And then we're starting to do some replacements of the first version of them that are going out of service. So
How many radios is that?
this
So
is
for
two,
40
this would be
40,000?
2 single band radios. And I put in 12,000 for that, radios, batteries, and so on.
Yeah.
And we've always had we called it the radio and pager line previous. We've since stopped using pagers because we're using a online system that they can use their cell phones. So now we've taken that cost out of it, that everyone had to have a pager, replacing batteries and so on. So they can use their cell phone for that through our bricks and our First Due apps. So we don't have that cost anymore.
so as I just look at, not for this year, but as I look at the 5-year capital
Mhm.
plan, so I see like next year, you have 2 again. And then it looks like in 26, 27, you have 1. Then you go down to $2,500.
That's just maintenance of batteries.
So you just need to do that.
Assumption of maintenance of batteries, yes.
Okay, sorry.
Yeah, I don't see that our volunteer staff would go over the 30 people that we would have enough radios for.
And I think you said it, but what did you say the useful life of these radios is?
Oh, these radios will go 15 years.
Okay.
As long as the state doesn't change their rules. But yeah, we should be good. Unless, you know, the radios will be good. I mean, frequency wise, if we change.
Is this gonna
it.
have any issue with, like Russ keeps talking about these tri-band?
No, this is our tri-bands we're gonna be limited on how many we purchase. That's really for us going mutual aid and talking on a statewide network. Our radios for our volunteers, they're always in town.
Okay,
99.9% of the time, they're gonna be in town. These radios in our system are fine. They wouldn't be able to use their personal radio if they went mutual aid to Wilton or, you know, Norwalk, Stanford, or something like that, which primary our career guys or career firefighters are going for that. That's what the tri-bands are for. And those are not issued. Those are signed to position. So those aren't going home
okay.
for people. Even our career staff has personal radios because we have, get back to callback. They come in, you know, they become safety officer, they end up going inside the structure, they have to have a portable radio. So, and we don't have, you know, they're not assigned to the apparatus. And we still have a water supply improvement. You know, that's always been a line item as projects come up to have the funding available. Again, Paul, Fire Marshal Payne and I and Director of Public Works are gonna sit down after and start really looking at what do we need for infrastructure. This number really is way less than what if we need if we're gonna put water supply in anywhere. That's what we're finding out. You know, this covers a homeowner that is willing to do a cistern or some type of water supply that we buy all the fittings and buy the piping for them to put that dry hydrant in front of their property. The way we're looking down the road is starting to look at, all right, if we put our own cistern in a cul-de-sac, you know, we're talking a lot more But we're gonna try to work with Tigers paving, plan to see long-term where we can start putting that water supply. So it's available to us and hopefully decreasing our ISO rating in that case also. So we do have 24 funds available, you know, if there's a need, to take funding away, that would be one place, that would be something I can offer is the 10,000.
Because you haven't spent any of it from this
We
year.
haven't spent 24s yet.
Okay.
Yes, we have not done that.
Okay,
So
great.
just,
Yep.
but the problem is if something does come up, it's gonna be, it's more than 10,000. I'll probably have to come for an ask. In that case, if we do have a good good option on the line. And, the 5-year plan is, you know, just looking out, we're gonna have start looking at our 2 biggest apparatus in 28 and 29. Once our current engine gets spec'd and bid on, we're gonna start looking at vendors to see what the best approach is for replacement or refurbishment for our tanker and our ladder truck. So the tankers, unfortunately, has a lot more issues earlier on in its life than expected. So that's why, we want to move that one up to take a look at. So, and I think that would be a replacement based on how it was built in the initial, so, but more to come on that.
Are you telling me it's a lemon?
No, it's not a lemon, it's just that there was a tank leak which was covered by warranty, which damaged some of the underside, which our vendor that does the repair on it doesn't feel that it's going to be a candidate for refurb.
How old is it?
The tanker's 16 years old now.
And not 1 year for the SCBA?
Oh, SCBA, yep,
That's a big
so
one.
that is, our SCBA is, at its 15-year mark. And we're starting, I mean, the cost of repairs is getting pretty high. And which cost of repairs means there's a high failure rate in them when the members are checking them, on a daily basis. And, so we're starting to gear up for that, actually it'd be 20, they bought them in 2007, so we're coming up on 20 years in 2027 of the air pack. They're at their lifespan, probably by 5 years, by the time 27 rolls around. So, starting to put that in our plan. I moved it up to 26 only because I'm going to put in a grant with Greg. That's what we're going to ask for the grant for is SCBA, which is a high priority item. And I was looking at it for 26 for next year. That way we make sure we have the 10% match if we do get the grant. So that could go down, probably about 60% if we do get the grant, because then we have a match that we have to do, and there's other stuff that we have to buy that the grant won't cover.
Okay.
So then that'll get renumbered. So that, my hope is the grant in this year. We'll know going into 26 if we were awarded the grant.
Okay.
But we definitely we got to start looking. I mean, that's replacement of about 40 SCBA units and things that need to go with that when they get replaced.
Well, 2 things we know they definitely need is water and air.
Yeah.
Yeah, water and air,
Kind of-
two thing, and gear. So gear I can fudge a little bit, but that's and our extrication tools are coming up on their recommended end of service life. 27, 29, and there'll be one in 31 also. So that's kind of the looking out for the next 5 to 6 years. That is my presentation, unless there's any further questions.
How do you all want to handle going forward? We're done with Albie. We're behind. We've still got general government and library. You all might need
I need a potty break. so.
I was gonna say, bathroom break. Do you want me to get you something to eat, or do you want to plow through until 1 o'clock?
The library's here. We should be-
Yeah.
Well,
Yeah.
Larry's here too, though. So,
Yeah.
yeah, so we're gonna-
Yeah, yeah,
yeah, so we'll do benefits, then we'll go to library, and then we'll go back to general government.
sounds good.
All right, but you want
Use restroom.
quick
Great.
break?
Yes,
Sure. All right.
Albie, thank you.
thank
You are
you.
welcome.
Thank you.
You're welcome.
Okay. Okay.
All right, thank you. We will try to make this quick, but it's a big part of the budget, so we thought we better talk about it. I have Larry here from Epic, who has been a broker of the towns for many, many years. And he is going to go through a presentation that I put in front of you, and we also have up on the monitor, so. Anyway.
Thanks, Cheryl. Nice to see everybody. Just put a few relevant slides together. Obviously, the main slide is the last one, which is our projection for the budget, upcoming budget for fiscal year 25. But starting off, really, any discussion on healthcare, this is a very depressing slide. You can see we've taken this all the way back now till 2007. But basically, as you can see here, and I'm not telling you anything you don't already know, healthcare costs have been.
We have another one of those? I'm sorry.
What?
I put one in front of each of you. So, sorry.
Wrong. Thank you.
Healthcare costs have been increasing significantly, going all the way down for long adults. And there's really no, like I said at the beginning, it's kind of depressing. There's no end in sight. And as we come out of COVID, there's tremendous pressures on the hospital systems, provider systems, and payers getting very combative. Cigna just had a massive fight with Sloan Kettering down in the city. Med Healthcare is a big one going on with Mount Sinai, but the long and the short of it, we're in an environment where providers, systems are asking for significant cost increases. We have some great new medications, new to market, specialty medications that are millions and millions of dollars. So we were sitting here 20 years ago and we had a hemophiliac on our plan, we'd be looking at $1 million a year, cross our fingers. We'd have reinsurance issues now as we head towards this year. We have a cure for hemophilia, thankfully, but it's about $3.5 million. So there's a lot going on, and a lot of it is tied to the pharmaceutical industry, who unilaterally increases. The only industry in the world basically unilaterally increases costs 10% every year. They announce it in August, and I always use my wife as an example. She takes Synthroid, and now the latest batch was now about $215, and I can remember when it was under $100. So again, a lot of cost pressures around this thing we call inflation or trend, but a lot of good news, as well. As we've come out of COVID, there's been kind of we were worried about this spike, and we're kind of getting through that now. People that delayed care, we're kind of back to normal in the way we kind of see costs trickling through. Page 3 here, just a recap of historical results. As we've talked about many years now, the self-insured plan has been a phenomenal success. You guys, if we had to do a case study this afternoon, would absolutely be top of our list. Not only with the money that we've saved, to me, it's two sides of the story, because when you're, and what this chart shows here is the relationship of our cost in blue versus our estimates, our accruals. And our accruals don't always tie to the budget exactly, but close. So you can see here at the bottom that we've run significant surpluses versus the accruals. And as you know, we've run our plan very tight over the years. We do not look to create scenarios where we're trying to run big surpluses, because our employees share in a portion of costs. So we're trying to manage a lot, as you all know. We're trying to keep costs low from a budgetary perspective, but also at the end user level, since our employees pay a percentage of the cost, they're directly impacted at where we set our accruals. So here, again, draw attention to the last year or so. We ended the last fiscal year a little bit over, about 1.5% over. And we're off, through November, and Ann would have the exact figures, but we're running a little bit of a surplus in this plan here as well. So next page, and again, I won't, for the purposes of time, I'll talk a few minutes about how we develop the budget. And when we talk about the budget, we're mainly talking about the self-insured health plan, which is the lion's portion of our budget. Our dental program, our life and disability insurances are de minimis in the grand scheme of things in terms of total costs, but those are insured programs where a lot of times we have multiple year rate guarantees. So the self-insured plan is really a big part of the cost, is the biggest part of the cost, and obviously the biggest part of our focus. So here, this is our standard rolling 12 projection, where we basically take the last 12 months of claims, and for this iteration, we use claims through November. We back out our claims over the 150,000 because we have stop loss insurance for people on our program that exceed $150,000 in annual spend. So we then develop an adjusted claim number. We divide it by our enrollment to get to a per capita cost, and then we apply. For this instance, we use 5% medical trend, 8% drug trend. Since we're using such a long period here, we are extrapolating that 19 months. And the difference is we've data through November. The fiscal year begins in July. So we got 7 months, and then we have to go all the way to the next fiscal year. So we have to inflate that by 19 months.
Hey, can I ask you a real quick question? The enrollment number, the 2,400,
That's our 200 employees times 12.
okay, thank you.
Yeah, we have about, so if you go down there, we take our trended per capita claims for medical and pharmacy, we multiply it by the 202 people we have under the self-funded plan now. To get our claims, projected claims, then we add back the 7 people we took out up top that would hit the stop loss to bring our claim number to about 3.5 million medical, 1.5 million pharmacy. Made a slight adjustment for contract size adjustment factor. That just means that we're getting a little bit more single. Some of the folks that are retiring that we've listened to a little bit for, families, you're hiring, bringing people on the program that are single. So we make a contract size adjustment factor there. The bottom line is we would expect about 3.4 million in medical claims, 1.462 in pharmacy claims. We then have administrative costs where we conservatively put in a 2% adjustment there. I'll talk more about that in a second. And the stop loss insurance also, I would say relatively conservative, about a 10% increase. Network access fees and total projected cost, bringing it down to the bottom of about $6.49 million.
And the stop loss we share with the Board of Ed. That was a share.
Yes.
So did you ever do an analysis of what increasing our stop loss to the Board of Ed level of 300 would be and how that would impact the plan?
We have. It's basically a dollar trade-off, meaning we would be buying less insurance if we raise the deductible, but we would be introducing potentially more volatility in the program. So we would get a premium reduction, and this will be part of the conversation.
Yeah, because there's significantly fewer employees at the town level than there are at the Board of Ed level.
And age difference too.
Yeah, it'd be interesting. I think we need to have that conversation.
Yeah. We've talked about this a lot.
Yeah, I know.
And
I absolutely know that.
Yeah. It depends on how you absolutely, we look forward to that, because the problem is that, and if we go to the next page, kind of encapsulated that. And again, we don't have a person, the person that can predict healthcare costs, right? Let's go ahead and have them buy us a lottery ticket, because here you can see our reinsurance costs and claims. So as Cheryl mentioned, we've done shared purchasing with the Board of Ed, and it's benefited both of us. So invariably, when we have bad years, they have good years. And so we're looking at, we have all the premium from their group and our group going together. And for the purposes of renewal negotiation. But here you can see, we've actually we've had some bad years. So
So
down.
we use the same stop loss provider.
We do.
We just don't use the same insurance carrier. So it's, we just have a stop loss.
They have Cigna, we have it.
That's
Okay.
right. We have uniform reinsurance over both programs with Voya. So here you can see we really clean their clocks really good. Over the last few years, we just ended our first good year in a long time. With the loss ratio of about 26%. Now,
Is this an annual? I'm not sure what I'm looking at. What's at the bottom?
That's,
What's along the bottom? So stop loss.
Yeah, I think it's, the years,
these are
19,
years of
20,
what we got
they
back
just don't have the.
Okay.
in refunds
you.
versus what we
Access.
paid in.
Thank you. No, I had the same issue.
So if we were running a stop loss insurance company, we would want the loss ratio to be about 70 to 75%. So you can see here, and one of the reasons why our plan has run so well is because we've had a lot of very high claimants that have been the responsibility of the reinsurer. We still have the issue of our 200 people that we have covered are, we're not bringing in a lot of new people to the program. So our people are getting older. As people get older, they need more services. But we have hit a little bit of a, this is good news. We hit a period where the reinsurance, the amount of our really high claims is abated. Now,
And you're saying that's because of the aging of the workforce, and your claims can sometimes be associated with childbirth or something like that. I mean, so, the flip side is you've got an older group. So would the older group then have have potentially more expensive medical things? And we're just talking town, right? We're talking
yeah.
the 210.
Yeah, but this also impacts the Board of Ed too.
Yeah.
We've had a lot of significant
Yes.
claimants hit the stop loss there. The problem with, and not to get too granular on this, but the problem with the reinsurance industry, and this is affecting all of your insurances, not just stop loss insurance on the health plan, is that going back to the hemophilia example, it's the law of large numbers. These claims are graduating to, when I started, if you hit $1 million, you were dead. Now you routinely see cancer and oncology treatments, and we have them, $700,000, $800,000, $900,000 a year. So there's a tremendous pressure on the reinsurance industry because these claims are graduating mainly around oncology and some of these new to market specialty medications for hemophilia and other conditions, spinal atrophy. The amount of claims coming through are just staggering. So that's a big area of focus. So going to our projection, the last page, incorporating what I just mentioned with regards to the self-funded health projection. Our budget as it compares to this year would be about a 4.4% adjustment. I made note here, and this is yours, we're all black and white here, but if you look on the screen, I did make note in orange that our budget going back to 23's fiscal year was 7.6 million. So we're in 2 years, 1% off of where we were.
It says 2005.
Even 25 was 25.
Yeah, 25, where we're projecting
Oh, okay.
7.67 million versus 7.57 a couple of years ago. Now, I don't anticipate that. I think our claim projection is very tight. If we look at the last 12 months run rate on we look at many different things. We look at how the plan is performing from a plan year basis, a rolling 12 months standpoint. I would expect us to have close to $5 million in claims next year. We will be doing That's obviously the lion's share of the cost, but there are some other things with regards to administrative costs that are going on that we're getting very aggressive around, and that's mainly in the area of pharmacy rebates, which in our plan, Anthem keeps, but gives us a credit for in our administrative costs.
Have we ever
versus-
been able to, I mean, do you know exactly how much we've gotten in rebates versus the credit? Or is that like, they keep it?
Very
We don't
tough on 200 people to get the actuals, but we can model that based on our book of business. It really goes to you could take 200 people and the run rate rebates could be $50 a month. And they could be $350 a month, depending on the drug mix. I would say knowing our population, and the rebates are really being driven by specialty medications, Humira, Enbrel.
Yep.
I would say with our population, our run rate rebates are probably 150 to 180 per employee.
And we're seeing that in the, which are we seeing on the other side, but in the rebate that we get, or the reduced cost?
They give us a credit, I believe it's almost $90, $80 to $90 per employee per month on our admin. So when you see the administrative fee component here, that also includes our cost as well.
So in this plan, we do also have retirees that are 65 and younger. So we currently have 16 of those in the plan. We do have library employees in this. We have 21 library employees in the plan. And then families, we run about 483 with everyone.
People, additional people, yeah.
Yeah.
How many, 65 and,
We
Yeah.
currently have 16. And then once they're 65, they go on to a Medicare supplement.
and
That's
so
one of the things
this
that-
is in addition to the 200, I mean, so if we had all these people in these plans. So,
No, this is all in that 200 covers library and people below 65.
okay,
I think what Amy's saying is of the 200, you've got the branch of these other 400 plus coming off of that too.
Exactly, yes.
It's very important, and we've talked about this in the past, is we have a lot of families. If you look at the average contract size, that means the total number of people covered under the plan, including dependents versus the employees. The average in the country is about 1.8. Ours is like 2.5, 2.6, because we have a lot of families. So, and that would differ from the school board a little bit because they have a lot more say teachers that go. So when we look at costs, we just can't, when we look at per capitas and things like that, we have to keep in mind, we're covering a lot of people here. It's not just the 200 employees, it's all the family members.
So how many lives are covered in the policy?
Right now, 483.
483?
Yep. And then I was gonna divert a little bit to Ann just to talk quickly about the 300,000, where we are thinking about pulling that from.
So what, based on the budget number of 7.6, we're looking to, because the retirees are in here, we're looking, and we're doing it in 24, so we'll look to do it again in 25, to pull 300,000, 350 around that, out of that budget number of 7.6, so that we say those expenses are gonna go directly to the trust, the OPEB trust. And the reason we can do that is because, as you know, we pay everything, we don't normally use the trust.
Yeah.
But in our actuarial studies that have been done by Hooker and Holcomb, the amount of claims that the town is paying, our ADAC is 0, so we don't pay anything into OPEB right now. But the claims that we pay is actually more than what the ADAC would be if we always pulled the money
Tell me
out.
what ADAC is.
Actuarially,
Determined.
employer contribution.
Yep.
It used to be just ARC.
Right.
They changed it. So there's that window that says we're already paying, say we're paying $1 million, but the ADAC would be 700,000. So we have 300,000 that we actually could take of those claims and put it against the trust. So.
Meaning we're using the trust for what it was funded for.
Exactly.
So we set up money to pay these.
We weren't at a point where.
Yeah, we had
it was
not.
fun- Exactly.
Yeah,
now.
you're basically in a nicely funded position with your trust. So now the trust can offset some of your current costs versus using for the retirees, right?
Right, right.
Which
Right, because that's what it was set for.
So we
Agreed
use
last year.
as little money as possible so that more money stays invested.
Yes, you
in
get
the
to
trust, so we
100%,
get
yeah.
higher,
Mhm.
So we have that ability to take that down about 350. And.
And that keeps us funded at what level for the,
What did we say,
the OPEB?
84% funded?
Right, yeah, I was gonna say
84.5% funded.
And this is just the employee healthcare, which by
This
the
is
way,
just the
most of the rest of the world doesn't fund at all.
And most are below 50%.
Mhm.
Or if funded at all.
Right, and it's because of the way, the mechanism we do it, because we're not drawing out those funds down.
Right,
We're not putting
we're,
them in either per se.
yeah, but it's earning on itself.
It's earning, yeah, so we're able to keep it in that level, so. The budget, what you're seeing here is the 7.6, we would bring it down to 7.3 because we're gonna take 300 out of the trust.
Right.
And then in total estimates, the contribution between library, retirees and employees are about $1 million for the year.
Mhm.
So that brings it to about 6.3, which would be town
Right,
expense. So we're at about 6.4, so as the year goes on and we tighten things up, we can see if that number can change, whether it's 100,000 or something, to the good reduction.
And the retirees run us about 400,000 from the 65 and below. So it works taking it out of the.
What is that OPEB invested in? Like, where do they put the money?
Vanguard,
And
That's
is it, but I mean, what kind of
Oh,
instruments?
I don't know offhand. I don't have, actually, no, I don't have the report with me.
Okay,
We can get
I
that.
should remember. I should
Okay.
remember, but I don't.
We'll
But
get
it-
that, we'll get to
it is-
the last
okay.
statement.
It is conservatively,
It is, yeah.
very conservatively invested.
that's
And
good.
that
Because most
three
people
is
think
in
they
there,
have it.
right? That's in
Yeah,
there.
So the three expenses in there, all in is that 7.6.
Mhm.
From a budget perspective, we pull the three mil.
Out.
100,000 out to bring it to the 7.6, then we know there's contributions of $1 million. So our contribution by the town expense would be the 6.6.
In our, at 6.6, our year over year increase for the town is an expense line, right? Because that's what we're really coming down to, like, how much out of taxpayer money is
6.3.
6.4 is 5%.
Yeah,
okay.
Employee contributions?
so, yeah, it's just a little bit below.
Okay, so we're in the 4.5% increase for healthcare out of town expense for the town. With the benefit of being able to tap our trust fund
Right, right.
appropriately.
And then we can have Larry run the 300,000 stop loss, Tiana, just to see, so we can present it to.
Yeah, that'd be
you
great.
guys.
Yeah.
Look at that.
Yeah, kind of last word on that, going back to saying the reinsurance costs, almost. Don't think you're penalized to keeping your stop loss low, but
Yes.
there's a point where
Move it up.
it makes sense to move it up. And just
We
roll the
went-
dice for lack of.
And we went last year from.
A couple years ago, we went to 100 to 150.
Yeah.
Yeah. So interestingly, so our, in this whole analysis is, we had those really bad health years, which we had huge benefit from having the stop loss. And then it seems like, last year we had the come to Jesus meeting with the premium jumped appropriately. So, do we have the stop loss premium assumed in for 24-20? I mean, do we have any sense of where our, I mean, if we're
Yeah.
paying 1.1,
We built in a 10% increase.
so about 1.2-ish, 1.
It's about, 1.3.
Okay, all
It
right.
works
so-
out to about a 6% increase.
Right. Okay, sorry. And so when do we end up knowing what that number is? I know there's a whole timing issue with this stuff.
Yeah, it's much past usually the board of finance. By
Right.
the time we really get those numbers nailed in.
Right.
We have some uniqueness in our stop loss contract with our current carrier that is tied to some things with the Board of Ed. So I don't want to say we're kind of pigeonholed with one carrier because there's 25 reinsurers out there.
Mhm.
But the one that we're using, and they've been good in terms of claim payment and on renewal. But they've also been good on provisions. For example, we have an unlimited aggregate maximum on the Board of Ed. We've got a 20% corridor.
Right.
As well, so that's all taken into consideration. So what we do is, and again, the school board is on a September,
Right.
and we're on a July.
Yeah, it's
So
confusing.
we kind of bring this all together in May.
Right.
Yeah.
And then early June, we sit down because we have enough, we've got a really good picture where, what we could do in July. And then ultimately what the pricing will look like for September for the school board.
So in terms of what's happening with the stop loss part of the market, you're assuming, 10% is our potential exposure in terms of increased premium. Is that what's kind of going on in the greater industry, or is it just all over the place?
It's a little of both, meaning, the stop loss is like your property insurance. It's about evaluating, if you have a burning building and you're going out to try and get insurance. So again, if we were starting, the other issue you have with the stop loss industry, again, if we were running a stop loss insurance company, most employers want to keep their deductible the same. So when you have something called leverage trend going on. So we have a $300,000 claim right now. You take 150, they take 150. That $300,000 claim next year comes 330,000. They take 180 and you take 150. The delta between the 180 and the 150 is not like 5 or 6% healthcare trend. That's more like 12 to 15%. So to answer your question, most insurers will go out with I would say between 12 and 18 to 20% increase regardless, because they're trying to get leverage trend across their book. Then we peel it back and look at, okay, how's our experience running? Oh, that person that was really sick is no longer on the plan, and we try to adjust it back. The big picture conversation will be, this budget will probably not change. But the question is, do we move the premium, the 1.3 million down to like 700,000? And we put $600,000 back in place. That's really gonna be the major question. And then if we had $300,000 of claims, then we pocket the 300, we've saved 300,000.
There's no pocketing here. It's just when we pay it.
It's 5-year trend, right? That's what I always heard you say. 5 years, 4 years is good, one really bad year.
No,
4
it's
years
true.
good, one really bad year.
It's true. It's
Kind of how it works.
Yep, every group has 1 to 2 years of 5 with horrific. But like I said, that's part of the challenge for, I don't care who the employer is. We are seeing some of these people, we got some really sick people out there, some very expensive treatments.
Mhm.
And,
But we're at an aggregate stop loss at 120.
yes,
So, I mean, you can plan for it. You know what it is.
Right.
yeah, we've
It's
never,
How many?
we've run this plan
Yeah.
like, within, like I said.
Yeah.
Like 95 to 103, we've run it very close to the projected cost. Not gotten anywhere near our aggregate, but we do have things.
Larry, do most towns keep Board of Ed and town separate, completely separate? There's no combining? Before you mentioned 2 different companies. I mean, is it, I know we've talked about this over the years, but it's, and I don't want to go down that road, but are you seeing still a separation?
Yeah, I
across the
think it
board?
depends on the town.
Yeah.
That, the juice is not worth the squeeze.
Okay.
The Board of Ed, like Cigna, they do a great job. We've got a great relationship with Cigna, Blue Cross,
That's a great analysis. There really is, in terms of functioning
Well,
as
just
an
getting all
entity.
the contracts
Right.
on the Board of Ed side and the town side to agree to one carrier would take.
But I think it's
Bigger-
perfect.
Bigger is better.
where these guys, and this is, we talked about this with Yana a few weeks ago. And I've talked to Joe initially on the Board of Ed side with Virgin. These carriers are making so much money on the pharmacy piece. That's where the money is. It's not in the admin. For us to save $2 by sweeping our people to Cigna for an admin and then going grievances because.
Well, I'm just like thinking, we just heard from the fire department and the cancer risk, and
Hey,
you're gonna have to go into teacher negotiations saying, I want to put in,
So with
it's just
Yeah,
not. worth it.
we,
just when we changed to Anthem, it took
Yeah.
us a year.
Yeah, yeah.
And we came from Cigna.
yeah, it's well set up. We like Anthem. We've got, they're great. Blue Cross is great. Cigna's, we've got the combined reinsurance. I think the next frontier is collective pharmacy purchasing.
Yes,
That's where the money is.
it's gotta be.
Deanna raised, that's like, there's,
Formularies and
For-
all that, you gotta, like, that's not
that's a
I've been in those union negotiations, it's not like,
healthy.
it's,
It's
it's
Humira, CVS announced a few weeks ago
Yeah.
that they were taking Humira off their formula. Right? So we have all these CVS customers that are like, well, what if the person can't take the biosimilar? So it's good news. The cost of Humira is $15,000 a shot.
Mhm.
And it's gonna go significantly down. Oh, by the way, CVS kind of embedded in their announcement that they are going to manufacture
oh,
the biosimilar. They partner with someone to that. So they obviously have a selfish interest in all this. So there's all this
Yep.
stuff,
Yeah, and by the way,
pharmacy-
you can go to kind of generic now, but the prices are coming down on this. So the pharmacies, that's it, there's gotta be some push on that, but we've been fighting that for a long time.
Yeah, that's where the money is.
Yeah.
And it's a very delicate analysis because we don't want to disrupt.
Well, thank you.
Thank you.
Thank
you.
Always good and always bad hearing.
Yeah.
All right.
You're next.
I'm sorry, I couldn't hear you. So catch me. Okay, yeah, catch me.
I have a hard time finding this in the book. Where is this?
I can't find anything.
What page are we? Just, oh wait, maybe it's on your.
It's on your picture.
37,
There
37.
we go. Yeah. Nothing.
Oh, all right. By comparison, this is gonna be easy. We still got no biosimilars, we got no formularies.
So, hi, everybody. I am,
One second. I don't have it on my tablet.
Page 37.
No, this. He's got it on his tablet.
I put it on last night.
I don't see it either.
Where did you go on?
But I
Oh,
emailed
right
it to
here,
you as well.
I got,
It's called library.
Right there.
I got budget presentation.
Oh, there we
It's
go.
up higher, it's up
So
higher.
I emailed it to you and I put it on your tablet. I tried to put them in order, but I was doing it. on
Okay,
my
wait.
phone. Came in late. Sorry.
So this I don't have email on though, Tucker, and I don't see it.
No, it's up higher than you think.
I'm all the way at the top.
Go in and go it.
Okay.
And I'm not trying to be difficult, I just might be able to go in and go.
Yeah.
It. I have it right here, if that helps you.
But you should have your.
Okay. Sorry, guys.
No, it's
It
okay.
just-
It's all right.
So 25 budget, yeah.
Yeah, it's-
All right,
okay.
there we go. All right, thank you. Good call. Go in and out. There we go.
That's what IT always does. Goes down.
Shut it down.
Okay, should you say Josh 37?
37.
hi, everybody.
Hello.
So I'm Cheryl Capitani, for anyone who doesn't know, I'm not the director, president, CEO of the library. As you know, Lisa retired at the beginning of this month, and new president CEO Tim McNally will be starting next month, so you guys will be working forward. But in the meantime, you have me, I'm the assistant director. My colleague Roberto, the vice president, external affairs, and our treasurer. I'm gonna try, I've got a lot to talk about, but you know, it's been a long day, so I'm gonna try and talk fast.
And we're sorry it was delayed.
I know, it's all good. Just have about a dozen slides on what it is what we're doing, and a few about just putting our budget in context with some of our neighboring libraries, and within a special focus on what is the largest budgeted increases that we've got here, which are in the salaries, programs, facilities, and collections lines, which we'll get to at the end. So, as you all know, thanks to the generosity of the town of New Canaan and individual contributors, we were able to build and open this incredible new library facility in February of this year. So wanted to kind of just give an update on how we're doing. We're doing really, really well. Library usage is incredible. Door traffic we've seen since February, over 340,000 people through our doors. That's more than a 60% increase just on that 10.5 month number over the entire fiscal year 2018-19. Obviously, we're not comparing to 2020. So then, the number of people through our doors is staggering. It's about 30,000 visitors a month. On an average weekday, 1,400 through a door is regular. It's
Is
pretty.
that visits, not visitors?
That's people through our door counters.
So,
And many times the door opens.
Yeah.
Not discrete people.
so
certainly.
visits.
No, lots of repeat users.
Okay.
So what is it that people come to the library do? They attend programs, they borrow books, they come to study, they come for meetings, they come to read the newspaper, they use our public computers, business center, visit our cafe. Lots of people who work from home from the library come to meet their play groups and just be in our shared community space. Lots of diverse usage by the whole gamut of the community. Just a track of, what this visitation has looked like. Again, this is 60% on not quite 11 months of data. So we're on track for what looks more like a 70% increase from that full 2018-19 year, in which we were feeling like we were busy and slammed in 2018-19. So we expected a large usage increase, and we promised that. But 70% is maybe, we're there. And I think,
Do you remember what percentage increase you projected it at when?
I was trying to remember.
Do you remember that?
Yeah.
40?
So I would say that we were looking at an average number of about 800 to 900 maybe on good days in the old building.
Uh-huh.
And we thought that we'd be at least at a 12 to 1,300 kind of a number.
Okay.
We can go back and check that. because
I'm just
that
curious.
That was also the number we used for our economic impact survey,
Mhm.
Amy, which,
Yep.
is important for us to be able to look at, but it's certainly lower than what we're seeing.
Yeah, and we're 1,800 is not unusual. That just means we're doing a bunch of programs that day. So,
Or it's midterms.
yeah. So this seems to be kind of like, it's where we're at. There was a kind of a looky-loo when we first started. So we had, 3,000 people on the first day, but that's 1,400 to 1,700 on a weekday. We've seen that throughout now 11 months. So it seems like where we are. So it's wonderful, but obviously that also adds to, the wear on the building and its upkeep, and, our team who staff our 7-day-a-week, 64-hour week service. So what do? We do programs for adults. Since we've opened, we've had over 425 programs for adults, over 14,000 people in attendance. That's 40 to 50 per month. We love working with our community partners, listed a bunch of them there. So we have large scale lectures like this one with Misty Copeland, author talks, music concerts, wellness, and then also smaller workshop type things, technology workshops, one-on-one tech help and research assistance, cooking and food science programs, book groups, writing groups, art appreciation and hands-on workshops, Maker Lab, we do CPR training, mental health preparedness, blood drive, outreach, and more. We have a knitting circle there. It's really, really runs the whole range of enrichment activities for our adult community. And we're just constantly working really, really hard to meet the demands and high demand and high expectations. And this promise that we've said that we're going to deliver to the community. So
I think one of the things that we've always said in the course of the capital campaign as well was it was the library's goal, very important part of its mission, to always be a lever for other nonprofits in the community. And I think what all of these slides really show is that we're fulfilling that commitment, and we are really allocating our resources as well to be partners, both as a space partner, but also as a programming partner.
And our staff who is responsible for all of those, 40, 50 programs a month. We have 1.5 staff who will do the kind of larger, big lecture things. And then our reference team of 4 who do the more workshop technology, instruction, education. So we're a pretty lean operation in terms of the kind of output that we've got. We do lots of programs for our families. So about 30-40% of everyone who comes in the doors goes right into that children's room. So since we've opened over 850 programs for children, teens, and families, 27,000 attended, so that's about 80 programs a month, sometimes more. Again, we love our partners. So what do we do with our families? We do 9 to 10 story times a week, music and dance and after school enrichment programs, STEM, writing, book groups, art, coding, Maker Lab, cooking programs. We have an incredible summer reading program. If y'all don't know about that, come visit us in the summer. It is so much fun. We had about 1,100 little readers participating and loving to learn with incredible outcomes. Author visits, teen programs. We have an incredible really engaged teen volunteer program. So we have 15 to 20 teens a week who help out in our children's room. They help with, getting books back on the shelves and also prepping for craft programs and things like that. But also this photo on the right is a high schooler who devised a financial literacy workshop for middle schoolers, and she approached our librarian Rebecca, who helped her work through and create what is now like a really successful financial literacy series. So kind of merging all of the learning from all of the elements from that is the kind of things that we absolutely look for.
I think it's fair to say that some of the biggest pressures we face in terms of programming demand is certainly within families and children's. If we look even at the programs that, Deanna, maybe you and I can reach back in memory to figure out what was going on when our kids were 2. But there is a big gap in this community for 2s programming. We do provide that time for 2s. It is a smaller group class than, say, Book Babies, where you might have Miss Marie doing something with 50 children, believe it or not, on her own with a series of parents. It's remarkable to see. But when you're talking about time for 2s, you need a smaller group, et cetera. There's a lot of pressure for us to provide that kind of programming. We have an extensive wait list for that. I'm almost afraid to tell you what the number is. Shall we tell them?
For 2s, but, so we've made some inroads on those 2s programs.
But the wait lists are triple digit sometimes. So
On the 2s?
yeah, is that right? Is that not right?
No.
Okay. I must be thinking about the French.
I have a better picture of the strollers than you.
I know, I was looking for the stroller picture, but I was gonna say.
I got
if
one
you've
too.
been on
You and
any-
I were together. I mean, they were
They
all
lined
lined up in the
up, I know,
hallway.
I was
The
looking-
New Canaan traffic jam.
Yeah,
Yeah, it really.
all the
really
same
is.
brand, I mean,
So-
all the same cup holders.
We are crushed with kids, but,
Well, let's say we could handle a tripling of the number of people at least. And for us, that's the gateway to the New Canaan Library. That's the point of initial engagement for a lot of new families. So it's really important that you serve that community.
so we still do books. So since February, we've circulated over 200,000 print books, over 60,000 digital books. The print book circulation is a really good news story. It's up 20% from 21-22, and we're almost back to where we were pre-COVID, which is the entire national library trend. COVID really did a number on people's borrowing habits, right? People just get out of the habit of doing the regular thing. And so they stopped coming. And clearly they've come back, but they've also come back and come and borrow books. So we're really excited about that. The digital circulation is, so it's up 6% from 21-22, up 25% from 2018-19. Those numbers could be way higher. The rates that are charged to libraries for.
As I say, I can never find what I'm looking for in the
It's-
digital library.
It would take us probably
Sorry.
quadrupling the digital book budget in order for us to meet the demand there, because an individual license costs 6 times the cost of a print book. So
So this is a unit increase to 6%.
And they don't even carry it.
Well,
So it's a
but
unit
it's-
increase to
it's- they don't
6%.
carry
It's not a cost increase or?
it's a-
I have a different view. I'm shocked at how many books.
No, they have a lot. It's just, obviously what I'm looking for, they don't have.
Classic.
we take requests, so we pretty much will
It's-
fulfill
it's-
almost any
yeah.
request.
Hoopla
that
drives-
anyone,
I can't believe it.
that
I'm amazed by
anyone
it.
asks
Yeah.
of us.
How
But
is the physical book drop going? Because initially there was a little bit of learning curve there.
yeah, so the book drop we have is going well. There's definitely been feedback that people are looking for something that's more convenient to a car. And we hear it, we know it. We are gonna have to wait for Kim to really weigh in on that, because it's not as simple. It seems like, oh, just add a book drop, but operationally, logistically, that's not where you're gonna drive through. We don't have it.
Yeah, well, the
Through
initial,
anymore.
the initial like little pickup spot there works where it's, something
Right, so
jump out.
the pull off is there, and that does work, it is maybe a little bit too far. It's farther than I think we expected it to be. So that was just one of these things that didn't quite make it from design to actuality in exactly the way that we had hoped. So we know that we do have to do something. In the meantime, we've told everyone, we will come out to your car. Give us a call. We'll come out to your car. We'll take your books. We will not charge you late fines. Let us know. We'll renew everything. We're extraordinarily understanding, but we know that this is a very real issue for the community. We hear it.
Is the mechanical check-in system working well too?
Oh, it's great. It is.
I mean, I know kids love seeing that.
They do, but our team loves it too. I mean, instead of, checking in 200,000 items, doing this 200,000 times, our staff doesn't have to do that. It frees them up to do much more interesting and fulfilling things. So it's been a tremendous time saver and an efficiency for our team for sure. But yeah, ebooks are expensive. And then we have our meeting spaces. So we have 7 study rooms, 2 larger conference rooms, and then our big auditorium and community room space. So since February, we've had over 5,500 meetings that had nothing to do with the library at all, just happening in our space. So 60 meetings a day just going on, turning over those rooms over and over. That's as opposed to like 50 per year in other building. I mean, there's really no comparison. We did not have what we built, and this was what the community told us they wanted, and they really do. So that is a true story.
Also significant staff impact and learning
Yeah,
to
so.
manage that, it's something new to manage.
For sure. So New Canaan nonprofits, students, people having meetings. We've had the public schools do grading sessions. The teachers do grading sessions in our meeting rooms. Emergency management had a regional training. You guys went to New Canaanite monthly coffee, social clubs, private business meetings, town meetings. We have a Board of Finance meeting. Everybody loves to meet in our space, so it's great. Our study rooms turn over 7 to 8 times a day. That's managed by our reference staff. Our conference and big meeting rooms turn over 2 to 3 times a day. That's managed by our facilities team of pretty much 1. So that can look like, a room is set up for the auditorium, which we share these spaces for our own programs as well, right? Obviously. So room is set up for a program the night before 300, got to clear it out for that empty book babies of 100 people. And then, does that at 7 in the morning. And then at 11 o'clock, he's got to tear that down, put the partition back up, and got to put up a luncheon and set up for 100 with the garden club, clean that up, and then set up for the program that night. It is,
Moving 300 chairs can take an hour and a half.
it is.
And you have one person doing that?
And that's, we currently have that.
We currently have that. It is,
We're hoping to go to 1.5.
it is a
Heroic.
heroic effort that he puts in. Victor's incredible. But yeah, that's true. We just opened the library green, so we're really, really excited about this. If you haven't been able to make that walk up from the corner of Main and Cherry up to the building from that side, it's like moving. It's more impactful than I even really expected it to be. It's a really wonderful, beautiful thing. That will speak to some of the additional facilities costs in the budget. We haven't had landscaping costs for a couple of years because we were a construction site, so those costs are returned. We do have the plantings and things that are there, are designed to keep the upkeep and maintenance as low as possible, but there will be usage, and there will be costs that are associated with it. Some of that is as yet really unknown in reality, so we'll really know everything a lot better next year. We intend to do some programming out there, but we also expect a lot of just ad hoc usage. I was had the SACS debate club meets weekly in our library, and last week they came with a soccer ball, and after their debate club.
Oh, that's who it was, because I saw the soccer ball.
the
I did see the soccer ball.
out in the snow, and there was, yeah.
I was like, wow, it's a little chilly for soccer.
That's great. I can't think of anything more exciting. I love it. So that is the green. Just wanted to give another shout out to our incredible team. So we have still 27 and change FTE. Our team works incredibly hard. Really can't do any more than they currently do.
What was the FT? I'm sorry, how many?
It's 27.79, I think, something like that.
We have a lot of part-time help.
Okay, like the 0.9s always are interesting.
Do you remember when it was old library?
It's constant.
It's constant. Thank you.
Yeah, so
Okay.
that was
Fine.
the,
Right, thank you.
that was what we proposed was, flat staffing levels, with all of this. We've been able to be creative within our salaries line. So, if somebody, we've had a couple people retire who've been around for a while. So sometimes you're able to find some savings in there and apply that and give some more hours to, help out facilities back. So where we're able to do that, we work within the line. So
We've taken a couple of full-time positions and made them part-time. We've brought in some outside contractors just to try to be creative and to try to fill some gaps.
so you want to take this slide?
Yeah, sure, absolutely. So Emily, as you know, the library
takes very seriously its responsibility to raise philanthropic dollars to support our share of the operating budget each year. We've had good success. We've met or exceeded our targets, at least as long as I've been there for the last 10 years. And we expect to continue to do so. We're operating currently this year to be on target, and our increases for next year are significant, but we think doable. We're looking at about raising the amount that we expect to achieve by, I think, about 30,000 or so. Any questions? Happy to answer, but as you well know, our largest fundraiser of the year is our literary luncheon, which we did this year with Geraldine Brooks. It was quite a success. We did it at the Country Club of New Canaan, and I have to say it was really spectacular and fun. And we're going to be bringing back something we haven't done in a while. It was a spring fundraising event. Think of it as a Lit Lunch Light at Spring Edition, where we've had Tyree Jones and Min Jin Lee and Douglas Stewart before. This year. We're featuring Vanessa Chan, who is a Mary Sue Lucci author, and she's been all over GMA, and we're going to be doing something at the library for the first time. So we're going to be setting up a tent on the Anderson Terrace. We expect about 300 guests, and then so we'll have a luncheon, and then we'll have the author speak inside. So everyone knows you can't adventure your way out of a budget hole, but we are going to be doing more events selectively over time because we understand the need to continue to work not only hard on our annual campaign, but as well as the event side.
So here's just some brief comparators to where we fall in line with our neighboring libraries who are the most like us. These are all nonprofit association libraries as well, with that similar 75% ish town grant of the operating budget. So yeah, see how that falls in there. There's some questions on that. I don't want to belabor these too much because I know you'll have more other questions. So that's where we fall with general income and income sources. These are all fiscal year 23. These are the audited numbers. And all of these numbers do include the number from insurance costs. So that's added on. So if you'll see, it's 3.79 is our operating budget. It was it's like 3.4 in our line there, plus the additional amount from insurance. So these are all apples to apples, all of the numbers.
So I noticed in the Darien budget, they have an income from their endowment that they take in. And I know that you have an endowment as well.
We do.
And we've been in a really great interest rate environment. And so, so what is the thinking around not using part of the endowment income to offset operating expenses?
Should I go first and then you can give the
Sure.
comparison? First, our endowment, just aggregate numbers, I want to say theirs is 8, is that right?
There's
So
8.
ours was 1.6, but we've used, or by the time it's done, we're gonna use over 50% of our endowment to pay for the legacy. We plan to build that up, but just, we're 1/10 of theirs. So just
Okay.
even if we did it, there's also just in our charter, which you could change, but we're not allowed to touch our endowment income or principal
not.
until it hits 3 million.
Okay,
So even at our max at
Okay.
1.6, we had 1.4 to go before it was really
okay,
seen. And so there are a few other aspects of funds that aren't in that straight endowment, but they were given with specific purpose. And so those are used in that way, but we can't touch them. And so long-term treasurer hat on, our hope is to get the endowment back where it was, get it north of 3, and then do just that.
Okay.
But as you know, we'll get to, not really here, capital campaign, fantastic in terms of paying for the facility. Still some work to be done with the legacy and kind of figuring that out. And kind of endowment, unfortunately, is really third on our list.
Okay.
Hopefully not a long timeline, but third.
The only thing I will add to that is, so because of what Darien is able to throw off on their endowment fund, their fundraising dollars are not as much as that is.
Right, we're one of the per capita fundraisers in the state, if not the highest. I think Mark Twain might be the only library higher than us for maybe some obvious reasons, but
Chart, we show that in one chart.
Yeah, and I would just like to reiterate what Rob said, for me, getting the building funding raised was 50% of my job.
Mhm.
And I think the other 50% of the job is setting us up for the kind of financial stability that comes with a strong income. And so from my standpoint, that's a really important strategic goal, which I know that the new CEO will share as well. I think you can speak with the boards, it's about that as well.
So just quickly here, this is the comparison, the town grant dollars per capita comparisons with these same neighbors. Town grant as a percent of municipal revenue. And salaries, for those of you who've been through Lisa's presentations for the past few years, you'll know that she worked really, really hard and dedicated herself to getting our salaries closer to be more competitive with our neighbors, and we've made pretty significant strides. So that's a good news story. We're not obviously quite there to Darien, Westport, and neither to our municipal neighbors, Norwalk, Greenwich, Stamford, all the union libraries, more.
I just want to make sure, the number, annual wage per FTE, I know you got a lot of part-time.
Yes, that's the salaries line divided by the.
Right, so that
Oh,
doesn't
right.
include, that
Yeah.
doesn't include any benefits associated with full-time employees in
Right.
terms of,
Yeah.
Right.
that's right.
Yeah.
That clears.
Right.
They
So if
will-
they have,
they
and
will
if
say-
they have more full-time instead of part-time, they're gonna.
Yeah, so this is
Yeah,
a
that's
little
not
bit of a
hard.
better
Right.
apples to apples, this
Yeah.
one here. So this
Yeah.
is entry-level full-time librarian, credentialed master's degree librarian, starting out hiring salary on an hourly basis. So this is where we fall with our neighbors in those. Darien is actually on the salary side, actually a little higher, but they work at 37.5 hour a week. Everybody else is 35, although none of us works only 35 hours. So that I'd love to flip those guys on the chart there, but that's where we are. So we're trying as best we can to stay competitive and to retain our incredible staff.
And again, the assumption with all these folks is if you're full-time, you do have benefits on top.
Yes,
right.
for every.
Just want to make sure. Okay.
This is just what everybody spends on programming. So this is what everybody fiscal year 23 spent on children's programming. And I'm drawing a line there for, this is where we're putting our request in the budget line. And in actuality, this year with those outputs, we're actually closer to that number because we've spent a lot on from designated gifts. So I think we've actually spent over $20,000 on children's programs this year because
We did some targeted fundraising, very specifically to help manage some of the need in children's programming, particularly because it was identified by the librarians that especially weekend programming for working
Yes.
parents was something that was a big gap. And so
Yeah, I
we
heard a
went-
lot about that. That's
Yeah,
great that you
so
can do
we
that.
went out and Found a way to facilitate that with a donor and also through some grant money. And we've also done some fun, smart mini fundraisers for them, just to try to backfill. Obviously, that is an incredibly low number for programming for a community of our size.
So because Darien's such an outlier in
Yes.
this, what is it that they're doing that we're not doing?
So they hire people to do a lot of their programs. So the majority of our programming for children's is done by our children's.
So that's
team.
salary for full-time staff, basically.
So it's salary for performers.
Oh,
So
Okay.
they hire people to.
kind of like what the schools do.
Entertainment.
They have a
Maybe,
fund
yeah,
to do
yeah,
that. Okay.
Which has its pluses and minuses. Knows every family, has a relationship with every kid, really, throughout the year. So we definitely want to maintain that connection. But in order to meet the demand, and interest from all the people on all the time and 7 days a week and all the
Yeah.
days, our staff can't do it all themselves. Similar staff, similar thing, but for the adult program expenditures, so.
Do you know what their staffing level is at Darien versus ours?
Yeah, they are. So Darien has, so we're 27.78 FTE, Darien is 36.19. Westport is 42.8.
That's,
Can you give me those numbers again? I'm sorry, 20.
well, yeah, I don't really care about Westport. It's so much
Yeah.
bigger than we are, but Darien is similarly sized. I mean, this community isn't very similarly sized.
36.19 FTE.
There you go.
And I assume it's obvious, but just to say it out loud, that line, that's a 2-year gap, right? So that's what
Yeah.
we're proposing, but the assumption, Darien, West, they're all growing too.
Yeah.
So those
Mhm.
columns, if we were to come back for 2025, we hope to be at that line, but for visual context, I expect everyone's bars to be higher.
It's 2 years ago.
Now, does Darien charge for more of its children's programming? No, it's all complimentary for 3
Other than
classes.
any special fundraising events would be, but, for
Yeah, I mean, the only person who has a big other is Westport in terms of their revenues,
yes,
fees and charges.
yeah,
Yeah.
and, yeah. Their other, I think is a lot from, federal, they have a federal, grant that they got an IMLS grant, a few years back, and so that is in the 6 figures.
I don't know what that acronym means.
Oh,
but that's
sorry.
okay.
Institute of Museum Library,
Library studies.
yeah,
Okay.
it's a, it's a big federal. So that's the long of it. And then we've got the actual, so,
You're racing through those.
you
need to do that.
No, I'm just illustrating what we've got going on. So, put that for you so I can see people. All right. So income, we talked about fundraising. The only other kind of substantive piece of that is, we're hoping to increase our rental lease income. So we've got a cafe now, so that's a fixed income, and then what we hope to achieve from renting out our leases.
So the state has said that they're not gonna fund you at the same level?
So that's twofold. So thing one is, the pie is smaller, the amount that they're.
Reduced at state level.
Yeah, the percentage of distribution. The other part of the state is, it's based on, how many people from other towns borrow our items. So last couple of years, we've been behind a construction fence, so we haven't been that great to go to. So we actually hope that those numbers will go up, but we couldn't necessarily bank on it. So, because we don't know exactly what the state's gonna throw off for us. We had a.
So, but you couldn't go back. I mean, I'm just, 2019, whatever. I mean, I'm guessing you were probably around the $8,000
I
level.
think that was probably pretty.
I mean, to me, it feels like maybe you're being a little bit overly conservative on your state. If since you were close, you couldn't actually.
It's a declining pool, Deanna.
It is.
It's more a question of it being a declining pool, I think, at Hartford than the functionality and what interlibrary
Okay.
ed look like for us, so.
Okay.
So Hartford is cutting back on libraries and state.
We think that,
Giving back
these
to
numbers could go to
libraries,
zero.
Really?
I mean, it's not a ton of money to begin
it's
with,
not.
but it's okay.
It's a message.
Yeah, I mean,
In your fines, is that, you're cutting that, am I in the right line here? Cutting that in half assumption for next year
So.
from 35,000 to 18?
So the audited number was 7,000 for fiscal year 23. We really don't. see
But you weren't really
much-
open, right?
We
I mean, you
We
were,
were
but
open.
but you know what I
we
mean?
were closed for 6 weeks.
Right, but it was under construction and,
But
even,
one thing, if I said in the fines, because we've talked about this
Mhm.
before, we could jack this number up. What they do operations, they alert them a week in advance.
Right.
And as you control it, the fines go to zero, and we've guided them, let's not be punitive here. Let's get people, and
Yeah.
so that's almost been an operational decision versus a financial trend.
Yeah.
let's tell people getting back, let's get them renewed, we make it easy, you can call in to renew. So that fine was more of an operational
Yeah.
decision, let's make it as easy as possible, not penalize versus a financial trend line.
I get it. I'm familiar with the library. It doesn't even charge fines.
Yeah.
'Cause
and
They just want
actually
people
the
to use.
vast Majority of
Exactly.
They want
libraries.
them to use it.
A little bit of a make them come back if you're not using it, otherwise it just sits in your
Yeah.
shelf,
Mhm.
there's no fine, but if we alert you and you still
Okay.
ignore it, then you should pay.
The vast majority of libraries in the state do not charge fines anymore. I think it's about like 150 out of 170 libraries in the state are.
The other thing to consider is that as your digital lending goes up, that's an automatic return.
Yeah, I love it.
There's no fines on the digital
Yep.
return.
Don't have to get it out of your car and put it back in.
There you go.
Can we talk about the rentals and leases? So,
Yeah.
you know, that's an area of revenue generation that we had talked about going through this whole process that we thought, wow, this is gonna be, you know, this could potentially give us some more revenue coming in. So in looking at that number, where do you think, in terms of, are you looking at, obviously you've got the cafe, but there are other opportunities in terms of renting rooms and renting space? I know, could there be events there that are,
Yeah. Yeah, that's what, yeah, yes. So that's something that I've been working on quite a bit and trying to establish, first of all, what is equilibrium with respect to room rentals, with respect to how does that match up against what our staffing requirements are to manage some of those room rentals? And what do we need in terms of our own programming versus what's possible for us to rent? And so identifying what that equilibrium has been part of the task from the beginning. Right now, since we've opened, we've gained about just under $10,000 in rental income. The budget line for this year is for us to get to 30, so we're slightly behind that rate, but I'm
Okay.
hopeful that in the next 6 months, we're gonna make that up because we've done a very good job of updating our meeting room policy, and we've just worked with our attorneys and our insurance brokers to make sure we have a solid contract, such that if we did want to have, let's say, a wedding, which we've been proposed, or a bar mitzvah, which we've been proposed, or other things, that we are well protected, and we just really haven't been in that position to really feel confident that we could go forward with bigger events. We will have some $6,000 kinds of rentals coming up, so I think we're gonna get there. Whether we get to the biggest numbers remains to be seen, because like everything else, there's a cost to us from a manpower standpoint. This gentleman who's setting up the chairs is still one person. He will hopefully be 1.5 people. We are figuring out how to factor that into
Right, I
our.
was gonna say, that should just be in
You
your
are
rental
right,
rate.
100%.
Agreed.
And we've also been reworking our staff so that we have an events coordinator who's really familiar with not only all of the room bookings, which she handles, but also how to handle what we think of as maybe a more special event piece, so.
Yeah, I mean, I think, you know, first year through, obviously, this is gonna be a learning curve for everybody.
That's right.
And I totally agree, but I believe that component, that area could be a pretty decent sized growth potential for revenue.
We agree.
Between the rooftop areas, the green and the deck, I mean, all of the different spaces you've got over there
We agree.
are amazing, so.
Yeah.
Hopefully we'll see
Chief
that.
Revenue Officer.
And the business center, I mean,
That's printing, copying,
Okay.
faxing.
so you had to amend your budget down, and are you, like, where, you know? Because you're still not where you proposed last year's business center revenue.
22 to 15.
22 to 15. I think that was based on the actuals that we were seeing, which we weren't. This
Part of
was-
what you know, fact sets based in Norwalk, and
Yep.
we were trying to get
Mhm.
some donations, if you will, and having some Bloomberg machines. And I think if
Yep.
you go back to 21 and 20, the hope was there'd be more of a true business meetings there.
Okay,
And whether we had, there were conversations, and I'm still hopeful we'll get those fax set machines, because
okay.
they were gonna give them to us.
Oh, nice.
And then we could have some sort of rent, but we don't have them yet. And so we're trying to be consistent, and I'd say
Okay.
it's not even the immediate priorities for that business center, because those rooms are booked. So if we started bringing for-profit businesses in, and if you were to go look in those rooms
Yeah.
today, you have to go a week in advance. So there's not the capacity. We could bring that line up, but we'd be taking it from somewhere else.
Well, they're
So-
booked for free, right?
What's that?
They're booked for
Yeah.
free.
They are. Some of the big rooms,
Yeah.
to the event side, they
Yeah.
won't be, but we're kind of proud
Right,
of
but
that.
the business center is really, that's really printing, it's really printing and
It's
copying
Right.
and fax costs.
It's
so
lower than it might have
We're talking about
been.
15 cents a page. you know.
Yeah.
It's not the meeting room income. It's not the rental of a space.
Yeah.
As
Right.
much as it is, as
But it would have been different if for-profit businesses were using that. I know their renderings, we were thinking that we may come there, but it's,
Yeah.
there's no room for it, so it isn't.
Although it is, and Amy makes a good point. It's a conversation you should have about, you know, maybe there are a couple rooms you designate that are fee generating rooms, and then you reduce the number of, I mean, I know that it's but you know, you have tables and people can, you know, a lot of people like to use a private room, but they could probably work at a table.
In fact, if
So-
the room is open, people.
Yeah, they
they're leaving
prefer, they
table,
like the
going to the room.
quiet. Yeah,
Yeah, we're 11 months in it, and I
yeah.
think.
No, I know. It's just something to
I
kind of,
agree.
you know,
It's a luxury to have always a room,
yes.
and that's how we should deem it.
Yes.
So
I
people
think that's
definitely
right.
don't have always a room. I mean, that's, there's a maximum of 90 minutes per day. And if
Mhm.
you come during the after school hours, what we have is, you know, high school students doing chemistry equations on the board, you know.
Yeah.
I would say there's also something, it's great because you're providing access to a lot of nonprofits, but there's nothing wrong with asking them to contribute toward this. I mean, anybody,
Custodial fees were appropriate. So
Mhm.
our meeting room spaces are free up to 2 hours for New Canaan nonprofits. That's again, part of our commitment to being a lever and a good partner, but we do expect people to pitch in for some of our custodial benefits.
So.
And again, if anybody chooses to have an event that's after hours, they're charged
sure.
for that at a reduced rate, but they are charged for it.
So do you know from the business center income, which you've reduced to more accurately reflect where you are, how you doing year to date? Do you know? If you have a 15,000, where, you know what? Are you guys on a calendar year or fiscal year? Let me see.
Fiscal,
We're fiscal.
it's through June.
Through June. So do you know how you're doing in terms of that?
I can look that up.
I just mean, because if you're gonna project going forward, that's all I'm asking. Yeah.
Yeah, for next year, it'd be good because like on the town side, we have where we are year to date.
Okay.
Just so that it's, you know, we can kind of see,
Yeah, what's the
Yeah,
run
yeah.
rate?
right,
Yep.
Yeah.
And the reasonability of the assumptions, yeah.
right.
And have we completely done away with book sales at this point?
Mhm.
It's a-
Business center income, now this is only through November, because we're
Okay.
30 days, but so anyway, we're probably 75%, so that at that point, the budget would have been 6,250. That's where we should have been to be on, and we're at 4,300.
Okay.
So a little behind, but for us, those are real numbers relative to where they were before.
Okay.
I'm blaming on us not getting that laminating machine.
I
Hard
know.
for the lacrosse team would have been done there, and I'm telling you, we had to laminate. it.
That's right.
That's funny.
It would have
Staff eliminated.
been.
And just as we're looking at revenues, just to make sure I'm understanding this correctly. So that's what you're asking for is a contribution from New Canaan, from the town towards the library. But we, this, sure, our healthcare costs on top of this, I mean, like we pick up
There's, yes, the healthcare costs are
are not
not.
embedded. So we do, there's another support
Yes,
that we
yes,
provide,
correct.
just so people are aware of that. Yeah. As good partners. Yes.
But you're no longer having our insurance, our liability insurance.
Correct, yes. We're not on Karma. We were, I looked into
That's a
that.
good comment though, because I know that we use Kerma because it's much more financially advantageous for us to do it. What was
We
sort
were
of the
asked to
rationale?
come off it because we're not municipal employees.
Oh, that's it?
So, yeah, so I asked Lisa about that. She said,
There we
Tom said, we reached out.
Okay.
He's not here. I don't see Tom. Yeah, so.
No,
so
no,
we're
you
not
asked,
eligible.
no, you asked to come on.
That is not what Lisa told me.
Oh, I promise you, that's absolutely, you guys asked to come off and we questioned it a number of times. Because we couldn't understand why you would have economically made that decision. And then we asked for a letter in writing from you saying that you wanted to come off, which we.
So
got.
we probably.
So here's what I have in my notes, because I asked Lisa.
Yeah.
So Tom Sadler asked us to come off. We aren't supposed to be on, because we're not municipal employees. And then we contacted them, and with the new building, they didn't want to cover us.
Well, let's figure that out.
Yeah,
Yeah.
we'll go back to it.
Because, yeah,
By definition, we're not municipal employees, so we're
Okay.
not.
because that would be
That's all right.
something, if there's some confusion in the transition, we may want to revisit that.
Okay.
Yep.
Oh, here comes
Yeah.
Tom.
Ah, there we go, Tom. Ah, yeah.
Question about when the library came off of Kerma. Lisa seems to recall that you asked her to come off, but my recollection is.
No, it was her.
Yeah,
I know, I have it written. I
yeah.
swear.
I'm sure it's written.
I have
There
it
just might be
written.
some confusion.
Yep.
Any way to.
And we really did question that. We couldn't understand why that.
Insurance especially, because that doesn't
All right,
impact
let's
programming.
go back and look at that then.
Yeah.
She contacted me and said, no, we're going off.
Yeah,
We're
yeah,
going off.
Lisa told them that we asked them to come off, and I said,
Oh,
absolutely not the
no.
case.
She's insane. I can't.
I mean, we'll figure that out.
That's
Exactly. Hold on.
That's why.
We did a number of times. We thought it was a bad
All right,
move.
let's get to Bob and Ag, come back, okay?
Okay, sorry.
There you go.
I'm gonna sign
Sorry
out.
now.
That's good.
So expenditures, so this is our admin stuff, the only, real, the largest, increase here is in our accounting services, that's our contract, accountant, our contract controller Caroline, who this is actually just representing the work she actually does for us, so she was not charging us for some of what we are, so there's an actual number that we owe her for all the work she does. You guys have any questions on under administration?
15%. This is outside service contractor
Yes.
that you
Yes.
use. 15%, that's a hefty,
For
that's a pretty hefty increase in accounting services.
She was not charging us what she was actually doing. There was a.
Yeah, and if you look
She
at.
did a great review, because I work pretty closely with her. She's kind of our contact, and she kept her rate constant, and we still are not paying her for 100% of the hours she does. She's kind of project oriented, so
Is it?
as a percentage, it looks big. It just means we were gouging her before a little.
Yeah, and the auditors is, we have, we always have just all the commendations on how
The cleanest audits.
our audits are. Yeah, the auditory. So that's administration. So the next is really where things have started out. So operation, salaries, collections, programs.
Okay, so what are you proposing? You're proposing a $91,000 increase in salaries, which would do what? Bring how many people in, increase rates? What is that? You have more people? What are we talking about?
So some of it is, again, that kind of ability to be potentially creative within the salaries line of adding some hours to our part-time workforce, and then there's also cost of living.
But so you referred earlier to that you're hoping to get a 1.5 elusive half person custodial. Is that in here or is that below? In terms of salaries, I'm just trying to understand, you're looking for a sizable increase and I'm just trying to understand exactly what you're funding with that. So if I'm looking at compensation salaries, is that salaries for everybody who works at the New Canaan Library? And then if I went down to custodial and stuff like that, that's separate,
Yeah,
that's not as, so,
Yes.
okay,
These are
so
all-
I'm just trying to understand. You're trying to staff differently? I'm assuming you're trying to increase staffing? It's not just increasing, I'm just
So-
trying to understand.
So we, I believe, and I declare,
Lucky you.
Sorry. So I can speak to, some of the thought process that was probably behind it, which I think was trying to be responsive to the initial promise of not overextending the FTE from before.
There's no new staff, full-time person in that line.
Okay, so we're not gonna increase our health No
No,
expense
we are not
associated with it.
increasing the health expenses in this line. We are providing a salary increase for existing employees.
Okay,
And we're providing for the flexibility to enable us to have that additional, 10-hour-a-week shelver in children's or a halftime person to work, say, for example, in our facilities. And some of that is a little bit offset because if we are smart in getting the contracts right for the rentals, we're going to be trying to cover some of the cost of that halftime person through the rentals embedded in the contract. So.
Yeah, I mean, another way to look at it is here, we said you had 27 employees total. You back out one for janitorial, that's 26. Maybe.
So not 27 employees, 27
27
FTE.
Oh,
So
so 27.
Full-time.
So
So you're gonna be more like 28.
So we have 23 full-time employees and about another 20 part-time, but some of those part-time employees are, 5 hours a week,
Yeah.
teenage shelter. So,
But it's still, I mean, you're looking at, if you divide it by 27, 91,000, it's $3,300. Across the road. So it's not, to me, that's not a egregiously big number.
no, I'm just trying to understand what's funding, that's
Yeah,
all,
yeah.
I'm just trying to understand.
and some of that
Well, it's gonna
will be
happen.
up, will be up,
I'm sorry,
that will be up to Kim, as to how. some of
Right.
that
I mean,
gets allocated.
I'm just like, I just, as a comparison, at the town level, we're at 2.5. So, so we just have to like, keep in mind sort of where we are comparatively as a town funded entity. I know you're not a town agency, but that's what we're funding at the town level. So it's,
Right, so we, and then we
yeah.
also. of
So
course,
then you have fundraising to
Yeah.
offset that or whatever, but I mean, it's like, what is the town gonna contribute to that versus?
Yeah, we've been at that 2% increase a lot, which is obviously not keeping track with inflation, as you know, for
Right,
several years. And I think one of the things Lisa did speak to is first, looking back to the budget of 23 was, a 5-year plan to get people up to at least a level where we were at a comp that made sense for our peer group. And this is just part of that effort to try to get people up to salary levels that are appropriate.
it's just where does that come from?
Where does the,
The town funding side or fundraising and,
yes,
raising revenue other ways. I guess that's, you have to kind of stand back and ask who's funding that, what you're doing.
I think in this case for this year, Deanna, one way to consider it is just to think about, there is some need for growth given what we're seeing as the demand and service.
Right,
And so it's perhaps different from other years. That might be the only way to really look at this. We've definitely had an impact on staff. I think the demand for service has been overwhelmed.
no,
And,
I don't.
Maintaining and making sure we don't have attrition is really important.
Right.
And it's perhaps.
Yeah, it's just all how you
here to
pay for it.
Consider it.
It's, no, I totally understand. It's just, and outside of this is the healthcare and,
Understood.
so we just have to kind of, we have lots of asks and this is a significant year in asks. So it's a lot.
the 403B match,
Mhm.
is down, why is,
Everybody doesn't opt in.
okay, there you go. Okay, so all in the salaries, you're asking for 3.5%.
3.8.
It's okay, so that's, the bigger asks are more in terms of reflecting the programming and maintenance of the building down below, right?
Actually,
that fair?
3.9, not 3.5.
Pardon?
3.9, not 3.87, not 3.5.
And she's deducting out the
Yes, to that.
the
I
match.
did.
Oh, the
I-
match.
The total is.
Oh, 3.5 down there. Sorry. Okay.
Yep.
Yeah,
Yep, I got it.
sorry.
All right, so next line, collection.
Question.
Mhm.
We talked through a bit of this before, so print books, back up to where we initially had asked and wanted them to be before we reduced them this year. So
We want a vibrant collection. We don't want Deanna to have to wait 16 weeks for a book.
I just go down the street to Elm Street Books.
Which is important, we support Elm Street too, but again, if we've got barriers to engagement to our community, that flows through.
Yeah.
Into how people feel about us as a philanthropic entity worthy of making a commitment to, so.
Maybe had a big commitment here with adult digital, so you're all set.
Just send an email.
Yeah, so the digital books content is again, it is steep. It's a little hard to swallow because it's just.
Our licensing it's just that expensive.
So an individual ebook costs the library about $60.
Yeah,
The
so
individual
put
audio, the
that,
audiobooks costs about 95, and then we only get to keep it for 2 years or like 24
Hours or
circulations,
something, right,
whichever
yeah.
comes
so from a
first.
taxpayer perspective, $90,000 worth of ebooks, like well, how many books does that on subscription?
That's really difficult to.
Depends on the mix.
Yeah,
Yeah.
because we also have, we have a model where we can do a cost per circulation. So that's a single license model. So just like you buy one copy of a book, you buy one digital license, one person can have it, and then there's a million.
But you like on a popular book, you're stacking up like.
They're a year long.
Yeah.
Right? So we also have they've gifted us an opportunity to do multiple copies of simultaneous use, kind of like a Netflix type model. So we pay per borrow.
Mhm.
So at a lower rate. So it's like $5 or $6 for a popular book per borrow.
That's a variable cost that we can't predict.
I was gonna say, I'm
And
like, how do
so-
you budget for
So
that?
you can't. So for Lit Lunch this year, it was forced. So we did, since we had additional funding and it was important that we were able to reach everybody who wanted to read that book, we used it as an experiment. Okay, what happens if we open this license or everybody can borrow it?
16-week waiting list beforehand. We opened the opportunity and we reduced it to basically a zero wait list on digital, and it cost us $1,000.
$1,000, one book, for what was it, like, for 6 weeks? I mean, that's not sustainable.
Yeah.
So,
Right.
so.
But it was a good test case for us.
Yeah.
But at that burn rate, it's 89 books. I mean, that's.
Yeah.
That's.
Yeah.
Yeah, so there is legislation now for the third year being brought to the state. The state library is continuing its advocacy for this. It'll be the first state to bring, Connecticut doesn't tend to like to be first, but to try to lobby the state to help to do something to make this more equitable for libraries and library users and citizens of the state. But the publishers, have to.
Are older
Not
books
making a
that
lot of
are
money either.
beyond copyright,
Not making a lot of money.
are older books beyond copyright, cost you nothing? I mean, if it's a classic 100 years ago.
Books are much less expensive, yes, but that's not what has the big one.
Yeah.
Yeah.
I burn.
You could probably get it.
Easily. Your
That's why you get your.
your classics depth is amazing. Yes. Okay,
Yeah,
so-
that's the digital book
Mhm.
story, the frustrating story for everybody.
Yep.
So, other questions?
Museum passes, are those used a lot? I mean,
They are,
Okay.
yeah. So I pulled those numbers. So we've got, we have 13 institutions. It's about 75 per month, 75 borrows per month. And that's, multiple people. Some passes let in four people. They all let in at least two.
I hope those borrowers contribute to the library. I'm just saying.
We had a generous donor underwrite that for 3 years for us
Mhm.
as part of the proof of concept, because you never want to build something into a budget that's not something that the community wants. And I think it's been well proven that it has been incredibly popular.
Particularly over the breaks, right?
Mhm.
December, it was just constant. So they're every 3 days, they turn over.
Family of 4 wants to go to the Met, it's $100.
Yeah, I was gonna say, maybe I'm wrong, maybe I'm making not just, but when you're saying, are they judges, I'm guessing the people that, I never asked for a museum pass in my life, so I just paid when I got there. So I'm guessing the people that are using the passes are not necessarily people that are gonna be their donors, but I don't know, maybe I'm not right.
It's actually,
know.
it's not the case because I'm.
We're just
checking it
frugal
out.
in New Canaan and everybody
They
gets them
just plan
used.
better than the rest of us.
I know, I'm like spontaneous, let's go.
Yeah, no,
Which
people.
maybe
people
gets to
plan
marketing if
ahead.
you want to talk about that.
But people do plan ahead there, because
Yeah.
we don't hold them.
Yeah.
So you have to be in front of me for me to hand one to you, and so. Are they there? I'm calling ahead, I'm coming right now, I'm outside the door, like, there's a rush to the desk. I know, I'm so long, I'm
Yeah,
sorry.
that's all right.
Yeah. Oh, she's.
I gotta leave in 10.
Two?
In 10,
Oh, in
in
10
10 minutes.
10 minutes,
But you
okay.
guys can continue. You guys can fill me in. So,
No, we might have
okay,
to,
I'm sorry.
Okay.
yeah.
Make your space.
Talk about programs, costs.
Obviously, a big number here is the projection for facilities, buildings and grounds, the 57,000 increase in everything there. And I know some of that is obviously a reflection of higher use.
Yeah.
But I do know when we put when it was, we're talking about doing the library, big supporter, no judgment here,
Yeah.
no judgment zone. But the assumptions was we didn't think that the cost of operating would not be appreciably different, but in fact, they are, right?
I think to this tune, they may be.
Part of maybe to give some color to that,
Mhm.
one, I think, and Cheryl, you'll give better color, but the cleaning has been a lot more, right? Just use, but also throw inflation out. The individuals that were doing that cleaning,
Sure.
retiring to replace them has turned out to be incredibly hard, to the point we
Okay.
almost can't get them.
Mhm.
Forget the money. And so
Yep.
that increase has been more utilization, but also supply demand has been off and we didn't project that.
Okay,
The other on the, and so that's almost been surprising to me. In the buildings and grounds, we touched on like there's different elements here, but we've had the benefit the last 2 or 3 years where there's been so much less. And so that is.
right, but when you're putting the projections together, we knew what the grounds were kind of sort of being, excluding the building. But, is it again, just a staffing thing? Is it just, shortage of folks to do the,
So some of the buildings and grounds, in these numbers here, the landscaping wasn't. We didn't have landscaping fees in fiscal year 20.
No, yeah, that's what I'm talking about. I'm talking about when we talked about building the library.
Yeah.
And projecting going forward, we had a line item projection for landscaping. We knew we weren't gonna have some during construction, but so we're just off. Well, I mean, I don't know, I'd have to go back and look, but it was, again, I just know people had, were like, of course it's gonna cost more money to operate, and I think it was projected, no, it shouldn't, because it's a much more efficient building and stuff like that, but I think reality is proving a bit different.
Did we pick, I guess, because I had heard this through people in town, the plantings that were chosen for outside, there is some concern that they are not low maintenance plantings, that they are more high maintenance plantings. I don't know. I haven't seen them. I'm asking.
Almost go the
I'm
opposite.
asking the
Yeah.
question. I'm asking the question.
I know the intent, then maybe I'm speaking intent more, but almost the opposite. So they were very much organic to this area that and the maintenance would be less. Now, the law, it doesn't mean there's none, and these numbers are real, but from a design perspective,
Okay.
the approach, and I've heard the landscape and the architects all talk about this.
Okay.
There was a mind.
Not a
to
lot
it.
of
It's not
hedge
gonna-
trimming
It's
and.
gonna cost us
you know.
less.
There are no
Yeah,
hedges.
yeah.
There's no hedges.
Pollinators, by the way, all that
Okay.
stuff.
No, there's no hedges. I mean, Stimson, as you probably can recall from our conversations, highly sustainable approach to the landscape, with all
Right.
native plantings. In fact, the things that you can't see include all of that drainage
Mhm.
system,
Right.
which is underneath our lawn,
Right.
which enables us to actually hold more water on site, which enables us to have less things like irrigation, et cetera, less runoff into the town drains, et cetera, because remember all the flooding in the Lamb, nobody
Yeah.
wanted to repeat that.
Right.
Right. So it was a very high intent.
Okay.
Again, it remains to be seen in the execution,
Mhm.
but they've done a remarkable job, I think, in choosing things, there's not gonna be people out there with watering cans. In fact, we have a sluice, if you may have noticed on the right-hand
Or
side.
hedge trimmers.
No, exactly.
But
Not-
there's
it's gonna look
collection
natural.
points, right? So we have natural
Yeah.
collection points for water with drainage systems that direct the water in ways that are meant to be sustainable. So with my incredibly black thumb, I say to you that I think that we've done a terrific job of making sure we have the right plantings there. There's no rose gardens, there's nothing of that nature here. It's really, it was done very thoughtfully
Mhm.
for us because we don't have that kind of stuff.
Good.
Now, whether we need to find a way to make sure we're supporting
its maintenance and upkeep in creative ways on the fundraising side, we're very prepared to do.
Okay.
One of the things we've done is have a campaign for the green. We've
Mhm.
been very successful. We named all of the areas out on the green. We've created a green society, which is something you're gonna see happen and we talked about in perpetuity, so we're conscious of that.
What about that energy line from 23 audited 96,572 versus 75,000 projected? Is that or proposed, is that just because we were under construction during that time, we use all that power?
So, yes, that we had both buildings going, right? And we had all of those, that construction equipment. I think this line is really we're really gonna see. I mean, there were projections,
Mhm.
but we don't know. So.
Yeah, because again, that was the hope that this building would be more efficient
Yeah.
and,
Right.
And we have the TVs on the roof, et cetera, but
Yeah.
we're literally going through a commissioning process now to make sure that our HVAC is actually working, the way it should be. So it's just gonna take.
Yeah, because I remember there was a talk about how the credits for stuff wasn't coming back through on the bills, and there was some talk about that, so hopefully that's all straightened out.
Yeah.
The other big, software, that's just, is that new software or is that, just licensing fees going up, the software?
The development software.
Yeah.
Specifically, so that's just, we took the things from the various software lines and actually assigned them within the departments. So the software used to live in the IT line. So this is Razor's Edge.
Yeah, Razor's Edge, which is our expensive donor database software, that's a necessary evil for us, but also I think we are holding now Greater Giving or Constant Contact and
Yeah.
various other things that fit
Something
more
that
into
used
those
to
sort
live
of
in
marketing
there.
buckets that now are all.
Constant
Yeah.
Contact lives in here now.
I mean, we're up, your, general, it's up from 102 to 145, $43,000.
Yeah, but
a
that
big
number in IT is probably down for software.
Oh,
The
That's-
big two
that's a
there are the
reassignment,
development
Amy?
and, yeah.
got it, thank you.
What we were able to do was reduce the number of donors, if you will, in our database. We went through a very extensive audit and cleansing process because keeping our donor numbers at a certain level keeps us below the threshold for rate increases going forward. So we actually avoided about an additional $4,000 or $5,000 increase this year by doing that exercise
Okay.
in Razor's Edge. So it's important.
Okay, now Ellen, this is for you.
Okay,
So I look at the fundraising event expenses going up by 20
right.
and your revenue only going up by 5.
Yeah. So it's more a reflection of what the reality is of fundraising expenses and the fact that we're going to be doing more. And
Sorry, it's up by 20. So you basically just like have a wash almost.
well,
And I don't think of you as a wash. kind
you're
of
right.
person.
You're right. I like to underpromise and overperform, and so this gives me that opportunity. Yeah, so in truth, we've been doing just lit lunch each year.
Yeah.
Right, and then everything else has been pulled into annual fund. Also, I've only come back to being in this role. I was CEO of Capital Campaign for the last 2 years to be concentrating on that, and so there's been a lot that has to be brought back up to speed, if you will, from the development standpoint. I don't, we have a saying like, what is it that Ellen's willing to get out of bed for? And so we're never doing a one-to-one on fundraising. And I think that, we've done a very good job of exceeding our goals. I think we anticipate, carrying that forward. But it's a fair point. That's a good point.
I apologize, I've
Yep.
got to go
Yep.
do something.
That's fine.
I love library. I think it's great. I would love if you guys could sharpen your pencils for us. It's a tough year for us. If you can look through and go, ideally, we'd love to do all this, right? But this is just my own opinion, and I'm a big fan. I think it's incredible. I think what you're doing is incredible. It's such a service to the town. But I think we're gonna have to ask everybody to see how can we tighten our belts a little bit? So, I'd rather not say, oh, just arbitrarily this much, but if you guys can come back and say, if we had to push this, we would, or something like that. Just, and it's not from a lack of support or anything, just from fiscal stewardship. So I have to go.
Okay.
See you.
No, please.
While we're on this line, legacy building, going forward, We don't have a lot of money, that's for sure, but I guess we're not, we don't really know what we're doing there, so. But you've have, there's $1,250 basically for insurance. And then we have to, are we gonna be able to power, is this projecting that we're gonna power it up or for $2,700 or that, there's no power to that bill? That was.
Oh, prior year, not for this contract.
So basically $1,250 just insure it for now. That's the answer.
I think we've been in a posture of really looking forward to having our new CEO join and help to set direction. And I think until we're really in a position where she can come and speak to you about what her assessments are and what she feels that the best use is, it would be hard for us to incorporate something into this budget that made any kind of sense.
Okay.
We just hope that like in the hiring process, that was part of the discussion.
I think
Well, I
Mark
mean,
can speak to that.
I'll say, I mean, yes, that'd be part of that. The answer is yes, and that'd be important. But I mean, we have perfect alignment now in that we want that to look and be as functional as possible, more so than you do. But it's kind of, as I was saying before, it's steps. We gotta finish the facility and we want to have a very thoughtful plan and not just turn it, because that would be a shame. And I just would want you to have patience that means it might take 12 months. We could rush and have lights on in 3 months, but the functionality of that building, I think, would be, we want it to be celebrated, and we're not in a spot to do that yet.
I just want to make sure that we weren't going to be spending any money that we didn't budget for.
Sadly, again, with the patients, we're gonna make sure it's protected. It isn't an eyesore, but it's not gonna be celebrated until we all collectively have a plan and then execute upon that plan.
Okay,
Thank you very much.
thank you very much.
Those pictures of full rooms of the library.
Yeah.
Are really. It's great.
Every day.
Oh my goodness.
The feedback has been phenomenal, so keep it up.
We're really proud of it. We're proud of our team.
Everybody, thank you.
Yeah, thank you very much, you guys.
Do you want to plow ahead with general government or do you want to just move that until?
Yeah, I think it's 1:45.
Yeah,
Yeah, let's move it.
move it. Okay.
And you should-
Put that on.
Sorry, guys.
All right, so we just need a motion to adjourn.
Oh, yes. Do I have a motion to adjourn?
Moved.
And I'm seconding it. So
Yes.
are we on?
You're still on?